everyone. Welcome back to day 2. Can you please come in and take your seats? We have another program of great fun and research to get started on. All right, give everyone a moment. All right, well, hello everyone. We are kicking off the day strong, day 2. I hope you're all rested and ready. We're going to kick off our first session of the day, another research panel, and today's theme, or this panel's theme, is on paint and batteries. So these are some of the more established sources we've known about for a long time, but they're still problems, and we still need more knowledge and solutions about what to do with them. So to moderate this panel, I'm pleased to introduce Claire Donaldson, who is very apt for a panel on paint and batteries. She is the co-executive director of the international NGO LEAP, the Lead Exposure Elimination Project, which works with governments and industry to remove lead from consumer products. They're currently working in 31 countries across Africa, Asia, and Latin America. And after 2 years of work in Malawi on lead paint, a follow-up study found that the market share of brands selling lead paint had reduced by over half. So in 2 years, getting half of the lead paint off the market in Malawi, really an incredible achievement. She's also a board member of Savita, a GiveWell-funded nonprofit working on immunization uptake in India. She has a PhD in earth sciences from the University of Cambridge. Claire, please join us on stage. Thank you.
Morning, everyone. Well done for making it first thing, particularly to those of you who are sort of jet-lagged coming from the West. It's great to see you all this morning. So I'm delighted to introduce our first speaker of the panel, Jenna Forsyth. Jenna is a research scientist with the School of Medicine and affiliated with the King Center for Global Development, the Woods Institute for the Environment, and the Dorr School of Sustainability. She completed her PhD with the Emmett Interdisciplinary Program in Environment and Resources and obtained her master's in civil and environmental engineering from the University of Washington. Her research brings together principles of environmental science, epidemiology, and behavior change. She develops and evaluates interventions to minimize exposures to contaminants and disease vectors in low-income countries. Her most recent research has focused on lead exposure in South Asia, and she is a non-resident fellow at the Center for Global Development. Thank you, Jenna.
All right, thanks so much. It's really great to be here. I'll wait a minute for the slides, I think, to show here. Oops. All right, great. So today I'll be sharing our research to assess child lead exposure and sources in the capital city of Bangladesh, in Dhaka. And this was a collaborative effort with our colleagues at Stanford, Berkeley, and our local partner known as ICDDRB, a little bit of a mouthful there. And essentially, our team's past experience identifying and addressing turmeric as a source of exposure in Bangladesh really highlighted the importance of local evidence to catalyze action and really motivated us to do this study, which started in 2022 after that turmeric intervention. Bangladesh is consistently seen as one of the most lead-burdened countries in the world, unfortunately, and there's still very limited evidence of the sources of exposure, especially at a population level, and especially among young urban populations. So that's the focus of this study. We enrolled 500 children with a representative sampling approach, a population proportional geographic random sampling technique. And these were children who were ages 2 to 4 years old. So that's important because these children spend most of their time at home. So we were trying to minimize the number of exposures they might have and really focus in on understanding the dominant ones. And our 2 objectives there were to determine the prevalence of elevated blood lead levels and, again, importantly, identify those dominant sources contributing most to the human lead burden. So our approach took several steps, and I could go at great length, more than 12 minutes, if you ever want to talk about this or just get really into the details. I love this type of thing, but I'll give you a high level of the 3 overarching steps we took. The first was really exploratory, identifying those relevant sources in the local geography, conducting a scientific literature review. That revealed basically there wasn't a lot that was known in the past couple of decades after phasing lead out of gasoline, but there were some associations with higher blood lead levels in industrial parts of the city. We also did this in anthropological investigation, basically just going to homes in high and low income parts of the city, observing, asking questions, trying to understand what types of sources we might be missing from the scientific literature review. This actually revealed the use of a stutter necklace, which was a lead pendant hanging from a chain that children were instructed to chew on to prevent stuttering, unfortunately, or speech delay. So we also did some market-based product testing, collected over 1,000 samples, actually, everything from cosmetics, pigments, toys, cookware. I'll just highlight a few of these. Nail polish, it turns out, some of the nail polish had lead chromate pigments. That was a bit surprising to us. Other sources like cookware and amulets, all of them had detectable lead, and they were some of the higher lead levels we saw in that exploratory work. So all of this was meant to inform our protocol, our exposure questions, and our next steps. So that next step, assessing the patterns of lead poisoning and sources, looking at this with statistical and epidemiological approaches now. We collected venous blood measured with atomic absorption spectrometry. We conducted a 45-minute exposure questionnaire with the caregiver, again, about potential exposures, and really informed by that exploratory step. We collected samples of soil, dust, water, and spices, and we also did some industry mapping within the city, which I'll tell you a little bit more about in a minute. Our analyses fell along kind of two fronts, descriptive statistics and some spatial analyses, as well as regression modeling. So in terms of our results, just jumping straight in here, there was really high levels of lead in the blood, unfortunately. So this is the histogram of blood lead levels using micrograms per liter on the x-axis, the frequency on the y-axis. And you can see it's right skewed, pretty typical of blood lead distributions. And 98% of these children had above that CDC blood lead reference value. So really high exposure in this population, about a 70 microgram per liter, 7 microgram per deciliter median value. We didn't, however, see lead in the turmeric. Again, this was after the turmeric intervention, and not a lot of lead in the water. There was some lead in the soil and dust, and we'll get to that in a minute. So the next step was looking at the patterns in the data, right? So when we looked, when we did some mapping and some spatial analyses, we found a really strong spatial clustering of these elevated blood lead levels in the southern part of the city. So this was statistically significant. But right here, you see just the deeper shades of red show those higher blood lead levels. And you can kind of see that pattern visually. In terms of the industries, so we mapped the presence of possible lead polluting industries and tried to identify them using 3 techniques. One of these was Pure Earth's Toxic Site Identification Program, and we went back to those sites that had been identified in 2017. Another was using Google screening and keyword searches. And then the final approach was boots on the ground, systematic field screening. We set fixed points with a grid over the over all of Dhaka city, separated by 660 meters, where some of our field enumerators went and followed a protocol to identify the industries in the vicinity. Ultimately, what this led to, and what you can see in this map, the black dots being the households and the red dots being those industries with the highest soil lead levels. These were battery making, recycling, and just industries directly dealing with lead, and there were 16 of those you can see in the red circles that, again, somewhat mirror the patterns we saw in the blood lead levels. And then there were just a lot of other industries with elevated soil lead concentrations. So just representing those in orange circles here, those were battery disassembly and repair sites, copper, brass, and metal melting sites. There were 55 of those within the Dhaka city limits as well. So here's just some images of of our field member going in and analyzing the soil lead at these sites, at the battery recycling and battery manufacturing sites. When he's measuring here with XRF, I think the value was in the tens of thousands of parts per million, not uncommon for these battery sites, up to 100,000+ parts per million. Okay, so given the spatial dependencies in the data, we knew we couldn't use a linear regression model, so we did some model fitting and landed on this spatial error regression model. Our outcome here is log transformed blood lead levels, and the covariates we included, we assessed many, many more covariates than you see here in bivariate models, and we included those with statistically significant associations. So what we landed with was socioeconomic status, distance to industry, tobacco smoking inside the home, dust and soil lead concentrations. occupations being risky, meaning battery, lead related, child having a pica habit, and the amount of time the child spends outside. So these coefficients, and I'll go through the key takeaways here, but here are all the coefficients. These are exponentiated for direct interpretation, and I'll walk us through verbally what this means. But essentially, socioeconomic status was actually protective. So higher socioeconomic status associated with lower blood lead levels, about 17% lower blood lead levels with the highest quintile of SES versus the lowest. When we look at distance to industry, living within 1 kilometer of those battery making and recycling and lead sites was associated with 43% higher geometric mean blood leads. Living 1 to 2 kilometers was also statistically significant at 24% higher blood leads. Tobacco smoking inside the home associated with 12% higher blood leads, and there was a small but strong association with dust lead as well. So these were the statistically significant factors adjusting for age and sex in this model. Notably, when we looked at a stratified model, so when we just looked at those living within 2 kilometers and living further from 2 kilometers, we wanted to see, like, do these sources vary, or do these variables vary? And what stood out was when we looked at those living within 2 kilometers of the battery sites, time spent outside became important. So children spending more than 6 hours outside, if they lived close to an industry, had 18% higher geometric mean blood leads versus those spending less time outside. And that's logical, of course, right? Because we imagine that the exposures, it's either through the air they're inhaling if they're spending more time outside, or through the soil and dust they're inadvertently ingesting. So when we overlay population density on our industry map now, we see something pretty striking, which is on the order of 5 million people in Dhaka live within that proximity of 2 kilometers. So this is a highly dense city in a place where the industries are located in dense locations as well. So that's really unfortunate when you think about what that means. Okay, so the next step, this was kind of the meat of the work, but the next step was to go through and evaluate the plausibility of these sources, go back to the children with high and low blood lead levels, understand those sources, but also other potential sources that may not be statistically significant or associated with blood lead levels, but still important to consider. So we did this nested case control study, lead testing of other family members and other sources. I don't have time to go into all of the details here, but just some takeaways around this. There were a lot of other sources, paint lead being elevated in 31% of the homes, cookware having elevated lead across the board with a median of around 400 parts per million, cosmetics like Surma, although relatively low prevalence, the median lead levels were off the charts, 46% lead by weight. There were some cases of home lead use where jewelry making or battery repair was happening in the home where the child was spending the most time. And the ambient air lead levels, a quarter of them exceeded the EPA threshold of concern. So this brings me ultimately to the conclusions. There are multiple sources of lead exposure and just a high level of background lead, especially in this urban environment. Proximity to industry is really the driver of these elevated blood lead levels. But we see other factors: indoor secondhand smoke, socioeconomic status, and this raises a question. We didn't have the budget for this study to measure nutritional factors like anemia, calcium. That's something I'm prioritizing in subsequent studies because I think this is potentially the elephant in the room, co-varying with socioeconomic status. We have some lingering questions. The dust leads were elevated and associated with higher blood lead levels. That's logical, but what is the source of dust lead? Is it the paint? Is it the indoor tobacco smoke? Is it the fact that there's households having lead-containing materials that construct their homes? Is it the proximity to industry? So our next step is to, again, stratify and look at the chemical forensics, these isotope signatures of the dust and the potential sources for children living near and far from industry. We also want to further investigate the characteristics of these highly polluting industries. What's the pollution plume? Dhaka may not be the best place to do this, because if you zoom out, you see a lot of other industries as well, especially in that southern region. So we have our microscope in one area, but there are other parts of the country where we can really characterize that pollution plume, understand when they operate too, because that could impact how we go about addressing them. this is preliminary results in the fact that it hasn't been published yet, but we're very close to submitting. Our next step is, and the most important part really though, is to disseminate this evidence in Bangladesh with the local stakeholders, develop an action plan, work through some of the levers we can take to tackle the sticky problems that have come up from this. So thank you very much for your time, and yeah, look forward to questions and discussions.
Thank you, Jenna. Our next speaker is Rania Jamal, an international student from Bangladesh, currently pursuing a master's degree in environmental science at Indiana University. Rania's work primarily focuses on climate resiliency, urban forestry, and industrial ecology. Rania is especially passionate about applying interdisciplinary approaches to support resilience planning for vulnerable communities. As Rania nears the completion of her degree, she is open to both academic and industry positions as looking ahead to the next stage of her career.
Thank you for the introduction, Claire. Good morning, everyone. So today I'm talking about sustainability loopholes that exist within the lead-acid battery industry of Bangladesh. And we're looking at this from an environmental and occupational health risk perspective. So according to the World Health Organization, there is no level of lead exposure that is considered to be safe or without harmful effects. But despite that, we know that lead is one of the most abundantly used metals in the world, and much of this is attributed to the battery industry. It was found that batteries use 85% of the world's refined lead, and most of these batteries are being produced in Asia. Bangladesh is among those Asian countries that has seen a rise in demand for lead-acid batteries, and this is due to a rise in battery-driven vehicles in the country, but also a thriving informal recycling sector that makes these batteries so cheap, convenient, and accessible. However, there are downsides to that. According to IHME, more than 38,000 deaths occur in the country annually due to lead exposure, which is a very concerning number. Yet the informal sector remains heavily under-researched due to various reasons like political barriers and such. So one of our main objectives for this study was to uncover the informal sector, understand its environmental impacts, and also occupational health risks, because workers who work in these informal factories are one of the most vulnerable population, given that they are exposed to lead directly for very long duration. So for this, we had to understand the full system. We studied the market, the supply chain, and the life cycle of a battery. And we integrated 3 key analytical tools: substance flow analysis, life cycle assessment, and human health risk assessment. So substance flow analysis is a method that tracks how much of a substance is moving through a system. So in this case, our substance is lead, and the system is the battery industry of Bangladesh. And whereas life cycle assessment is an ISO standardized method that calculates the environmental and health impacts of a product or life cycle, product or service throughout its life cycle. Lastly, human health risk assessment assesses health risks posed to a certain population under specific conditions based on soil contamination data, and it measures this through exposure routes like ingestion, inhalation, and dermal routes. These are the results of the substance flow analysis. I know this is a lot to look at, but the key takeaway from this is we found that electric rickshaws and electric vehicles use up most of the lead through batteries. And when I say electric vehicles, I don't mean EVs in the sense that we consider what we see here in the US. It's more like 3-wheeler vehicles that are big and can carry like 4 to 5 passengers or more, and they're very popular in the country. We also found that more than half of the ULABs end up being informally recycled. But the really shocking part is the difference in how much lead pollution occurs from formal recycling versus informal recycling. We found that almost 7 times more lead is lost to the environment from informal recycling compared to formal recycling. And this is, before I show the results of the life cycle assessment, I wanted to give a look at the model itself, because unlike the substance flow model we just saw, which considers one substance, the LCA model considers everything that goes into manufacturing, using, and disposing, recycling a battery. So it counts for how much electricity is used, how much of the other elements like antimony, oxygen, plastic, water is being used, and it has its own inventory database that it uses to calculate how much of environmental impact is occurring due to these processes. So these are the human and ecosystem health impacts. On the left bar, we have the human health impacts measured in DALYs. And on the right, we have the ecosystem health impacts measured in potential species lost per year. And we can see that the largest impact for human health is fine particulate matter formation. And this is all the lead dust that is released during manufacturing and recycling batteries. For ecosystem health impacts, global warming of terrestrial ecosystems is a huge impact. But land use also has a huge impact for ecosystem because of all the lead that settles onto the soil makes the land inappropriate for most land use activities like agriculture and so on. And these are the contribution of the different life cycle background processes to the impact categories that we just looked at. And yeah, so you can see that in red, recycled lead is the dominant contributor to land use impacts. It's contributing to most of the other impact categories as well, like global warming, fine particulate matter, and terrestrial acidification to some extent. But, and the market for lead is a huge contributor to human non-carcinogenic toxicity. Lastly, the results to our human health risk assessment reveal that workers working in these informal recycling facilities are 15 times more likely to develop a non-carcinogenic disease in their lifetime compared to an average person. They're also slightly above the threshold for cancer risk as well. And the main exposure pathways for these workers is ingestion, followed by inhalation, and then the dermal route. But yeah, the ingestion pathway poses almost 10 times more risk than the dermal pathway. Policy gaps and what needs to change. So in 2021, Bangladesh established a policy that applied to all industries, and it's focuses on reverse logistics, so it shifts disposal responsibility to producers. It says that it bans informal recycling and mandates safer practices. And while this is good on paper, it does not reflect in reality because informal recycling continues to be the major recycling sector in the country. This is because there is really no real incentives, monitoring, or any strategies outlined to formalize the informal sector. And therefore, we recommended in our study a national action plan that's specifically targeted towards the battery industry. Like the one that China has is a pretty good one. It should set clear recycling targets, and it should use economic tools, local partnerships, and really the specific context of a developing country of like Bangladesh to outline a strategy to formalize the informal sector. We thought that targeted cleanup is also necessary given that the sites that these informal facilities are in have become hotspots for lead toxicity over time. And concluding our findings, we found that there's a huge difference between the amount of pollution occurring from formal versus informal recycling. And despite that, even though formal facilities are much more efficient in recycling lead and much safer as well, informal sector is still the bigger market. And it's also the most dominant source of lead pollution in Bangladesh. These findings can definitely be expanded on, especially with access to trade data that's more continuous and more complete. We could portray a much more dynamic picture of the industry. And the findings can also be strengthened by increasing sample size. It was really hard to access the worker population in the industries because it is a very politically sensitive industry in the country. So yeah, with an increased sample size, the findings can be strengthened. And I also want to mention that there are levels to informal recycling. Like we can see that sometimes it's makeshift furnaces in the ground, sometimes it's furnaces like that on the left. So, and sometimes it's even bigger than that. But it would be really cool to analyze how the lead pollution differs based on these different levels of the informal recycling sector. Thank you, everyone.
Our next speaker is William Seitz, a senior economist and team leader for the Poverty and Equity Global Practice of the World Bank in Central Asia, based in Almaty, Kazakhstan. His areas of expertise include poverty measurement, small area estimation, labor market analysis, and survey methods. Before joining the World Bank, William worked as a research officer at the Center for the Study of African Economies at the University of Oxford. He holds an MBA from the University of Denver and a PhD in economics from the University of Milan.
Thank you. So I'm going to share some work that we've done in Indonesia, focused on lead paint that we tested in homes across the country using a survey. So the background to this was that we launched a new program on pollution issues in Indonesia about a year and a half ago, and as we were kind of considering what were the areas that we wanted to focus on, one of the things that we elevated to our partners was that one of the types of pollution that we were considering is not like the other ones, right? So lead is by far a much more damaging toxin than many of the other types of toxins that you could be worried about. But so in this graph here, you see that lead is as dangerous in terms of premature deaths as these other 15 sources combined. And the regulatory attention that lead gets is certainly not 1/15 of the total already. So just putting this into context and why we wanted to focus on this issue compared to some of the other pollution-related topics that we could have focused on. We also we're kind of trying to motivate a greater attention to lead poisoning in Indonesia because it's very neglected. It's not very well understood by many partners, by society overall, but certainly also with our government partners, how large and how urgent the challenge is in Indonesia. So there are no nationally representative statistics on lead poisoning in Indonesia, unfortunately, but the Global Burden of Disease database estimates that lead exposure kills about 27,000 Indonesians. It killed 27,000 Indonesians in 2019, with a loss of about 711,000 disability-adjusted life years. So if we just put this into context, it means that Indonesia is likely the 4th most affected country in the world. If correct, this also kills more people per year than traffic fatalities. And if any of you have ever visited Indonesia, that's quite a statement. I mean, it's a very a large factor in terms of premature mortality in the country. And when we focus on children, the numbers are very striking. A very high number of children are suspected to have very significant lead exposure, leading to significant learning delays. And in Indonesia's context, this is particularly a challenge because the government has prioritized closing the learning gap between Indonesia and the global average, which has been a challenge for many years. And some work by colleagues here at CGD have suggested that as much as a quarter of that gap may be due to lead poisoning. We also did some calculations on sort of the value of statistical life and converting these years of disability-adjusted life years lost and how that compares with the value of a statistical life. And you find that it's equivalent to about 0.8 to 1.7% of GNI in 2023. So that would be larger than the entire government state budget for health in the country. So it's, I mean, the magnitudes here are very extreme. So what we did at the beginning of this study, and this is sort of the first phase of a larger work program, was to go out into the country, do a survey, a nationally representative survey of 5,000 households to test for lead in the household paint. And we used a chemical-based test, so it's a positive, negative type test. And we found that almost 45% of Indonesians live in homes with paint that tests positive for lead. So that included about 46% of children aged 5 or younger, so about 10.2 million children. We also assessed the condition of the paint where we found it. So the idea here was that deteriorating lead paint exposes children to much higher concentrations, or adults as well. Because it turns into dust and it becomes more, the exposure levels increase. So we found that about 14.1% of children aged 5 or younger were sort of exposed to these elevated risks because of the deteriorating condition of the paint. And this is particularly common among low-income households. So if you look at the high-income households, it was very rare for their paint to be in poor condition, even if it contained lead. But those that were at the lower end of the income distribution were much more exposed to deteriorating conditions of lead paint. So we used these estimates to calibrate the IUBK model, which is sort of a method of trying to assess sort of what would be the consistent level of BLLs that you would expect to see given a source of exposure. And we found that this may explain up to about half of the level of exposure that is found in sort of the national studies, so about 55% according to the IUBK estimates. So this is just a visual of sort of the exposure across regions. And one of the things that I think was very remarkable is that there were very large differences in sort of the regional distribution, often due to differences in preferences for color. So in some parts of the country, it was much more common for people to have sort of red or yellow painted homes, and in other parts of the country, much less common. In some places as well, there was actually a sort of a protective effect of people not having any paint at all. And so in those cases, the paint test came out negative, of course. So you can also look, we asked when the paint was last applied, and you can see that there's been a reduction, a modest but significant reduction in the lead content of paint that was applied more recently. But that there was a very strong relationship between sort of the condition of the paint and the income level, as I mentioned before. So on average, people are repainting their homes in Indonesia about every 5 years. And so this is a parameter that we've used in our discussions with counterparts about sort of the life cycle of sort of replacement if there is big changes in terms of regulation, which is, I'll get to in a moment, but just a couple of words about the IUBK model. So this is a model that's been developed over several decades, but there's an updated sort of overview of the model and how it works and its validation that was published in 2020. It comes with initially set default values based on empirical estimates, and then we can use these, we can changed these empirical estimates based on sort of the conditions locally. So the key parameter for our study was the indoor dust parameter. Then the way that this worked is that we calibrated it to sort of the background level of lead. Generally, if there was no lead paint in the home, or the lead test came back negative, or in the case of a household that had lead-based paint, we varied it depending on the distribution that we observe in studies that have observed this directly. So in many countries, this has been sort of applied, and so we use the sort of the empirical distribution with a maximum of just above sort of what the typical case was in the United States. So that was 1,200 micrograms per gram, and so the model calibration varies from 400 to 1,600 depending on the exposure levels. And so we did some robustness checks to see sort of how sensitive the results were to these parameters. And really what we found was that it's kind of the bottom end of the distribution of these that tend to drive most of the results in any case. So even if you were to cut these in half and say only, say, 200 to 600, you would still find qualitatively very similar results according to the model. But this is a sort of a visual of the results by age. And of course, I'm sure many of you already are familiar with this, but the challenge with lead paint is, that is especially dangerous for children is that, you know, they have hand-to-mouth behavior and they're sort of on all fours, you know, crawling around. And so they get exposed to much more dust at a very young age. And this is also a period when, you know, they're very susceptible to lead poisoning. And that falls with age. So as children get older, the amount of exposure that you would expect decreases. But chronic exposure is still very dangerous, even if it's not sort of at the threshold that we would commonly use to sort of to signify sort of very severe exposure. And this can account for, in some other work that's been done at the World Bank, this can account for as much as 70% of the total cost, these sort of chronic conditions that are exacerbated by ongoing lead exposure. So the IUBK model gives distributions of expected values of sort of at the population level, how much exposure you would expect or what the blood lead levels would be. And so we published these in the paper for the different distributions and different groups that are vulnerable. So this brings us, of course, to sort of what do we do about it? So in Indonesia, we've been engaging with the government and with other partners about changing the regulations in the country to ban lead paint. So currently there's no ban. There's a voluntary standard that's very rarely actually applied in practice. But despite this, there are several brands that are already lead-free. So we know for sure that it's feasible to do in the context that all the materials are available, but due to the lack of a ban, sort of lead paints are still very common on the market. So there's one company in particular that was a sort of a leader in this, moving to lead-free, Maulex. But the most recent published work on this suggests that many of the producers are awaiting sort of a stronger regulation before they sort of make the shift themselves. So only a few have done so based on the voluntary standard. So from the World Bank's perspective, I mean, these results were, they have limitations. They don't sort of go into all of the level of detail that we would like. Of course, this is a model-based estimate, so there's some imprecision around it. But it helped motivate a little bit our sort of ongoing engagement in the country on this issue. So one, clear area is, we often sort of support policy reform, and so we're focused quite heavily on this issue of banning lead paint in the country. Also, there's an ongoing program to see about helping Indonesian paint producers, because a lot of this paint is produced in Indonesia, to make the transition in a way that's not as disruptive. There's also a real lack of information about the prevalence of lead poisoning in the country. So as I said, there are some small studies that are available that we can extrapolate, but we don't have a nationally representative estimate of how much lead poisoning there really is. So we're running now, we're launching in a few weeks a new BLL, a nationally representative BLL study. So it'll cover 5,000 households, 5,000 children and 750 adults, which will give us, I think, for the first time, a very precise estimate of sort of the amount of poisoning in the country and its distribution. And this is part of a sort of a larger initiative that is, trying to encourage adoption of easier and more systematic testing of the population. So right now it's only venous blood testing, which is available. It's very rarely ordered. And so one of the areas that we've been discussing quite a bit with the counterparts through our health program is building out capacity and trying to make the capacity that is a little bit less invasive than the venous-based testing by using capillary-based testing instead. So a few other areas that we're thinking about, but one of the big ones sort of is maybe a phase 3 or sort of further on is, if we're successful in banning lead paint, there's still a huge question about what to do with the stock of lead that's in the environment. And this is an area that's sort of under active discussion with our partners about what we can do to affordably address sort of this persistent issue that's going to be a problem for many years to come. So thank you very much for the chance, and looking forward to the discussion.
Thanks, Will. Our final speaker is Lee Crawford, a senior research fellow at the Center for Global Development. His research focuses on education policy in low and middle income countries. Previously, he was an advisor with governments in Rwanda, South Sudan, and the UK, and a consultant for international organizations and NGOs, such as the World Bank, AFDB, and ADB. He has a PhD in economics from the University of Sussex and has studied at the University of Oxford and the School of Oriental and African Studies. Lee.
Thanks very much. That's the end. So this is a paper looking at battery recycling and taking a step back from the detailed country-level data and thinking big picture. And we ask quite a simple question, I think, with a not so simple answer. How much of lead exposure globally is coming from the informal used lead-acid battery recycling? This is joint with James Hu, who's now at Open Philanthropy, and Theodore Mitchell from CGD. And there's some motivation. Here's a clip from Hugo Smith's excellent battery Substack, asking the same question as us and answering, nobody really knows, but probably a lot. And remarkably, there's almost no research on the share of lead poisoning caused by used lead-acid batteries. So we're trying to add to that a little. And I think this is really important because there's so many candidates for where you should, where sources are coming from. This is a clip from the excellent Toxic Truth report from UNICEF and Pure Earth that lists 16 different sources of lead exposure. And when you speak to policymakers, they want to know, okay, so what are the most important sources? Where should we prioritize action? And I don't think we have a great answer right now, and it's very context dependent, and there's always caveats. But it feels like lead-acid batteries are going to be a big share of it, given that 85% of lead is used in batteries. And so, but we don't know exactly how much of that is getting absorbed ultimately and contributing to blood lead levels. There's essentially one paper which tries to model this. So this is by Brett Erickson and colleagues who's here from 2017. And they build this model based on the estimated number of polluted sites in each country and the estimated exposure at each polluted site. And ultimately come to a number which is a relatively small share of a burden. I think around 5% of the total burden of lead exposure, which is very different to the 85% by weight being used in this industry. And so there's a little bit of a puzzle there which we try to unpack. And I think the answer is maybe around how far do you need to be from a lead-acid battery site to be exposed. And so the model from 2017 uses quite a narrow radius of 300 meters, and there's good reason for that, which I'll get into. But as we saw yesterday, there's been this recent raft of empirical studies showing effects on people, 5,000 meters away, 10,000 meters away from a informal battery site, and Jenna's work as well, 2,000 meters. So essentially what we do here is we go back, we revisit the Erickson et al. Model and add this wider radius of exposure at lower levels and see what that adds up to. So this is data from Pure Earth's excellent toxic site identification program. So they have hundreds and hundreds of thousands of polluted sites around the world from different countries that they've been to and investigated and tested. Here, I limit just to the informal used lead-acid battery recycling sites, of which there are 912 different sites around the world, and nearly 12,000 measures. So there's 10 to 12 measures per site. And each measure is at a slightly different distance from the site itself. So there's some coverage around the site. And so I'm plotting here on the x-axis the distance to the site, and on the y-axis the soil lead concentration. And you can see there's a very good reason to focus on that narrow bandwidth of 300 meters, because that's where most of the exposure is. But as we saw yesterday, here's a clip from Gerald Ipapa's paper, which shows, before the lead-acid battery sites started up, it didn't make any difference if you lived within 4,000 meters or further away from this site. And when they started opening up, suddenly we see these negative effects on test scores for people who live within 4,000 meters of a site. And so this is a good reason to look further. This is a compilation of 5 of these studies in which they vary the distance that they look at. So rather than just picking one bandwidth, in each of these studies, they're varying this between 1, 2 kilometers, all the way up to 10 kilometers. And overall here, I think you do see bigger effects at closer distances. But in several of these studies, you still see effects on test scores or on birth weight when you look at this much wider radius up to 10,000 meters away from a site. So we go back to the pure Earth data, and we fit our line of best fit between the inverse of distance and the soil lead concentration. And what this line of best fit predicts is roughly around 100 parts per million in this range from 300 meters away to 5,000 meters away. So that's a relatively low level of exposure, but it's enough to cause some contribution to blood lead levels, and for a really large number of people. So that's gonna really matter. So what happens? So this, in brief, is what the model does. So we're estimating the share of burden attributable to lead-acid battery recycling as a function of the average exposure per site multiplied by the number of sites in a country, and dividing that by the total burden. And all 3 of these numbers are estimated with a huge amount of uncertainty, so there's big confidence intervals here, but nonetheless we do our best. So with the exposure per site, as I said, it's around 90, 100 parts per million. The average soil exposure, and then the population we overlay with toxic site identification program data, gridded population data, and we estimate it's around 200,000 people within the average site within 5 kilometers, so a really large number of people with a relatively low level of exposure. Second, we need to know how many sites there are in each country, and we don't have great data on this. There's one published study which has effectively a census from Ghana, where they had boots on the ground and they had nationally representative sample of neighborhoods, and then they walked every street in every neighborhood. I'll have to include Jenna's data in the update of the paper that does something similar. And from that, you can extrapolate essentially we take how many sites there are per capita in Ghana and extrapolate that to other countries with some adjustments for income levels and levels of informality in different countries. So that gives us one estimate. And then a second approach is more bottom-up, based on the demand for batteries from vehicles. So we add up all of the three-wheelers and cars and motorbikes and different vehicles and what that implies for battery demand. And we subtract from that data on formal recycling, and the residual then is what is left to be informally recycled, and we make some assumptions about how that might be distributed. And finally, we use that IUBK to convert from soil lead to blood lead human exposure. Just on this second point, these 2 quite different approaches have reasonably, they have some coherence. There's a correlation of 0.68 between these 2 measures across countries. With the top-down extrapolation from Ghana, we estimate 2,500 sites on average per country. And with the bottom-up vehicle demand approach, we estimate 1,600 sites per country. So they're not a million miles away, but there's a fair bit of uncertainty here. And so what does all this mean? Here's the conclusion. Essentially, we start with replicating the result on the far left with a radius of 300 meters from a site. If that's all we focus on, we get this very small percentage of the share of burden, 5% or so. And when we go up to, say, 5,000 meters, we're suddenly up to 50% of the burden that's coming from used lead-acid batteries. So it's a big order of magnitude change. If you go all the way to 10,000 meters, as some of these estimates would imply, you get over 100% of the burden. So clearly that's impossible. So this is a flawed model and is, far from perfect. But I think moving from perhaps 5 to perhaps 50% makes some sense. There's much more we can do to try and improve and refine these estimates and to show them by country, which we haven't yet done. So this is just an average across countries. This is a clip from our meta-analysis of studies on test scores and blood lead exposure. And it shows the dose-response curve between lead exposure and test scores. And this is just to reinforce the point that this low-level exposure for a huge number of people, at the moment in the model, we're treating that the same, whether it's 100 people with 1 microgram or 10 people with 10 micrograms, we're treating that the same. But actually, the harm may be bigger for people with low levels of exposure. So if we have more people with a low level of exposure, that may be even more of a harm in terms of impacts on outcomes like education. So yeah, to conclude, there's lots that we can do to improve our confidence in these numbers. Here's just 3. So more ground estimates of the number of actual sites in countries would be really valuable rather than just relying on one study from Ghana. Second, I think better understanding of different pathways. So this is entirely based on soil lead estimates, and there's all these other pathways that we know matter, like air and water and food, which are not in the model at all. And then better estimates of these soil ingestion rates for different countries, which we know can vary by orders of magnitude as well. So huge amounts of uncertainty here, but I think fitting together these different pieces of research should shift our priors a reasonable amount about how much of this overall burden we think is coming from batteries. Thank you.
Great, thanks everyone. Got plenty of time for questions. So I just want to connect the dots between the first 2 talks. So Rania, a big conclusion from yours, and what we've heard throughout is that informal sites are really the bulk of the issue. So I suppose, Jenna, just want to sort of hear from you a bit. Is that a good characterization of the toxic sites that you were looking at? And then maybe a follow-up question is, what are some strategies we can use to formalize the informal sector? And is that the right question that we should be asking as well? So maybe, Jenna, do you want to kick things off?
Sure. Yeah, so that's definitely in line of the sites you saw. Well, of the 16 kind of major ones in Bangladesh, the majority are informal or not, on that spectrum, which it is a spectrum, as you mentioned as well. Yeah, and I mean, I guess, do you want to add anything to that in terms of level?
Yeah, so I think that for formalization, context is really important. What has worked for another country is not necessarily going to work for a different country. Social context, cultural context, historical context, and political context is really important to take into account before you decide to ban some. So yeah, context-based strategies are very important.
Yeah, and I guess to add on that, potentially there's one way of viewing this is that we need to formalize the informal sector, right? And there might be other angles we could take a look at, like what are levers that we could move that could change things from another angle as well. Certainly, like, it's complex because these sites have a leak of pollution that won't go away. So you mentioned there's this existing pollution there that won't leave. even if the activities that happen change. But there could be, look at the tariffs, which we know, so there are taxes in place that are kind of perpetuating this. So that's one potential lever. There's ways to incentivize funneling the batteries recycling to fewer actors that are maybe safer, checking to make sure they are indeed safer. And then there's possible other angles in terms of technology and alternate solutions, like just to add a few of those levers, yeah.
Great, thanks. Okay, and then turning to paint. So, Will, as you said, Indonesia doesn't have a lead paint law, so it's currently legal to manufacture lead paint. So I'm interested, how were your results received in Indonesia?
Thanks. So it was, I think, mixed is probably the best way to put it. So some parts of government, I think, were very surprised. We're very, and sort of shocked into action. So there's been, I think, quite a bit of positive momentum from some partners in government. There were others who I think are very reluctant to kind of admit the problem. So there's and I mean, this is especially kind of the industry side of the discussion. So there's a powerful paint lobby in Indonesia that was very did not endorse the findings, called them into question. So some in sort of the industry side have been, I think, much more reluctant to kind of embrace change and reform. So this is still sort of developing. I think the general public, I mean, the reaction was mostly frustration or outrage even. So there was quite a bit of public discussion about sort of how this could continue. That there's strong evidence for a long time that this is a really bad thing. So that I think brings some pressure on the situation to maybe that may lead to change, but it's still a work in progress. Yeah.
Any questions from the audience? Let's go right to the back. Your hand shot up.
Hello, everyone. Good morning. A quick question on one pathway of exposure that is soil related, but not really from the fine particles of, or not the fine, but the particles of lead that come out of recycling, about the slag. And I wonder if you guys have ever kind of observed of like what happens to the slag that comes out of these formal, informal recycling facilities in these countries, because I suppose there's no real way of a proper protocol of what to do with that slag. And from my fieldwork in Bangladesh, I've heard examples of the slag being sold as soil. And I wonder if that is another pathway where the lead gets kind of taken quite far away from these facilities.
Want to take that?
Well, I can say that our study to date actually was looking more at the population. So like the next step would be looking into some of these things. I think it's a great question. I've also heard that the slag is used in like concrete for building materials, related to that. But that's kind of like a next step that we haven't dug into, which I think is really, really worthwhile to think, is it just there's also a human movement. We know in a city people move a lot more than potentially a rural environment in terms of like actually relocating. So I think you're right that there's the exposure from actually the air and the soil, the touching near the sites, but there's where the soil is going, and then there's where the people are going that I think are all angles in thinking about how far the distance that matters. But yeah, did you look into that at all?
Yeah, that would definitely require looking into the construction industry in that case and how they interconnect. But yeah, that's a really interesting question. I have mostly just worked with soil contamination data, but haven't looked into the slag part of it.
Another question? Should we come down here?
Yes, Perry Gottesfeld, Occupational Knowledge International. My question is for you, Rana, about how did you define the informal sector versus the formal sector? For the photos you showed, I know that that those types of sites are considered formal in other countries, even next door in India, for example. So there's really not often a clear division. So I'd like to hear your thoughts on that. Thank you.
So the formal sectors are licensed in Bangladesh. They are part of the, there's a battery manufacturing community board that they can be licensed under, and the ones that were not under that license was considered informal. So fun fact, the sites that I just showed you, when we got there, the people that were working there, the workers and the managers fled. They left the site. They did not want to talk to us, and that's how you know that those are not regulated. Yeah.
Rachel has a hand.
I guess this is a question mostly for Jenna, but possibly, oh, I have double mic. Maybe just use the lapel mic. I think that's the problem. Okay, maybe a question for Jenna, but sort of for everyone. I mean, so one thing that was really notable was your stratified analysis, right? Of, okay, it looks a bit different, like soil lead levels if you're within this category. And I mean, and I was struck especially by the indoor-outdoor, right? Whereas, okay, if you're far away and your exposures are mostly indoor, then it would make sense that, you know, being indoor, like actually being indoor would make things worse, spending more time indoors, versus if you're near a battery recycling site, maybe your exposures are outdoors. But that's going to look like a net zero effect, right, if you're combining everyone. And actually, this just makes me a little bit nervous, broadly speaking, about some of these statistical approaches to source assessment that I think, if you have a variety of sources, that actually if you're lumping the population together, you might be getting a lot of false zero effects because you're actually lumping opposite effects from different sides. I just wanted to, if you have any reflections on that, are you worried a little bit looking back at previous source assessments? Because that's sort of a flashing red light for me.
Yes, I mean, well, we try to like there's so many angles to this actually. Yeah, I mean, certainly, I think it's hard to stratify when you, like, a bigger sample size allows us to tease out more from these studies just writ large. There's always the question in the statistical studies of what we haven't measured or what we haven't included, right? Like, so those are some of the things in the back of my mind always thinking about, like mentioning the nutrition, for example. But then I think that's where some of the, it's not perfect, but some of the exploration of the data and exploring these patterns, the interactions, the stratified, what's happening with each of the variables can help us tease that out. So even if we see something directionally surprising, but not statistically significant, still taking note of that, not just basing all of the conclusions off of statistical significance. But I think it's a really good point. So I mean, I think my conclusion to that is, for all of the variables, we do more behind the scenes exploration to really understand what is their distribution, what is their nature, and if we stratify or interact, even if the sample size is a little bit on the low end, what is the direction we're seeing that finding, and should we consider that more? Is that logical, or do we need more understanding? But yeah, I think it's true that I think alone statistical measures, you really need the multiple approaches to really understand and ensure that they check out. Yeah, it's a great point.
I know Lucas has a hand over there.
Good morning. I'm Lucas from Metallics, and I have a question that goes to Jenna Rania, and well, in different ways. And that is, you all highlighted how important it is to know which source of light it is, and the take home, and then further down the awareness. And just as a thought experiment, if one was able to give a test, like a home test, to all parents in a city or in a nation, what would need to happen such that people could actually effectively protect themselves or their families with something like that?
Do you want to go?
So I can speak for the worker population. Since ingestion is the highest risk route for workers, it's really important to wear the proper gear, like mask up, wear suits, wash hands. So when I visited formal facilities, there was a very stark difference. They had signs, they had stations for doing all of that. They were wearing the right gears and everything, but in informal sites, it's just a guy in his regular clothes. There's no safety measures, nothing. So I would say that for workers, it's really important to practice safe working conditions. Mm-hmm.
So maybe on lead paint, I think, I mean, there's an opportunity in the sense of these chemical-based tests that they're very cheap, right? So it's not very expensive to, give everybody a test. The downside is that they're not very, they don't tell you anything about the concentration. So it'll come out positive if there's actually a very small amount of lead in the paint or if there's a very large amount of lead in the paint, and you can't really differentiate between these two things. But if the purpose is to try to encourage some people to say, to recognize that there's a problem, and the risks are very weighted towards their not doing anything about it, even, so if you get somebody worked up and they, take care of a problem that's maybe more modest, that's, I think, a much lower risk than, people leaving the lead paint as is, without any sort of way of addressing it. I think part of the big challenge is sort of what can a household do to once they've established that they have a problem. And that, I think, so one of the common ways that it's dealt with in the United States, for instance, is using encapsulant paint. So not removing all of the paint, but using a very durable, thick type of paint that binds very well and is very sort of elastic so that it doesn't chip or become dangerous over time. So this type of paint is not readily available in many places. So this is an area that I think potentially could be explored much more. But I think this would be the beginnings of kind of a solution to that you would want people to safely apply encapsulant paint in those cases, because that would be sort of an affordable way of making it at least much safer than it is today.
Another thing I noticed was informal factories, the lead dust is collected and reused, which is not something that you would see in informal sites.
I know we've got one more eager hand here. That's the final question.
Yeah, good morning, and thank you very much for this very good session to all of you. My name is Stefan Böse O'Reilly. I'm from Munich, from the university in Germany. A very quick one for Lee. How about artificial intelligence and spotting these ULOPs? But this is only very quickly. But to Jenna, chemical forensics is a wonderful word. I think it's very important that we really think about this. I'm a pediatrician, so if you have a blood lead level, I can tell you how dangerous this is for the kid. I don't need all the health effects measured. But to combine environmental data and health data is extremely tricky, not only for that. So if you have environmental data, let's say soil, and I would like to know if this is really the source. It's so important because, as you indicated, it could be nail varnish. That's absolutely new for me. I'm not using it, but might be the black one. Could be very, very important for some people. But it could be different sources, and some sources are cheaply stopped, like turmeric, as you mentioned, which is a success story. But lead in paint would be very difficult to phase out. So if we look at the cost-benefit of interventions, we would clearly need to know the fingerprint, the chemical forensics, much better. So if you have 100 million to spend, and you want to have the cost benefit. And yesterday we had wonderful modeling about all this from Seattle and so on. But I think you 4 or 5 should discuss a little bit more and inform us a little bit more about the fingerprint and how this could be accessed and how this should be included in future. Because if you want to come to interventions, this is really the one and only way to identify what intervention could make more sense than the other one. I liked very much your comment about low levels might be much more important than high levels and so on. But maybe you can say a few words about this. And the other one we can talk later on.
Okay, we're very short on time, so quick fire on a big, hard question right at the end. Should we start? Jenna, we can go.
Well, Lee, did you want to, since you haven't had a chance? Or
No, it's a great idea, AI, to find sites. Thanks.
Okay.
So is the question, how could chemical forensics be useful? Is that the basics? Yeah. Okay. I mean, I think the multiple there's actions that can be gleaned from earlier steps too, right? Like I think now we have a pretty clear path for the broad driver, right? Like or at least a pretty clear focus that dominant source is worth pursuing. But I think, as you said, I think we still don't know if there is a single fingerprint that can be linked to those ones I mentioned for actually ascertaining the lead in the dust. The data isn't so clear on what the ultimate source of the origin of the lead chromate in the paint, for example. We think that the lead in the housing and the aluminum is actually from local battery recycling and the lead coming in there. And we think the tobacco smoke, the cigarettes, is actually a very different source. So we probably can't tease out between the housing and the proximity to industry, because those might be the same. But those other two, like logically, the lead might be sourced differently. So I think that's kind of the current prior, and it still needs data to test out. So I think, it's nice to hear that you also think that could be useful. Yeah.
Okay, Will, very quickly.
Yeah, I mean, I think in one way, this is kind of a question of whether it's a zero-sum decision, right? So if we have only $100 million and that's, we have to spend it on the most effective thing that we can, then I think this is a really good question. If we're not sort of in that situation and we can address many issues at once, I think that, we know that all of these are going to contribute to some degree to the problem, right? So I think, there's some situations where we're in that kind of zero sum, we don't have the resources to do everything, we need to focus. But in other cases, there are many things that we can do across many of these different areas that are not zero sum, that they don't rival one another, and we can make progress across all of them. So I think we're often in that second case, in fact. So.
Okay, thanks everyone, and enjoy your coffee break. You want to come in, Rachel?
All right. Yes, per usual, just brief announcements. As always, please try and take out garbage with you as you go to your coffee break. We will be reconvening in 15 minutes for our next panel at 10:45. And if you are on that next panel, please come out here to get your mic'd up. Thank you, everyone. All right, everybody, welcome back from the break. If you guys can take your seats and come back from your coffee, please. Give everyone a moment to come back to your seats, please. Great. All right. Everybody, please come back to your seats. All right, we'll get started. It's going to take a while for people to filter back in, I think, but we should get started. So for this next session, we're going to be talking about emerging sources of lead exposure. So these are sources that maybe are a little bit less well known, where we're still just getting signals about them, or maybe we know about them generally, but we're learning about them in new contexts that we didn't necessarily think previously they were a problem. So we'll have a few different presentations in this space. I want to now introduce our moderator for this session, Nida Parks. Nida Parks recently joined Pure Earth as Chief of Staff, but she has over 18 years of experience in global health and development, including 15 years with the USAID, working on key priorities from HIV/AIDS to pandemic planning and response and environmental health. And for those of you who have been in this space, you will know Nida well because she was USAID's agency-led coordinator and helped mobilize support for countries to effectively detect and prevent lead exposure, including playing an instrumental role in launching the UNICEF-led Partnership for a Lead-Free Future. Welcome, Nida. Thank you.
Hello, everyone. Nice to be together with you all. So we are lucky to first hear from Dr. Vivian Hoffman. She will be presenting on heavy metals contamination in urban agriculture, specifically in Nairobi, Kenya. Dr. Hoffman is a senior research fellow at the International Food Policy Research Institute. She comes to us with her PhD in applied economics from Cornell. Prior to that, she was at the University of Maryland and IFPRI's Nairobi office. Much of Vivian's work focuses on the intersection of health, agriculture, and economics, in particular how information, regulatory oversight, and market incentives affect food safety behaviors and outcomes in low and middle income countries. Welcome, Vivian.
Thank you, Nida, for the introduction, and thank you, everybody, for being here today and allowing me the opportunity to share my research. This is joint work with Mike Murphy, who's here somewhere, there he is, as well as Githenya Wachira, who's at the Kenya Plant Health Inspectorate Service, or was at the time of this research, and also doing his master's at the University of Nairobi, as well as Cecilia Onyango, who's a professor at the University of Nairobi. Okay, so food is a really important pathway through which lead exposure happens globally. There's not all that much research on the intersection that includes both blood lead levels and source attribution to food, but there are two studies that bring together evidence on blood lead levels around the world, and another study that looks at the estimated contribution of food to those blood lead levels based on market basket studies and contamination levels in that food. And when you put together the countries of intersection across those two studies, we see that probably about a third of the blood lead levels are actually through dietary exposure. That's excluding China because those numbers don't make any sense, but in China it seems like a lot of the contamination is actually coming from food. Right. And when we look at the level of health harms caused by different foodborne contaminants, lead is actually the #1 contaminant in terms of DALYs per 100,000 population. So it is the biggest contributor to health harms of any single foodborne contaminant out there. We focus in this study on peri-urban agriculture. Now you might think, well, urban agriculture, how important is that really? How much food is grown in cities? Well, you'd be surprised. I was surprised when I looked into this first. About 11% of all irrigated cropland in the world is within urban areas, and 60% of all irrigated cropland is within 20 kilometers of a city. And so that's because irrigation is typically used for vegetable crops. Those are also the crops that are typically most contaminated with heavy metals. So this matters. And thinking back to the discussions and presentations we had earlier, 20 kilometers may seem like a long distance, but you do get significant levels of deposition from atmospheric sources within up to at least 10 kilometers. So also, in these environments, urban households typically are engaged in agriculture in many settings. So across 15 low and middle income countries, 10 to 70% of households were engaged in some sort of agriculture, whether it's keeping a home garden, raising a couple chickens, et cetera. And there's significant upsides to growing food where people can get it, right? Interventions that promote urban gardening find that this significantly improves dietary diversity and nutritional outcomes for kids. But there's a downside. So as we've seen, there's a lot of heavy metals, and especially lead, in these environments. And so there's just a ton of different potential sources that could be getting into the soil and getting into the food. In the Nairobi context specifically, there have been several previous studies. Most of them have had quite a small sample size and have focused on areas that are known to be highly contaminated. So in this work, we wanted to use a broader sampling strategy and understand, what is the level of contamination? How big is the problem? How bad is the problem more broadly in Nairobi? Okay, so the main crop that is grown in this area is kale and leafy greens more broadly. Kale is a great crop because you can harvest it continuously throughout the year. It is easy to grow. I can grow it in Ottawa. You can grow it in Nairobi. You can grow it all year round. And it has huge market demand. 74% of Kenyan households, according to nationally representative data, have eaten this crop in the past 7 days. But unfortunately, it's also a significant accumulator of heavy metals. So how did we get our sample? Well, we used a grid-based sampling approach, which means that we took areas around the Nairobi River within Nairobi County. So most irrigated crops, most kale is grown pretty close to the river because they use the river or its tributaries for irrigation water. And so we took these two rectangles on the western and eastern sides of the city, which are not as densely populated. There's more cultivable area there. And we split those up into grid cells. We discarded those that were more than a kilometer away from the river, and then randomly selected 100 cells, inspected those on Google Maps, threw away any that were on buildings or roads or rivers, and then sent people out to actually figure out who cultivates this land. Well, are there greens grown there? Who cultivates it? And set up an interview and arrange for sampling of the crop. Most farmers grow around an acre of cropland in this sample. 92% of those are growing some kale. About 2/3 are growing another leafy green, primarily African nightshade, cowpea, so indigenous leafy greens. And people are harvesting often per month, on average 7 times, but as frequently as every day. And the estimated revenue from this is $273. So that's about twice the daily wage rate if you're working 6 days a week as a laborer, as an agricultural laborer or basic daily laborer in Nairobi. So it's a significant income source. And also about 9% of this food is consumed by the household of the farmer. Okay, so how bad is contamination? About 45% of the kale that we sampled was contaminated above the Codex maximum allowable level with lead. The levels of cadmium and mercury, which we also tested for, were quite a bit lower. Okay. And we see that on the upward side of this distribution, we've got some samples that are an order of magnitude above the Codex limit. And the 90th percentile is about twice the Codex limit. So it's a significant amount of contamination. It's not off the charts, but there's quite a bit of lead there. So when we went into this work, it was actually meant to be a pilot study to inform an intervention. Okay, we wanted to figure out, okay, we figure kale is going to be contaminated because we know it's a high uptake crop of heavy metals, and we know there are lead sources in the Nairobi environment. So we wanted to go in and find what are some recommendations we could give to farmers instead, or we could give to consumers. So in addition to sampling kale, we sampled these other leafy greens, and we compared the contamination in the other leafy greens with kale. We had thought about testing other crops like tomatoes and beans, but when we talked to farmers and asked them, what could you substitute for kale? None of them wanted to substitute those crops because they don't have the nice quality of being able to continuously harvest. And so, we were looking for crops that were close economic substitutes, and the only ones that jumped out were these other leafy greens. Now, unfortunately, the other leafy greens are about twice as contaminated as the kale. So that is not a viable alternative. We also thought, well, maybe we can tell the government that we need to do something about people growing kale in the urban area. Maybe we should be encouraging consumers to purchase from markets outside of Nairobi, bring kale in from other growing environments, and maybe get the government to do something to actually stop the cultivation of this crop within the urban area. Unfortunately, when we sampled crops from local markets and we asked vendors, where did you grow this? They also were growing it outside of Nairobi, so we screened on that. Those crops are that kale is just as contaminated. So that's not a viable alternative either. So here I am committing this cardinal sin of offering a problem but no solution, and I'm sorry about that. But this is unfortunately what we found, and I think we need to find other solutions, which probably involve attacking the problem at the source. Okay, we wanted to understand as well how much of the contamination is getting into kids, right? So if there's a lot of kale, but kids aren't really eating so much of it, a lot of in-kale, but kids aren't eating it, then we wouldn't be so concerned. But the median daily consumption of children under 5 is about 21 grams per day. And for adults, it's almost triple that. And this is during weeks when the crop is consumed. But keep in mind that in 11 out of 12 months of the year, these households are harvesting and therefore likely also consuming these crops. So when we multiply that daily consumption by the level of contamination with lead and other heavy metals in the leafy greens as an aggregate, so we took the mean of kale and other leafy greens grown by the household, we find that 66% of under 5s are consuming from leafy greens alone more than the US FDA interim reference level for dietary exposure to lead. Okay, so that's most households getting too much lead from only one source. Other heavy metals, there's also some households above that reference level, but lead is by far the worst. Now you might think, okay, these are households that are growing leafy greens. Of course their consumption is high. How representative is this? So we compared our results for consumption against a few other sources. The Kenya Integrated Household Budget Survey is a nationally representative survey. And that survey shows that 74% of households in Kenya are consuming dark leafy greens over the past week. Within the Nairobi subsample of that survey, 87% are consuming. And that compares very closely to about 90% in our sample, who, given the 11 months of the year times the 99% consumption in a typical week, this is about the same. In the Kenya Demographic and Health Survey, we find that, or previous research has shown that 57% of women of childbearing age have consumed dark leafy greens in the past 24 hours. And 46% of caregivers fed this food to children between 6 and 24 months. Kale and leafy greens in general are considered a highly nutritious food, and they are promoted by a lot of nutrition interventions in Kenya and elsewhere. And this has worked. Kids are eating their greens. And this compares to about 60% of the households in our sample feeding them to their kids. In terms of daily consumption levels, a representative sample of kids from co-authors of ours in the same communities where we worked found the exact same median consumption level, slightly lower mean, sorry. And the GAIN survey estimated daily vegetable consumption at about twice what we found for greens only, which makes it, our levels are plausible. Where's this contamination coming from? It's not clear. There's not really a strong spatial pattern here. You see these red dots. These are the highest quartile, and they're all over the city, not only in the more industrial eastern area. Soil levels are really not that high. Water levels are not that high. And there's no clear line from soil or irrigation to contamination, so it's still a mystery. We suspect perhaps aerosol deposition. There's some evidence that that can be absorbed through leaves. So the next step in this research agenda is to actually do that forensic analysis and do some isotopic analysis of samples from these same farms in collaboration with Pure Earth, Columbia University Metal Lab, and KEFIS. So thanks so much for your attention, and I think I'm out.
Thank you so much. All right. Next, we will hear from Dr. Gordon Binkhurst, presenting on potential lead exposure from aluminum cooking pots in low and middle-income countries. Gordon is a senior technical advisor at Pure Earth. He comes to us with a PhD in geological sciences from the University of Connecticut. Gordon was instrumental in developing and implementing Pure Earth's 2022-2023 Rapid Market Survey, as well as spearheading the testing of over 100 aluminum pots and pans for leachable lead, which you will now hear about. Thanks, Gordon.
Thank you very much, Nida. The first slide. Oh, we're going the wrong way. Hang on. Okay, so today I'd like to present our results of leaching lead from aluminum pots and pans, which was done from 25 different countries. The results are summarized in a journal article, which is actually coming out in July 2025, coming to a newsstand near all of you, I am sure. It's also available online, luckily. The genesis for the leaching study that we did came from Pure Earth's Rapid Market Study, where we collected over 5,000 products in 25 lower middle-income countries, everything from cosmetics to toys to aluminum cookware, et cetera, et cetera. Included in those 5,000 items were over 500 metallic cookware items. And that's what we're going to be talking about today, and specifically the leaching of lead from some of those items. In terms of the over 500 cookware items, which again included things like plates, spoons, and pots and pans, we found some alarming levels of total lead in these cookware samples. I think we had a high of 10% lead in some of the samples. But again, these were plates, spoons, pots, and pans. And today, we're going to focus on aluminum pots and pans and not on the other cookware items. And so you may ask yourself, where does the lead come from in aluminum in the first place? Why are we concerned about it leaching into our food? And this work was from Wiedenhammer and Perry Gottesfield, who's here today, some 10, 12 years ago, who found that the feedstock for these aluminum cookware are things not like just Diet Coke cans, which would be nice, but aluminum engine blocks, radiators that are potentially soldered together with lead solder, cans with lead solder, and also used aluminum cookware. In addition to that, electronics. So everything goes into a big pot, and if it melts, it can be formed into aluminum pot or pan, specifically in lower middle-income countries. What do these pots and pans look like? This is just a brief example of pots from Indonesia, Bangladesh, and Ghana, just to put things in context. We tested all of the cookware items. It was actually 115 for the total study. And again, we found pretty high levels of total lead in the cookware samples. I think the highest was 16,000 in the pots and pans, and over 75% were above 100 parts per million, which you'll hear is a reference level we used in this study. Only 4 of them were above 10,000 parts per million. So total lead, big deal or no big deal? Hard to tell. It's a hazard versus risk question. And will it leach into your food is the bottom line question we tried to answer. In order to do that, you can't test for total lead with an XRF. You actually need to take the pots and pans and subject them to some leaching, which is what we did. So how you leach them is definitely a very important question, and what you get into the leachate, or ultimately your food, is a function of many different things. And we considered some of these factors in the early part of the study and came up with a standard leaching procedure for 100 pots and pans. So we'll get to that. So one of the questions we addressed, heated versus unheated. We heated, first we put 5% acetic acid in pots and let them sit there for not hours, but days. And then we also took a selected number of the pots and subjected them to heated leaching, where we boiled them for several hours, and again, measured lead concentrations in a time-stamped series throughout. And what we found was the heated leachate was 2 to 3 orders of magnitude higher than unheated room temperature leaching, even if it was left for days. And these are very high levels, of course, 10 being the drinking water standard, and finding levels of 200 to 20,000 is significantly above that. Replicability we also looked at, like can you take the same pot and leach it repeatedly and get the same results? It's an important research question and an interpretation question as well. And we found out that no, you can't. You leach the same pot over and over again. We did 7 pots 6 times. We found that the lead levels were quite variable as we went, generally decreasing. But sometimes they went up and sometimes they went down. Meanwhile, the aluminum concentrations, also extremely high, were way more consistent over time. And we'll get back to this later. We also found that old pots tended to leach old pots leach less lead proportionally than the new pots. We'll also get back to that. The addition of salt, common in cooking, we found that there was a marginal increase in leachable aluminum, but not an increase in leachable lead. It was a marginal decrease. So what we settled on was basically taking our 100 pots, filling them 80% with 4% acetic acid, boiling for 2 hours, and testing the leachate for total lead and aluminum. Okay, and what do we find? This is the summation of all 100 pots with total lead on the X, and on the Y-axis we have leachable lead. And there's a correlation, right? The higher total lead, we see generally higher leachable lead. But there's a lot of scatter here. And keeping in mind, this is also a log-log plot. It looks worse if it's not, okay? And you can see the R value, the correlation coefficient of less than 0.3, which is embarrassing, right? Now, would you expect anything better? I'll tell you no. But just to put things in perspective, for a pot with a total lead of 1,000, you could get anything from leachable lead from a few parts per million to a few hundred parts per million. That's not a great correlation, right? And we'll talk more about why. I want to draw your attention to this part of the graph, which indicates that of the 20 pots that had less than 100 parts per million total lead, we only found 1 that leached above a drinking water standard. So in terms of a threshold, that's where we come up with our 100 part per million value of total lead being a good threshold for what could be a significant source of lead. So getting back to the scatter and my correlation coefficient. First, the total lead that you're measuring is with an XRF. Generally, obviously, we tried to do it on the interior of the pot, but sometimes the pots were too small. We had to do the exterior where liquids are not in contact with. Some of the pots were very variable and heterogeneous in our XRF measurements, and we took a median value. So how well that represents is another question. And then, as you saw in the pictures, our 100 pots, they were all sizes and shapes, okay? And they ranged, I think there was a median of like 1.6 liters, but they were quite a range. And that, of course, alters the surface area to volume ratio in each pot. We didn't try to segregate that. And then also, these are supposed to be uncoated, untreated pots that we collected. Of course, we don't know the actual manufacturing techniques for all of the pots. What we did separate for, which I'll show you shortly, is cast versus wrought pots. Cast pots being molten aluminum poured in a mold and allowed to cool slowly. Very common manufacturing technique. And the other method is a wrought pot. It's a mechanical way. You form the aluminum into a sheet, you form it into a pot mechanically at cold temperatures, and that's a wrought pot. Now, if you separate the wrought pots and the cast pots, you start to see some dramatic differences, right? The wrought pots tended to leach less lead than the cast pots, which is an important finding. And you can see my correlation coefficient at least went up to something a little higher, which was nice. Okay, so there's this story here. Why? So we looked at some of these pots, the cross-section, using SEM and EDS, and we looked at cross-sections of the pots. And you can see the upper one is a cast pot, and the 2 lower ones are wrought pots, okay, from rolled aluminum. And first I'll show you the 2 bottom ones. The rolled aluminum has an actual structure. And you can see the light gray is the aluminum, and the dark gray is either lead or other like iron-bearing silicates, et cetera, other inclusions in it. And you can see that the wrought pots have an actual layering to them. And the cast pot is very different. Cast pot, the aluminum will crystallize first, and the lead will then crystallize later at a much lower temperature around the aluminum grain boundaries. Okay, and then you have the you have the acetic acid attacking the aluminum, and again, these are cross sections, and they're forming in very different patterns. And so the cast versus wrought, I think that this, particularly with the wrought, the layered nature of it does impact the amount of lead that can leach out at any given time. And as the aluminum dissolves, it does it in preferential pathways. Okay, the one on the bottom is an old pot where you can see that it's actually quite deep into the pot, and it does, again, follow preferential pathways. So there is a question of the accessibility of the lead to the leaching solution as the pots wear. Again, another close-up. This shows the lead inclusions at a much finer grain, also in a wrought pot. So what does all this mean in terms of blood lead levels, which we've talked a lot about? Okay, and we used, similarly to my colleagues yesterday, the EPA's AALM to model blood lead levels based on our leaching concentrations. Okay, and this is what this looks like. And it looks sort of like the graphs yesterday with one key difference. The greater effects were on older adults, okay, women of childbearing age, and the lesser impacts were to children. Okay? And children are definitely in the model and in real time, not just in the model, actually, the children absorb greater amounts of lead. But what we adjusted for was a dietary intake, that the children eat much less. Okay? And so that's why we see a much greater effect in the women of childbearing age. So there's a lot of limitations in what we did, especially with respect to the modeling. We're modeling this based on acetic acid, which is acidic. It's supposed to represent a tomato sauce. What it doesn't represent is rice cooked in the pot, cassava, other staple goods that forms the predominant diet of most people. So leaching with acetic acid, boiling it, is great to certify a pot is safe under most conditions, but it's probably very poor at estimating what actual exposure is based on actual dietary consumption. In summary, heating was really important to leaching, 2 to 3 orders of magnitude higher. This says 1 to 2, but that's a mistake. Our 100 part per million level for a significant contributor to leachable lead in the leachate, I think, is a good one. And generally, yes, higher pots with higher lead, total lead, tend to leach more. Cast pots leach more than the wrought pots, and new pots leach more than the old pots. Our replicate leaching was poor, but that's okay. And we also had poor correlation between how much aluminum versus how much lead leached. More leaching aluminum did not necessarily result in higher lead. Okay, and I think our SEM EDS work helped shed some light on the mechanical aspects of what's controlling the leaching and the environmental accessibility of lead. And our blood lead level monitoring is good. It is actually consistent with some of the work that Katie Fellows did, who's here today, which showed similar blood lead levels for Afghan refugees in Washington State. So, and again, finally, the boiled acetic acid is great for certifying cookware as safe, but may be poor for or overly aggressive with respect to actual exposure. And just to acknowledge all of my help that I had, I didn't collect or bring all these pots to me. And thanks to Lexon Geen, who's here, who helped with some of the early studies at Columbia, James Brown, certainly Open Philanthropy, who helped fund this, who's here also. So thank you very much.
Thanks so much, Gordon. Next, we'd like to welcome Dr. Argal Ambalou, a professor of environmental health at Addis Ababa University. Dr. Ambalou has his PhD in applied biological sciences and environmental sanitation from Ghent University, as well as a degree in environmental health. And Dr. Amblu has longstanding experience coordinating nationwide WASH intervention, water quality assessment in collaboration with PSI, Ethiopia, the Water Institute at UNC, Swiss Church Aid, and other organizations. Thank you so much. And Dr. Amblu will be presenting on lead contamination and risk level in Ethiopia. Thanks.
Thank you so much, Naida. Good morning again. I'm Argao. I will be taking through some of the studies we have been doing since 2012. So I will highlight you the background, the problem related to lead, and some of our findings, and recently our efforts, what have been being done, and also the challenge. Lead contamination in Ethiopia is very alarming. Mainly, nearly 20 million children are at risk. The contamination sources are like any other developing countries, informal recyclers, ingot production, maintenance shops, specifically the garages, cookwares. They are mainly used, which are produced domestically, and they use lead for making some of the pots, the dippers, and related materials. And the wastewater is another big problem, because the local smelters, they pour the acid into a ditch or into septic tank, and it discharges into the agricultural field. And the water, which we have been working a lot since then. And the wastewater dump, the electronic waste dumping, there is no sorting. Sorting is hardly done, and unfortunately. So they are leached into the groundwater. There are several studies that we are currently conducting, specifically what amount of lead is being migrating into the groundwater, which is not yet. And paints, I think Dr. Taddese is here, and in paints in Ethiopia, it has been a big problem, but his organization, Taddese, has made a lot, and in fact, still they couldn't bring down into the compliance level, but a lot of efforts, still a major problem. So some of our studies, our first lead-related study was with garage workers. We used the garage workers and non-garage workers, and mainly, in fact, all had higher blood lead level, even the controls. We used students as a control who were not exposed for garage activities. And the major risk factors we identified were longer stay in the workplace was a problem, and eating and drinking in the work area, and uncontrolled environment, specifically related to hygiene was a problem. The other study we conducted was the construction workers. So the construction workers, still we used students as a control, and we examined their blood, and construction workers had around 40 microgram per deciliter, and even non-construction workers had elevated blood levels than the recommended one, which the average is nearly 30. Female construction workers showed higher level of blood lead. And the other study, this is with water. We used Jimma town, one of the oldest city in Ethiopia, and we divide into 4 quadrants. The first quadrant is partially populated and relatively new settlements. The second quadrant is in the down side of the watershed of Jimma, and the third and fourth quadrant, they are old cities. and mainly many garage shops, and also taxi stations and bus stations are located there, and which is a busy traffic area. So except water, high concentration of lead in water was obtained in shown in quadrant 3 and 4, but the same was in air. But when you come to soil, the second quadrant had also very elevated lead concentration, which might be due to erosion. When the flood is coming in the downstream, it may accumulate wastes that contain lead. And we predicted the risk, and the children were highly exposed in the 3 quadrants. Mainly the second quadrant was obtained from, maybe obtained from soil, and the other is air and water. This is a recent study in Addis Ababa. So we randomly collect water samples from 88 private taps. After the first flush, 1 to 2 minutes flush off, the water was analyzed for lead concentration, and over half of the samples had greater than 10 microgram per liter. Then we predicted the risk level using non-cancer risk and health hazard quotient. With cancer risk, and children still showed a high level of risk. And we want to estimate the population at risk, specifically children, and we used the WHO threshold level and the CDC threshold level. The first scenario was if children are exposed only for water, and the second scenario is when children are exposed only for, exposed for the 3 sources: air, water, and soil. And in the first scenario, about 37% of the children are exposed, will have elevated blood level, and in the cumulative risk, about 60% of children will have elevated blood level than the recommended. So when you come to the recent efforts, here I would like to appreciate Jonathan Dury. I hope many of you know him. He has been working a lot for the last 1 year, and he established, together with Taddasa and also Barakat Tasfai from GIZ, and I became a member of that task force, and this task force was established and working what has to be done in the coming times. And in that short time, Jonathan were very successful to make, to bring lead as a major problem in Ethiopia, and the policymakers signed an agreement to tackle this problem. The Minister of Health and EPA, the General Director for Environmental Protection Authority. So the challenges are analytical problems. Specifically, if I wanted to conduct a national survey, the analytical capability, the laboratory capability is very tight and a bottleneck, and lack of attention by key stakeholders is still a problem. Like my colleague who was presenting, those pots, they are really luxury pots for majority of us. And domestically, and also without any quality control, importing is rampant. So it is not in the table of decisive policymakers. And policy implementation gaps, said shortage of funding, is a critical problem. And this all, thank you so much.
Thank you so much, Dr. Amblou. All right, I will get us going with a couple of questions, or a question for each of you, and then we will turn it over to what I hope will be good questions from the crowd. Vivian, recognizing that there's the issue of a substitution, a good alternative. However, if there were a good alternative, do you have examples from other food sources where you've been successfully able to affect the behavior of consumers, where they switch from, through education, risk, communication, from one kind of known contaminated source to another? How hard is that to do? Again, recognizing that you would need a compelling alternative to the leafy greens you've identified, but maybe what models do you have there to share?
Sure. So I will say that we can at least tell people to avoid the indigenous greens. Yep. Right? So kale is not great, but amaranth is worse. And there's a lot of people actually promoting these indigenous greens as even more nutritious than the typically consumed kale and other brassicas. So yes, we do actually have some nice examples of work that we've done at IFPRI testing the impact of information on consumer choice when it comes to food safety. And we went door to door and told people about the contamination risks of maize flour with aflatoxin, which is a fungal contaminant. It's pretty prevalent in Kenya. And we got about a 40% reduction, 40% increase in the proportion of households that were eating a safer version of maize flour compared to the sort of informally milled maize flour that was the most contaminated. So if you give people that basic information, this is worse than this, a lot of them will actually respond to that, which is, I think, really encouraging when we do have alternatives.
Great, thank you. Gordon, thanks. You've talked about kind of the difference between wrought and cast, but maybe you could say a little bit more about the smelting process, and if you have any models, again, I'm focused on solutions here, where you've been able to, A, determine a safer smelting process that's protective from absorption and leachate, and then what would it take to incentivize those who are doing the smelting to adopt that practice?
It's unfortunately a difficult question that you ask, and it's similar to all of the lead sources we deal with, and particularly I liken it to labs. You know, like we would like to have aluminum pots and pans formed in formal manufacturing settings where they do have the capacity to refine the aluminum to be lead-free. Unfortunately, in many parts of the world, as we well know, it's way more artisanal in nature, and there's literally no controls on what goes into the pot, literally. So I think it's location specific. You know, Peru always comes to my mind, and they don't smelt aluminum. They import aluminum sheets from China. So that's one supply chain model, and then you have others. So yes, I think to promote the formation of pots and pans in a more formal setting is probably our best bet, unfortunately. To get the lead out of the aluminum melt, there are ways, but they're technologically and logistically not easy.
Understood. Challenging. Argal, thanks so much. So you've identified kind of the challenges. Your last slide were a whole host of challenges and identified barriers. And you noted the progress that's great in terms of mobilizing political will to start to address these. What would you advise in terms of kind of the mounting a coordinated response? And how would you advise your colleagues in country to kind of prioritize how to get going, knowing what you know about the sources or even where you have research gaps?
Yeah, thank you so much, Naida. Mainly, I think it's very important to bring back this task force. Now this task force is not working. So identifying major policy challenges, including this supply chain, is critically important. And you know, the water pipe systems, they are not monitored, they are not controlled. The quality is not evaluated. And so I think the presence of this task force will help to enforce the policy and regulatory offices body to impact the quality. The other is, I think it needs a national, there is no a national representative data. So now we are just correlating lead from air, soil, and water, but we need to know what amount of blood lead is contributing from water. So national survey in blood lead level, it's hardly assessed. Only if you ask him is a number of samples for blood, I think they are 50-50, 30 samples. So they are very small because of the cost, and national survey is critically important. And bringing the informal sectors. Yesterday, there was a very interesting presentation which directs, if you elevate tax exemptions and subsidies, the informal ones will come into the formal so that they will be available for regulation and control.
Great, thank you. All right, we will turn to the audience here, and I see some hands. Is someone, okay, maybe I'll do what others did and face this way first. So we have one here, yep, thank you. And then let's see, Yi maybe, and then Tadesse, we'll do those three to start with.
Good morning. My name is Zaya Craigie from the US EPA. For the Kenya study, I was wondering if you had any samples or information about the soil chemistry or the opportunity to add more organic matter, or even potassium as an intervention.
All right, we'll just hold for, what did we say, maybe in the Yi in the yellow.
E from Vital Strategies. I have a question for Vivian. I see you had geographic distribution of where the lead is high, but have you compared whether there's any other difference between your half of kale that had exceeded level versus the lower level? Whether you have seen a variation if you harvest them or collect them from one single farm, or is that not what have done? I think the isotopic will be really interesting. And then one question to bridge your work with Gordon is that what happens when we have a lead contaminated kale that is cooked in a contaminated cookware? What does that mean for the children that live in Ethiopia or Kenya in that case?
Right, maybe one, yeah, if you can remember these, one more from Tadesse, and over here, yes.
Hello, Tadesse again from Pan Ethiopia. Thank you all the presenters. Starting from yesterday's presentation today, a little bit, one thing is highlighted, which is in my heart, that's a political will. Whatever research we do, whatever innovation we bring, if there is no political will, we are nowhere. We cannot solve the problems. I can just highlight three things. This political will is global, regional, and it comes to national level as well. If I start from the global one, two issues. The first one is the Global Alliance to Eliminate Lead in Paint, which was led by US EPA, Angela here. We have now around 70 countries having regulations in the world, in low and middle income countries. That's a very big commitment from USEPA, which really helped many countries, including Ethiopia, and we have a very stringent regulation. The other thing that Argao mentioned, the political will that came last year from USAID initiated a very big movement globally. And I have been working on lead for the last 13 years. I tried to bring Ministry of Health and Ministry of Environment on one table on chemicals and waste issues. They cannot come together. But after the intervention of USAID, last year we brought Ministry of Health and Ministry of Environment on the same table to sign a memorandum of understanding on lead, not even bigger. That can be a basis for other chemicals and waste issues. So when we are doing our research and our work, please let's emphasize also on political will harvesting and also strengthening like working groups and task forces like we established in Ethiopia. Thank you.
Right. Thanks. So you want to start off, Vivian, with a couple for you? Yeah.
Sure. So unfortunately, we do not have other soil chemistry information, but this is a gap that we can fix next time we go back. So thank you for the question, and we will have a chance to collect more information and look at how that then correlates to contamination in the crops. In terms of intra-farm variability, we just pooled the sample from the farm, so we can't answer that question either. This was really a pilot study. But again, a great idea for future research, so thank you.
Now the kale goes into the pot. What happened?
So I think there's increasing focus on lead in food to begin with before it ever gets to the pot. And I think that's a really, really important part of the story. Of course, we could add lead by cooking it in the aluminum pot or not. So we don't really know, but I do think there needs to be a lot more focus on raw foods, and we did it at Pure Earth start to do side-by-side cooking of foods and different types of foods and curries in a stainless steel pot and in an aluminum pot. And the results were not exactly revealing, but it sort of goes to that same aim is like you have to account for the natural lead that's in the food in the first place, and you can't test every ingredient, so we just tried to do side-by-side cooking in a lead-free pot.
Thanks. Anything else on the political will aspect that Tadesse raised?
I think Tadesse has explained it very well. In the political will, it's critically important, when USAID was moving and going to fund lead prevention strategies and efforts, the government themselves, they started to act on it. So I think it needs some sort of coordination at different levels. Mainly, even if there is a political will is there, it needs evidence. So they need to see what is evidence, what does what, and this is critically important. And evidence generation, along with working with the political will, is critically important.
We have some opportunity to continue the momentum with a UNICEF-led partnership for a lead-free future. So let's look into that. All right, okay, back there, our colleague from South Africa, and then the man in front of you, and then woman in green there, thank you. And if we have time, we'll get you.
Thank you very much. My name is Senia Namo, an associate professor of economics at the University of South Africa. Vivian, your presentation triggered something in my mind. There is a practice called geophagia, where women, pregnant women, have a craving for soil. So there is direct ingestion of soil. And when you look at the prevalence in most African countries, it's as high as 50%. And so for me, there's need to really look into that. There are even markets for this soil, the clay, that people actually buy and ingest directly. So we're not talking about now the kale, we're not talking about the cooking, but direct consumption of the soil. And I think there is a research gap there that we need to explore. Thank you.
Thanks, Will Seitz from the World Bank. I was curious about sort of the differences in how cooking is actually done. So, if I understood the method that you were describing well, it's mostly sort of boiling water with some leachate sort of testing. But in the case of that, there's somebody who's using a wok for frying, for instance, and kind of scraping the metal. I mean, do we have a sense of what the difference would be for different types of cooking? If you've looked at that, I'd be really curious. And then maybe just one other quick question was, I mean, you mentioned that you selected the pots and pans to not have coating on them. And I was curious, I mean, if there's any evidence that coatings could be protective, so that, could that be maybe one option of trying to address this by sort of keeping the food separate from the base material? Thank you.
Thank you. I'm Sofia Chavez from Mexico, CASASEM, an NGO. I just wanted to continue on the topic you brought up about political will. And it's not only putting laws in place, but surveillance of those laws. and we can get lost. If we get the law in place, but there's no surveillance, it's the same thing. So at least in my country, we've been working for 10 years to have political will. And once we get it, then we have to continue with surveillance. I just wanted to bring that up. Thank you.
Thanks so much. All right. Some of those, I think, were, if you want to comment on any of the comments made or the questions, I think, Gordon, you had the most specific question there.
I did. So I appreciate your question. It's an excellent follow-up. As I mentioned, like boiling acetic acid is a very conservative way. People don't necessarily cook for 2 hours. People don't often cook something that is acidic as 4% acetic acid. So again, very conservative. And the next bit of research we're doing is evaluating different cooking times, different pH levels in what they're cooking, and ultimately to do it with actual foods. But we're at least going to do pHs that are representative in cooking times. So yes, it's a very valid question. And then with respect to coatings, yes. It's, again, very hard to get the lead out of the aluminum, but to coat something by anodizing it or not Teflon anymore, ceramics should be. It's not, maybe not a permanent solution as those coatings wear away, but it would be an improvement upon just the raw aluminum.
Right. I think we probably should wrap up unless there's a burning brief one. Did we have a burning brief one? Okay, you can find them out there by the posters. All right, thank you.
For the panel. All right. So we are breaking now for an hour and 15 minutes, but it's not totally a break because this is our poster session. So you will have noticed there are wonderful research posters around the periphery. We ask that you get some lunch, take a stroll, check out all the excellent research being done. If you are presenting a research poster, we ask that you get your lunch and go stand by your poster so you can talk to the people who come in. So that will be great. We'll reconvene here at 1 p.m. As a reminder, please take your trash out with you. And if you are on the panel before 1 p.m., please meet in back here about 15 minutes before the panel to get mic'd up. Thanks, everyone. All right, hello everybody. Welcome back from lunch and from some very interesting poster presentations. If you can please come and take your seats so we can get the next panel started. So we actually have right now a double header of panels. We'll have 2 back-to-back without a break in between. So get ready for quite a lot of research coming your way. So if you do at some point need to get a drink of water, use the restroom, feel free to let yourself out and do so. But we will not have a break for the next, after this session. So we'll be sitting here a little bit longer than normal. So please do prepare yourselves for that. So first up, we have a session on understanding supply chains and incentives. So why does lead end up in all these products and systems, and what can be done about it? We have a number of great speakers here, but I'd like to first introduce our moderator, Will Fitzgibbon, who is a senior reporter and the Global Partnership Coordinator for The Examination. He previously worked as a reporter with the International Consortium of Investigative Journalists, where he played key roles in award-winning investigations, including the Panama Papers, Pandora Papers, FinCEN Files, and Shadow Diplomats. As ICIJ's Africa and Middle East Partnerships Coordinator, he trained and led the largest Pan-African investigations in recent history. And if you've been following his work in lead, he's had truly excellent investigations going into great depth on some of the drivers of exposure. Will's a French speaker, trained as a classical musician and lawyer in Australia, and is a certified anti-money laundering specialist. That's quite a resume. Anyway, Will, please join us on stage.
Hello, everyone. It's an honor to be here. I am an investigative journalist, as you just heard, and I'm very happy to have been moving my experience from chasing after the bad guys who hide their money in secret tax havens to looking into the corporations and potentially other bad guys and bad women who are poisoning us. The Examination is a fairly new non-profit investigative news outlet that focuses on corporate-driven public health harms, and lead has been my focus for a few years now. I've spoken to a number of you in the room. I'll probably try and bother you at all, the rest of you at some stage. So thank you for all your calls and responses to my emails over the years and in the years to come. The first speaker we have today on this very important panel is Sofia Chavez Arce, who is the founder and general manager of CASASEM in Mexico. CASASEM began many years ago as an organization focused on electronic waste, but has expanded into one of the most globally recognized, and certainly within the Latin American region, incredibly important organizations looking at toxics. CASASEM is rooted in community, linking local research to national policy laws. It's an organization I know, in speaking to Sofia, that is committed to working with local actors and to giving voice and power to the incredible, talented group of researchers who work in Mexico and in the region. Sofia has years and years of board experience. CASASEM has been involved with IPEN for many years, and Sofia herself has been a representative and worked with IPEN in many global summits. So we're happy to have her today. Sofia today speaking about her most recent report that she will now present to us. So thank you, Sofia.
Hello, everybody. Let me see if I know how this works. There. Okay. This is us. We are CASASEM, and we are an NGO. We're not in a university. We work in the field. That's our conflict of interest statement. I'll just skip that. And I just want us to start saying that we've been working on lead for 10 years now. These are the reports we've been working on. We started working on e-waste, like Will said, and then we moved into paints. But then we moved into batteries, and then we moved into ceramics. And then we found out that everything was kind of connected. So these are all the things that we've been working on, and this is our last report. And the previous one, Mexican toxicity, is the one that I will be talking about today. We published that in the second half of last year. So there it is. It's the supply chain of lead compounds for the pottery, plastic, and paint industries in Mexico. So we have a lead crisis in Mexico, like Bangladesh, maybe. Lead poisoning has been identified as a pervasive problem in Mexico. We don't have leaded gasoline anymore, but we still have a lot of lead contamination. We had the National Health and Nutrition Survey, which estimated that 17.4% of the population between 1 to 4 years of age has lead poisoning. And if we move it to 1 to 14 years of age, then we have 3.5 million kids contaminated with lead. So, as I said, although the country eliminated leaded gasoline since a long time ago, we still have a lot of sources. And many studies have noted the widespread lead poisoning coming from glazed pottery, which is a special problem we have in Mexico. But few studies have adequately evaluated the contribution of other consumer products. So the next one. So why this is an important report? We wanted to take a fresh view of the problems. We've been addressing the problem for 10 years, and we have seen not much change in our country. We know the sources, we know where they are, but especially working on lead, despite 20 years of government work on lead in glaze for pottery, not much has been achieved. We lack comprehensive regulations like many countries, but the objective of this report was to look for solutions from a new perspective, as I just said. We were looking for the sources. We wanted to know where the lead oxide and lead chromates were coming from. So maybe with that perspective and having that information, we would be able to address it properly. So these are some of our findings. We have a persistence of lead use in traditional pottery. We did field work. Out of the 48 workshops we visited, only 14% have stopped using lead glaze after 20 years of persistent work. We have high levels of lead. More than half of the glaze samples collected from workshops and vendors had an average lead concentration of up to 35% of lead. And the highest one was 93% of lead in weight. So that is a big problem. The supply of lead oxide is complex. The potters we talked to were reluctant to say where they were being sourced, where the sources came from. And this picture that you can see here, this is a shop we visited, and this is litharge, lead oxide. And they have no sign whatsoever where it comes from. Nothing, not a hazardous label, nothing. And this is, anybody can come and buy one of these. So what we found was, this is the end of our investigation. We found the sources, and we have 3 graphs. The first one is for potters. Now, after interviewing potters, making a lot of phone calls, doing research in internet, we were able to know where these sources are. And what we found is that the beginning of the story is batteries. And from there, we moved into the recyclers. We have formal and informal recyclers, and then oxidizers. You find at the middle of the page, there's Phenox, which is a German-based company that oxidizes lead. And we found a direct relationship between Phenox and Acinsa oxidos who sell to potters. So our idea is that being able to know where these people are, we might be addressing not the end use of the lead, but before looking at the sources of lead. So we could maybe do work on legislation to work on the sources of these metals. So this we did for potters, and then we also worked on the sources for paints. This is lead oxide for paints and plastics. And then this last one we did for lead chromates. And this is the one that we know for sure it's perfect. We find 4 companies, 3 of them who come from abroad, and they have local distributors. B Brands and DCL Pigments are now owned by private equity companies in the States. Dynachrome is a local company, and they service Latin America. They are big players in Latin America. And then we have Bipul Organics, which imports from India. So we know for sure that this is right. So our thinking is it better to tackle 4 companies, or is it better to tackle every single paint company? Or how can we do to tackle both? We know there are lead-free alternatives for the 3 markets, for sure. Mexican government has put a lot of emphasis on developing low-temperature glazes, which are lead-free for the Mexican market. So we have them now. Okay, so the conclusion is what we say that should be done is that we should ban the production, import, and export of lead chromates. There is not another use for lead chromates, and we know who the players are. So we think it's much easier to tackle them than to tackle all the paint companies. About the lead oxides, that's another story. I would say the first one is the lowest hanging fruit, but the second one is much more complex. So what we propose is to restrict the sale of lead oxides to the markets we approve for lead oxide use, like battery manufacturing, but not for potters. We still have to understand the informal recycling, battery recycling, and the informal oxidizing. We still need to work on that a little closer. But we need, for sure, a regulatory framework which is enforced. For sure, that's what we need too. So this is it. This is a report you can download if you want. This is a comprehensive report. It's a big report. So any questions, I'll be around. Thank you.
Thank you, Sophia. I still remember when I first received a copy of that report shortly after it came out. And as an investigative reporter, I thought, finally, thank goodness, someone has done the hard job of naming companies that are involved in this. We can finally write to Mr. or Mrs. CEO and say, what is happening here? What are you doing? So I know it was hard work, and I look forward to hearing a bit more about how that went. Up next, we have Usman Anwar, also known here perhaps as the man with the most fascinating tales of what working in a Pakistani spice market is like. Usman is a PhD candidate in operations management from Lahore University of Management Sciences in Pakistan. His research interests include the responsible management with a focus on lead exposure elimination and sustainability, as well as climate change. His current research and focus of his presentation today will be on lead exposure due to turmeric and lead chromate. So welcome. Thank you.
Thank you, Will, and thanks, Team CGD, for bringing us all together. I'll be presenting, as Will mentioned, I'll be presenting the turmeric lead chromate adulteration in Pakistan and trying to explain why all that glitters is not turmeric, it could be lead chromate. Most of the people here know about turmeric lead chromate adulteration, especially from Bangladesh, but for those people who are not familiar with it, I'll just quickly explain the turmeric value chain processes. First, it is harvested as a tuber root, which can be consumed fresh. But generally, it is processed by boiling and drying. And it reduces, from boiling to drying, it reduces to about 20% of its weight, 1/5. And it is then polished to peel off the skin of the turmeric, and it further reduces the weight of turmeric, but it brings out the bright yellow color that we see on the fourth picture of the slide after polishing. And it is then ground to powder for consumption. It can be transported in all these forms except when it is boiled. So what happens is, as we can see on the Bangladesh-related literature, that to add more color, if the processing is not done correctly, the color of the turmeric roots is usually dull. It is it does not look very fresh. So lead chromate, a bright yellow pigment, is added. And while Jenna, our collaborator, the co-author, she has done a wonderful job in Bangladesh. There are some other countries in South Asia which have the same issue, including Pakistan. So we focused on understanding the two value chains, the turmeric and the lead chromate value chain, and trying to understand how they intersect, how do they overlap, when, where, and how. Who does that? So obviously, from that, we want to understand the incentives of the key stakeholders in these value chains, which lead to this turmeric lead chromate adulteration. Our methods are diverse. We focus on interviews and observations of the key actors in both these value chains. And we collect samples of turmeric and lead chromate from different cities of Pakistan. I'll explain this methodology with the map of Pakistan. It has 4 provinces mainly: Punjab, Sindh, Balochistan, and Khyber Pakhtunkhwa. The purple is Gilgit-Baltistan and Azad Kashmir. We did not work there. But the other 4 provinces, we identified 2 main turmeric-producing regions, Kasur in Punjab and Bannu in Khyber Pakhtunkhwa. And we further identified 10 most populous cities of Pakistan. And these happen to be the most important markets of trading turmeric throughout the country. So what we did was we interviewed key stakeholders in both these value chains. As you can see in turmeric, we focus from farm to the consumer and all the actors in between, all the processors, the middlemen, the market representatives, and also the regulatory authorities, like the food authorities in Punjab and Sindh and other provinces. For lead chromate, we focused on the producers, paint makers or paint mixers, you can say, and sellers of lead chromate. Later, we also interviewed the importers of chemicals and specifically lead chromate. We conducted 2 rounds of systematic turmeric sampling, one post-harvest and the other one pre-harvest. So post-harvest was around April to May 2024, and in December 2024, we did the pre-harvest. It is usually harvested from January to February. We collected over 450 turmeric samples and tested it by XRF for lead and chromium. We also got lead chromate pigment samples from Karachi and Lahore. These are some pictures from our fieldwork. You can see the drying and polishing happening in the fields, and some pictures from the market. These are the pictures from of our samples. The top layer is of turmeric. The middle bottom layer is, and the middle bottom picture is of lead chromate pigments. And you can see the display of XRF and the testing of it. I'll quickly move to the results because that is the meat of it. For sampling, we found that high lead levels, high lead concentrations are found in all provinces except Punjab for both the turmeric samples. And the highest lead level concentration was found in Karachi, which is in Sindh. It is 11,550 ppm in our turmeric root sample. And lead levels were mostly higher in turmeric roots, as well as they were more frequent in turmeric roots as compared to turmeric powder. That is an important finding. we correlated it with the data we got from the interviews and observations. So we got to understand that it is mainly the color of the root and type of the root that people need to cover it with lead chromate. So there is a mother root, which is basically the seed of turmeric, and it is usually dull in color. So that is a wastage for a typical value chain. But some actors use it by coloring it with the lead chromate. Then the main sources of turmeric, this is quick. Kasur and Bannu, we knew. We kind of mapped the flow of local turmeric and also the flow of imported turmeric, because it is imported from Karachi and it flows northwards. It does not mean that all the importers or exporters are situated in Karachi. There are very large actors, importers and exporters, who are situated in Punjab, Lahore, and Faisalabad. Sources of lead chromate, that is very important. We found three main sources import from Germany, China, and India. Germany being the best quality and the most expensive. And there were other local sources of lead chromate, which is formal production and informal production. And for informal production, sourced their lead from the lead acid battery recycling. And that is something which again links to the U labs, which are the main theme of the conference, which have become the main theme of the conference. Important finding is that it is easily available in all markets. Anybody can go. It is accessible for anybody. You do not need to explain any purpose of why you're going to buy turmeric samples, lead chromate from the market. So there are no requirements or barriers for any buyers. Drivers of adulteration and role of food authorities, synthesizing all the data, and this is what we get. It is because of poor processing. If boiling and drying are not done properly, polishing is not done properly, you will need to cover it with lead chromate. And if you use the mother roots to sell as turmeric, you will need to cover it with lead chromate. And there are buyers who are non-expert buyers. They are not aware of which quality of turmeric is good. And this is an important finding, because when you communicate to the consumers that turmeric has lead chromate in it, it is a common perception that they will stop buying powder, turmeric powder, and go for the turmeric root. And when they go for the turmeric root and they want to judge the quality, they would want the bright yellow color. And that bright yellow color, they get it for purity, but when in fact they find that it is adulterated with lead chromate. So this is an important finding. There are loose regulations. The regulatory authorities are not very active, and the market actors know that. This needs to be improved. Punjab Food Authority in Punjab took the issue seriously, and that is why we saw that in both the turmeric sampling, we did not find much lead in turmeric samples from Punjab. So they raided the shops. They developed, most importantly, they developed a testing tool to detect lead. And that tool basically led for the litigation purposes. Obviously the actors knew that they would be litigated after this tool, so it kind of stopped the adulteration. And they also conducted the trainings with all the market representatives, market traders. Recommendations going forward, there are a lot, but we have summarized it in just 3 points. Turmeric lead chromate adulteration is still a major issue in 3 provinces of Pakistan, where there is weak regulation, there are awareness issues, there are consumption patterns different from Punjab, and it will affect 100 million people. Policy enforcement, monitoring, surveillance, consumer awareness, as well as the market people awareness, that is very important. That needs to be done. Successful efforts in Bangladesh, Georgia, and very, you can say, local effort that is in Punjab can serve as a role model. So this is from my side. Looking forward to the questions. Thank you.
Thanks very much, Usman. Now, as a journalist, I'm obliged to say my maths is probably terrible, but I do think we're going to need another chair up here, given the number of speakers. And I could almost see thought bubbles above all of your heads then, thinking, where's that turmeric in my kitchen cabinet? So a lot to think about. Up next, we have Amrita Kundu. Amrita is an assistant professor of operations and analytics at the McDonough School of Business. She knows this part of DC very well, used to work at the World Bank, so if you have any questions about where to get a good coffee, I'm sure she can assist. But for today, and in general, her expertise is focusing on circular supply chains, business model innovations, technology adoptions for small firms, especially in emerging markets. Amrita has worked with large companies, small corporations, governments, businesses, obviously, and policymakers to develop, design, and implement all kinds of important solutions with a view to improving environmental sustainability. So we're lucky to have Amrita speak to us now. Thank you.
Thank you so much, Will. Hello, everybody. So seems like all roads are taking us to lead-acid batteries, and so that's what I'll be talking about, the supply chain of lead-acid batteries in Bangladesh, specifically the electric three-wheelers. And within the very complex supply chains, there's so many players that we've been studying. The one that I'll focus today is the retailers. Honestly speaking, that's because it's kind of the easier one to study than many others in this supply chain. But they do play a very important role in allowing for poor quality batteries in this market. And also, they are the ones who collect back batteries and then send it for informal recycling. They send it to the informal scrappers. So that's their important role in the supply chain. These are the electric vehicles that I'm talking about, not the Teslas. These are electric three-wheelers. Millions of them are operating all across South Asia, including Bangladesh. These vehicles, almost all of them, are running on lead-acid batteries. Each vehicle has 125 kilos of lead in the 5 batteries that they run in. So large amount of lead that goes into these, the batteries that power these vehicles. The batteries have really short life. What that means is that they're recycled really frequently. Large industry for the local battery manufacturers in Bangladesh. This is a picture of me just kind of observing the 5 lead-acid batteries that would go into one vehicle. You can see how large it is, so that's majority of it is lead in it. Once it's used, it becomes ULAB or used lead-acid batteries, and in Bangladesh, 77% of the used lead-acid batteries are coming from this large electric three-wheeler segment. These batteries then go into recycling, typically informal recycling, as Rani also pointed out. You can see scrappers, they're kind of separating out the battery parts that go into the recycling. You can see the pits on top, that's completely illegal, just kind of a pit in the ground. The one below is, I call it environmentally irresponsible. They have some accreditation in that, like they have some papers to show that they're formal, but really how they're operating is very poor. Here's an estimate, 10 to 20% of lead emitted from these facilities. Who knows? More research is needed to really quantify what's the amount of lead that's emitted. But needless to say, causing a lot of lead emissions. Now, once these batteries are recycled, it's a circular economy, so they go back to the manufacturer, and the manufacturer manufactures the new batteries, goes back into the electric three-wheelers. One thing I wanted to point out, I know we've been talking about a lot of the batteries from vehicles, but also another segment which is producing a lot of used batteries is the solar home systems. And so essentially, the renewable energy technologies that we're using as a tool to fight climate change is also causing toxic lead pollution. So how to tackle lead poisoning? Well, simple, right? Like we improve the reverse supply chain. We formalize the collection, formalize the smelting. And by formalizing it, we can make it more efficient. We reduce the emissions per smelt in the formal facilities. But obviously, much more difficult to actually implement the solution and have the governments form the right policies, but also have the right way to monitor whether the policy is being implemented. We are doing some work in this space, but it's extremely hard and very complex and opaque in Bangladesh. So an easier solution, we thought, is, well, can we look at the forward supply chain? That is, can we look at the batteries that are in the market, and can we make better quality batteries available in this market? Now, if you think about it, if you have a battery that lasts twice as long, it's being recycled half the times, right? And so the amount of lead emissions you have is halved by just using a battery that lasts twice as long. Quick observations about this market and why we study the retailers. Battery life very short. We observed the batteries in about 200 vehicles and saw that almost all of the batteries are replaced within 18 months. The price of the batteries is really high. Here I'm quoting the net price, which is the price that you pay when you buy a new battery and trade in your used battery, and everybody is trading in their used batteries. So that's $350 for one vehicle that lasts about a year. And we're talking about really poor consumers. Here, the daily fare from driving these vehicles is $13. So the really economically vulnerable segment is paying a really high price for the batteries that's not lasting very long, and then the population is suffering because of the lead pollution coming from recycling. This is an example of how the batteries are made often, unbranded, informal battery manufacturers kind of assembling the batteries by hand. Rampant tax evasion. These vehicles are unlicensed. There's no battery standards and labels in the market. We tested the quality of the batteries using handheld battery testers to look at the internal resistance of the batteries, and we found a high dispersion in the quality of the batteries even within a brand. We found counterfeits, so here are 4 variants of the same brand, and this brand is called Power Plus. Used to come from China, now it's all manufactured locally. Now, manufacturers can make better batteries. It's very simple to make better batteries. In fact, it's also quite cost-effective to double the life of a battery with known technology. About 15% increase in the production cost can result in a battery that lasts twice as long. Batteries that were imported from China used to last that long, but and these companies are producing these batteries but exporting out of Bangladesh. Informality and misinformation in this market is really high, and that's why the manufacturers say that they cannot be selling their higher quality batteries in this market. So a classic lemons market, which is common in developing countries and in informal markets, is what we see in this battery market. Now, this retailer, they're selling the new batteries, buying back the used batteries. Clearly, they're selling multiple brands of batteries, and because they're buying back the batteries, they can observe how long the batteries are lasting, right? So they can direct the customers to the better quality batteries that may be lasting longer. And that's what the literature would suggest, that retailers can play this certification role where they want to build their own reputation. They want to increase their future sales, and so they will provide that information to the customers. So what we did is we observed how they're actually behaving. We conduct sort of an investigative audit study where we made mystery shopping visits, 1,122 undercover visits to 261 retailers in Bangladesh, where we trained our enumerators to pose as 5 different types of customers. So each of these 5 different types of customers would visit the same retailer, so the owner of the retail shop, ask the same set of questions: which is the longest lasting brand of battery, what's the life of specific battery brands, the price of the new battery, and the trade-in price of the used battery. And then we also surveyed the retailers and got some information about the incentives that they get from manufacturers. These are the 5 different types of customers that visited each of these retail shops. You'll see 2 of them are wealthy, 3 of them are poor. Wealthy customers are the lessors, that is, they own the vehicle, but they don't drive it. They hire someone to drive the vehicle, and then the owner drivers are the ones who drive it themselves. And each of them had the scripts that explained what their character type is, very similar scripts across the 5 customer types, and the poor customers explicitly mentioned that they are poor, they're budget constrained. The 3 hypotheses that we wanted to test, simple. When a customer comes and asks for the longest lasting brand of battery, a retailer gives the same information to the 5 customers who come to them. For the same brand of battery, the retailer gives the same information of how long that battery is going to last, and retailers might give a higher price to the wealthy customers from the price discrimination literature. What we find, retailers are not giving consistent information on which is the longest lasting brand of battery. Across, this is a frequency plot showing the frequency with which the different brands were recommended as the longest lasting. We found 190 different brands being recommended as the longest lasting brand of battery. Well, not surprising that the retailers are essentially promoting the batteries that are giving them the highest incentive. So the plot at the bottom is the frequency at which the different brands are giving the highest incentives to the retailers. We also find that the same retailer, in 80% of the cases, is giving different responses to the different types of customers. And we do a fixed effects regression model, controlling for a bunch of things, and we find that the same retailer is less likely to recommend a brand of battery to the wealthy customer that gives them the highest incentive. That is, they're actually recommending the brands that are giving them lower incentive to the wealthy customers as compared to the poor customers. So likely they're giving more relevant or more correct information to the wealthy customers at the loss of getting that incentive from the manufacturer. We find that they're exaggerating on the battery life. We observed that almost all batteries fail within 18 months, but 80% of them said that the batteries last 2 years or longer. And again, we're finding that they're giving more conservative estimate of life to the wealthy customer as compared to the poor customer. And I think surprisingly, we find that the same retailer offers a price discount to the wealthy customer as compared to the poor customer. And not just in the price of the new battery, but also price of the traded-in battery. And so what we think is going on is the retailers are behaving strategically, like the literature said, that they can play this certification role, but they're playing it only with the wealthy customers who they think will have the higher word of mouth, the better word of mouth, and want to keep that relationship with them. But for the poor customers, which is majority of the customers in this market, they're getting the worst information and the worst price. Don't have much time, just to say that, again, majority of them don't pay taxes, no labeling on energy efficiency, a failed secondary market, so you cannot get a better battery, better price for the used battery, even if it has performance, or if it is performing better. These retailers, 80% of them are selling their used batteries to informal scrappers. 90% is just selling to whoever is giving them the highest price. And the price difference between the first and the second offer is as low as 5 cents in majority of the cases. This is just to show you kind of the structure of the complex supply chain and where the retailers sit. Don't have the time to go through it, but happy to talk about it. And there's a lot of interaction between the formal and the informal sector. Key takeaways: retailers perpetuate this lemons market of batteries. Manufacturers are unable to sell these longer-lasting batteries. Solution pathways: formalize the sector, implement battery standards, perhaps track battery life, make the manufacturers accountable. Again, easier said than done, and I think this requires a lot of kind of brainstorming and thinking about technologies that can come in and be used to track the life of the batteries and the performance of the batteries. One idea is that manufacturers of longer-lasting batteries should kind of avoid this retailer channel, perhaps go direct to customers. And these, the models of loan, lease, and swap is something that we've been thinking about, and we're doing an RCT with BRAC Microfinance to test these models out with lead and lithium batteries. And finally, retailers are collecting all the used lead-acid batteries, so we don't really need any kind of additional incentive for them to collect back the batteries, but the incentive is required for them to send it to the formal recycling channel. Thank you.
Thanks, Amrita. Thanks, Amrita. Really interesting. If there's anyone from Netflix in the room, I think you'd probably have a few new subscriptions. If maybe you scripted a show using some of Amrita's methods, maybe we can title it Battery Undercover or something like that. But I'm here for it. Our final presenter is one of the most tired people in the room. This is Rory Todd. He works as a research associate with the global education team at CGD. That's why you've seen him running around doing various things, and now he also has to form coherent sentences and tell you about some very complicated but fascinating research. Rory, before joining CGD, worked at the University of Manchester as a research assistant, looking at the impacts on economic hardship of COVID-19 lockdowns, is based in the UK, and is going to speak to us today about a really, really important study on lead chromate. So over to you, Roy.
Thanks very much, Will. So yeah, today I'm going to be talking about some work that I did with Lee and Rachel, and this links quite a lot to the work that Usman and Sophia were talking about, because we're looking at documenting the exports of lead chromate. And this was just our attempt to understand a bit more about what this market looked like, the key exporters, the key importers, and particularly if high-income countries have a role in kind of sustaining this toxic, but also quite small, but also very potentially quite harmful industry. So I'll provide some background on lead chromate and also talk about its legal status globally. I'll outline our approach to documenting those international flows of lead chromate. I'll provide some highlights of those results, and I'll also talk about what we recommend to governments to curtail this trade. So what is lead chromate and why should we care about it? Well, as Usman mentioned, it's a pigment which is used particularly in paint, but also plastics. But also, as Usman mentioned, in Bangladesh and Pakistan, but also in Bangladesh. It's also been found as a food adulterant, so a highly hazardous application. And I thought I'd just show on the right there the two main compounds used as lead chromate, which come under the umbrella of lead chromate. So it's particularly used more for dyeing colours like yellow, red, or orange. And it's valued particularly for its durability, so it's highly weather resistant. But it's also relatively simple and easy to produce, which makes it very cheap as well. Unfortunately, it's also very toxic when ingested. So it poses a particular, not just for its lead content actually, but also its chromate content as well. And that poses a particular risk to young children who are more likely to pick up flakes, for example, from drying paint, from aging paint. And I think the key point here is that non-toxic alternatives to lead chromate do exist. And not just rich countries, but also low-income settings. It's been found to be affordable to switch over to paints which don't have lead chromate. There are some drawbacks in terms of durability, as I say, and there's also an investment cost for reformulating those paints, but it's clear that this is an unnecessary use of lead, and an industry that shouldn't really exist in general. So a bit about its legal status globally. So around half of countries have at least some controls on lead paint generally. So not lead chromate, but typically a law on the maximum amount of lead allowed in domestic paints, for example. So that's all countries in blue have at least some law in their books controlling that. Unfortunately, the capacity to actually enforce that legislation varies a huge amount. And so, as we've seen in earlier work that Sophia's done in Mexico, for example, technically they have laws on their books, but in practice, lead levels in paints can be found to be very high. So in practice, it might be different. And another critical thing to remember is that since 2019, lead chromate has actually been completely banned for sale or use within the European Union, as well as the UK. And it actually hasn't been used in Sweden for decades, which I think just goes to reinforce this point that this is a non-essential use of lead, and one which we can change. So in this paper, we kind of wanted to understand more about the main exporters of lead chromate and the sort of features of this market. Unfortunately, standard trade data, so available through Comtrade, for example, isn't sufficiently granular to examine exports of lead chromate specifically. So instead, we use data from bills of lading. There's an example on the right there. And these are issued by carriers, so shippers usually, to acknowledge receipt of cargo. And they contain data on things like the date, the volume, the prices of the shipment, the exporting and importing companies, and also critically a product description, which is what we're going to use to filter for specifically lead chromate shipments. And these are reported by 25 countries. But importantly, we have data both on the exports of those countries, but also imports to those countries. So we can get quite a good sense of this trade, if not comprehensive. So we downloaded all data from 2022 to 2024. And we, as I said, used this product description to filter for shipments which included a reference to lead chromate or one of its synonyms. So we did a manual validation process, and so we can be pretty sure that our sample includes only lead chromate. That doesn't rule out exclusion errors. So again, we might not have a comprehensive picture of this trade, but we have a pretty good sense. And we know that because we also followed an extrapolation process, basically comparing flows that we have access to flows in UN Comtrade data to understand of flows which do exist, how much do we have access to. And that suggests that we have about 60% of total trade, so a pretty good amount. And just quickly, these are the countries which which we have bills of lading information for. So it includes large countries like India and America, for example. So what do we find about this trade? Well, firstly, most importantly, this is quite a large volume of lead chromate which is being exported overall. So we detect around 14,000 tons of annual exports in our period, and that includes about 10,000 tons to lower middle income countries. And the extrapolation process that I mentioned before suggests that the true figure might be somewhat higher, around 23,000 tons. So in the paper, we do some estimation of what the effect this could have on human health. A lot of that obviously depends on the final use for this lead chromate, which is difficult to determine. But it's quite clear that, given the evidence that it's being used, for example, in domestic paints and also food adulteration, for example, this is an amount that has the potential for huge harm and that we should care about. The flip side of that is that by value, it's actually quite a small industry, so around $170 million annually, which represents a really small share of the overall pigments market. And so, even for the key exporters of this trade, as I'll mention as Indian companies, this is not a hugely important trade. It shouldn't command too much political capital, for example. And so as I mentioned, just to explain the graph on the right, supplier country refers to the country in which the company is based, whereas the country of export is where the product was physically exported from. So typically those overlap. They're usually the same for a shipment, but not always. And as you can see, India does dominate in our data. To some extent, that is a reflection of the fact that India is a reporting country in our data, so it might be slightly overrepresented compared to overall trade. But the extrapolation process we follow also suggests that it is, in fact, actually the largest exporter. So this is a pretty good picture of overall trade. In the paper, we focus particularly on high-income exports from high-income countries. That's primarily because these countries typically have very strong regulations on the use of lead chromate. So, as I mentioned, Europe completely banned lead chromate, but also in the US and Canada, it's only really used for specialist applications such as road marking, for example. And so we were keen to show that, these countries might be exporting to places where it's not used as responsibly. And so we find that around 6 to 7% of exports are from those countries. So not a huge amount, but a non-negligible amount anyway. And so zooming in on those exports from high-income countries, you can see that Canada is a particularly important exporter. It's generally an important pigments exporter generally. But the US and the UK also make up a significant amount of exports. The case of Spain is quite interesting. So as you can see, Spanish companies are not a big part of this trade, but it is an important export hub. And on the graph on the right, which just shows the largest flows from high-income countries, shows that it's in fact Indian companies which are exporting from Spain to countries in Latin America, particularly Mexico, but also Peru. And so it's a little bit, our data can't tell us too much about exactly where the product's being manufactured, but it seems likely that Spain is being used as a kind of pass-through, allowing Indian companies to market their product to Latin America. And just to reiterate that Spain has completely banned lead chromate for sale or use within its own territories. So. I hope I've convinced you that this is like a small but relatively potentially very harmful industry. And in the paper, we put forward some things that governments can do to kind of curtail this trade. So firstly, most obviously, and as Mun has also highlighted, we think that countries should move towards a complete ban on lead chromate manufacture and use in the long term. Not just Europe, but other countries have showed that it's perfectly possible to have a paint industry which doesn't use lead chromate. We think in the short term, high-income countries should prioritize ending exports of lead chromate to poor countries. And the case of Spain also shows that they should prevent their ports being used as a kind of pass-through to allow those exports to happen. That said, there's also kind of a demand agenda here, particularly if, for example, Canada or the US ended those exports, it might be quickly replaced by exports from other countries like India, for example. So this just goes to show the importance of making sure that countries educate their public about the danger of lead chromate and lead paint generally to kind of reduce the demand in the long term as well. And finally, just really quickly to touch on this is kind of a whole topic in itself. But the Rotterdam Convention kind of governs some trade in hazardous chemicals. It allows countries to have more control over the chemicals which pass their borders. And lead chromate is not currently on the list of its regulated substances, but it should be. And this is kind of being stopped by a bureaucratic tangle, which we think that some political will would do well to kind of end this and make some dent in this movement. So thank you.
There we go. Thanks, Roy. That was fascinating. Now we're lucky to have a bit of time for some questions. I'm going to kick off with one and then pass to the audience. You're all talking about a similar phenomenon in which none of the products you're focusing on are advertised like McDonald's would. There's no sign out front saying, get your dodgy batteries here, get your lead chromate here, get your adulterated turmeric here, get your lead-tainted glaze here. And we've had really interesting expositions of investigative research tools, if I can appropriate a term from my own job. Bills of lading, undercover operators and customers using charm and interview skills. So I'm going to turn to Sophie to start with, which is my question to you. Take us through, if you can, how you went about identifying in Mexico these players in the lead oxide and the lead chromate industry. Because I imagine they weren't necessarily, screaming it from the rooftops.
No. We attended the Latin American paint show, and we interviewed a lot of providers to the industry for many days. We also went to the potters to find their sources. We went to the shops that supplied the potters. We looked through internet. We made a lot of phone calls, and we then connected dots. So it was hard. And when we were drafting these charts, we were very afraid that we didn't have the correct information. But this is the best we could do. And as I said before, the lead chromate supply chain, that we know for sure that it's good. One thing we did that was really interesting, and that was Perry's idea, is to look for lead oxide suppliers that did small amounts, like did small 25 kilogram bags. So that would be something that a potter would buy. So that was helpful too. But yes, it was a year of work, and it was hard.
And I'll just follow up with a quick question, which is, what kind of response, if any, did you get from these entities that you named?
None. Because it's not forbidden.
Right.
You see? So if their names were in a report, it's not forbidden. So they said, okay, yes, we're here, so what? But it's very useful for public policy. So that's the question. That's the answer.
It's very useful for journalists too, so thank you. I'm going to open it immediately to questions, because I know we'll have a lot. I'll take one from each segment. Yes, we'll start there with the lady on the far side.
Hi, I'm Juliette Finetti from LEAP. For Pakistan and Mexico, do you know how much of the lead chromate supply comes from imports versus local manufacturing? And is there a risk that with banning lead chromate imports, there could be more local manufacturing of lead chromates?
You want to start on that one?
Okay. So Pakistan, we have looked at both the imports and the local manufacturing, but we haven't quantified it. So we rely on the data that respondents gave us and kind of related with the data on prices of different kinds of lead chromate. So we found out that there were mainly 3 kinds of lead chromate which were present in the market. Best one from Germany, then the one from China. Sometimes we found from India, and the price is kind of reduced. The cheaper one was the one which was produced informally in Pakistan. And this was about 25% of the price of what we got from Germany. And how much is it? That needs to be quantified if we want to understand how much is being imported versus locally produced. But we do understand from the triangulated qualitative data that a lot of it is being produced locally by informal actors. So if it is not quantified, it probably is a major concern.
We did not find informal lead chromate production in Mexico. So we don't have the numbers nor the sources, but we think that Dynachrome, which is the local company, is servicing most of the local industry.
Thank you. I'll move into this center here. Yeah, in the second row here.
Amrita, and it makes so much sense with what's going on with retailers. So during my field visits, something interesting I found was the formal manufacturers were complaining about how the customers, which is mainly the EV drivers, won't buy their batteries if it has their own brand name on it. They will buy it if there's like a Chinese brand name on it. So did you see a pattern in retailers trying to sell batteries based on where they're made? Yeah.
Yes, it's so fascinating. I mean, there's just so many layers to kind of the market in Bangladesh, and this was super interesting as like a fun fact that we learned is that earlier when this technology started, it came from China. And so the batteries that came from China used to last much longer. In 2015, 2016, because of lobbying from one or two of the large battery manufacturers, Bangladesh increased their import taxes to about 80 or 90%, which stopped all imports of batteries coming in from China. And all batteries started being manufactured in Bangladesh. But that memory of the market remained that the batteries from China used to last much longer. And so as a result of that, there's a high demand for batteries that have these Chinese letters on it. So we know a lot of the, including large or kind of medium scale local manufacturers who manufacture this Power Plus branded battery with the Chinese letters and like the Chinese faces, and it sells quite well.
We're making good time, so all of those on this side of the room, keep your questions, but I'll keep moving this way. Front row, I know it's the obvious choice, but please, go for it.
Thank you. Lex van Geen, Columbia University. I have a question, which is how profitable is supplying these various forms of lead? And the reality check I wanted to provide is that Colombia forbids the import of mercury for artisanal gold mining, and yet artisanal gold miners use mercury in most places in Colombia. I'm hoping it's not as profitable, but I'm curious to know what you think. You know, on the incentive side, can you really forbid that?
Who wants to take that?
Okay, I'll start. If we are talking about turmeric, probably it's not very profitable, and this is why Punjab was able to solve the issue. But if we look at the other value chains that we did on the sidelines, it is sometimes very profitable, especially in the recycling of batteries.
Rory, do you have any insights based on companies you've looked at, or?
Yeah, I can start that. Typically, companies from high-income countries, there were only like a few companies which worked on it. And for example, DCL, which is like the main manufacturer in Canada, they sort of dropped that industry because it just isn't a huge part of their exports anyway. And you sort of see smaller companies kind of pop up to fill that trade. But overall, it's not, I mean, it's a very cheap ingredient to manufacture, so it's just not a particularly profitable industry, which is why, yeah, high-income countries tend to stop after a while.
Okay. Anyone over this side of the room? Nope. Otherwise, we'll move back this way. You. Yes.
Thank you very much. Paolo Peña from Dalberg. So my question is for Rory. I'm a Spanish national, so I feel a bit ashamed by the last slide in your presentation. And I wonder if it's a matter of policy enforcement, given that the sale is forbidden, or is it like a loophole in the law where you can act as a pass-through for trade? Thanks.
I'm not an expert in this, but my understanding is that it's lead chromate within the territory of Spain that would be banned. So I don't think that those flows to Latin America are illegal. We highlighted in the paper more as a kind of double standard, I suppose, that sort of treating you know, how dangerous a product it is differently and how they export to other countries compared to in Spain itself. But I think, yeah, this is probably an area for legislation rather than just enforcement.
Did you see whether or not those figures were rising, falling, staying the same over years that you looked at?
From Spain specifically, or struggling to remember now, but I think it was in the last couple of years. It's still ongoing, its exports from Spain. Yeah.
Right, something to follow up there. Yes, the patient gentleman in the back.
Not that patient. Sorry. Mike Fisher from University of North Carolina. I thought it was interesting that a bunch of y'all mentioned the availability of lead-free substitutes for pigments and batteries. And in particular, I guess I was curious what the barriers are to those. In particular, you mentioned lithium-ion batteries, and I don't know anything about electric three-wheelers or batteries, but my understanding is that they cost a little bit more upfront and last a lot longer. But I'm wondering, what barriers are there to introducing lead-free substitutes for pigments and batteries in these markets? And in particular, which ones of those barriers might be tractable, and where might you pilot it?
Please, all yours.
I love that. We need to think about batteries that are longer lasting, not just lead, but also lithium. So the barriers that I observe in Bangladesh, and may also be the case in other countries, really high import taxes, so they cannot get high quality batteries from, or lithium cells from outside, or that's expensive. The cost of the product itself is high, so high upfront cost. And if you think about the typical loan that's available in the market in Bangladesh for these consumers is a microfinance loan, and the term of those loans is typically just 2 years, versus the life of this battery, a lithium-ion high-quality battery would replace a lead acid, which is for a year and a half, to like 7-year life. Now the cost is going to be 3-4x the price, right? So how do you structure loans such that it becomes cheaper for consumers to either buy it or introduce these models of lease and swap that allows for these more durable technologies to come into the market? So I think that market failure needs to be addressed, and I think more financiers need to come into the market. And if the market was regulated, there will be just more availability of financing to actually do those kind of models. So that's one, and I think decreasing the import taxes, at least on lithium batteries, just makes I think sense.
Do you have other questions? Yes, please.
Thank you. I have a question for Dr. Anwar for Pakistan. Do you have any efforts in understanding how much of the lead from the spices are contributing to the children's blood lead level or the population blood lead level, like what is being done in Bangladesh? Anything in plan?
Yes, and there are a lot of things in plan, and one of those is getting data of the blood lead levels and how much is the impact coming from different forms of lead among the population. So turmeric is one of those. I think we'll integrate it with all the forms, like the regions near to the battery recycling, the regions which are historically or currently exposed to turmeric or other kinds of spices. And there are other sources of lead exposure that we identified during the study, and we are in process of identifying more. So there is a lot in plan, like in Bangladesh and in India for Pakistan.
Any other questions? Yep.
Thank you so much. Phil Burbley from IPSOD. Talking about the spices, we always focus on turmeric. What's the process of cinnamon and curries and other spices, chilies? Where is this lead getting in there? Is it through adulteration or is it through manufacturing? Do you have any information on that?
Yes, that's a very good question, because along with the turmeric roots and powder samples, we got some samples to identify whether there is lead in those spices or not. So we got chilies, cumin, and some coriander, and some mixed recipes as well. So we did not find any lead in those samples. How is it got? It varies from region to region. So it can be due to processing of different spices at a certain place, or some other reasons which are I think specific to different locations.
Any other questions?
I just wanted to ask about the lead in the glaze in the pottery. What is the motivation to include it in there? I know why you would do it in turmeric. It makes it shinier and brighter, and it looks like it tastes better. Why do you put lead in pottery? Is it necessary? What are the alternatives?
Yes.
What are the motivations? Do they save money?
Lead oxide is what it's used. And it is very important for potters because you don't have to be perfect in the process to have a perfect shine.
and it melts at low temperatures. So it has to do with the furnace or the kiln. The kilns are homemade also, so they don't get to high temperatures. So having lead oxide and low temperature kilns is a perfect match. So what the government has worked on is on lead-free glazes that melt at low temperatures. That's the reason.
Thanks. Maybe a question for all of you, which is, where do you see a bright spot in your research fields? This has been a day or two of
depression,
sobering conversations. But in terms of the supply chains you're discussing, maybe given your interviews with various actors, stakeholders, like, where are you excited to see, or where do you think there could be a shining light in the next 12 months? I'll start with Rory. Or further, or longer term. I don't mean to be too optimistic.
Sure. Well, I suppose the fact that like the EU banned lead chromate in 2019 shows that, you know, I think it's a really good start, and it shows to other countries that it's perfectly possible. And for example, the EU, even though it hasn't supported the accession of lead chromate to the Rotterdam Convention, it has its own export notification system. So it basically does notify countries when it exports lead chromate. So I think, you know, they can be a kind of they can push the movement, I guess, against lead chromate generally.
Okay, Amrita.
I don't know. I mean, I don't know what the time frame would be for something to look really good for the battery industry, just because it's so complex and so many players. But I am very hopeful that lithium batteries, high quality ones, will start coming in. BRAC Microfinance especially is very keen to and have developed new business, their new loan products for batteries for this segment. And I hope there are manufacturers that can stand up to that challenge, and because the financing will be available and ready for them to go with.
Okay. And if the answers pass, we can play a version of Lead Family Feud here, so feel no obligation to answer. Usman, what about you?
Yeah, I think as far as turmeric is concerned, in the next 12 months, we should be able to abolish it, eliminate it in Pakistan. Inshallah, as far as the other sources of exposure in Pakistan are concerned, there is very little research on them. So we don't know how the value chain actors are acting in those sources of lead exposure. So that will need time, and these are usually more complex. We are learning from the other presenters here. It will need time, and it is more rooted, and it has more branches. So it will obviously take more time.
Okay, well, you heard it here first. Within 12 months, we'll be this time next year. Usman will be here on another panel.
Hopefully, yes.
Yes.
And Sophia?
I think my hope is with industry, because we wrote a report in 2018 pertaining lead in paints in Mexico, and we saw a lot of interest from the industry to move towards lead-free. So we're working on a new report this year, and we've been approaching industry, and we really think that they are putting some effort into this. So hopefully we'll be able to do a better job in the following 2 years on that. Mm-hmm.
Okay. Important points there. Recognizing that, certainly in my job, you know, you all probably assume that journalists are just there for the headline and who we can name and shame, and that's certainly a part of the job that we do. But I think also recognizing that these corporate actors have an important role to play, and sometimes, in my experience, also are more amenable than the minister of whatever who never responds to her or his WhatsApp message. So it sounds like we have plenty of things to watch in the coming years. If I can thank, and we can thank all of our 4 panelists for this great discussion.
Thank you, guys. So please, we don't have a break now. We're going to do a very quick mic change. So if you're on the next panel, if you can come up here, very quickly get mic'd up. And it will be about a minute while we just do a quick change of scenery. right, thank you everybody for your patience as we do a quick mic change, but we are ready for our next panel. So in our opening policy panel, we heard a very clear demand for solutions. What can we do to prevent, treat, mitigate lead exposure? And we have a panel today that's starting to think about exactly some of those questions, interventions to address global lead exposure. So we have a few panelists for you here today, and I'll kick off by introducing our moderator, well, reintroducing our moderator because you will have already met him. This is Lee Crawford. He is a senior research fellow here at CGD, working on education policy and a key member of our lead team here. So over to you, Lee. Thank you.
Thanks very much. I'm really excited about this session. I think you've all hopefully followed the careful arc we've carved out between looking at the big picture, the impacts of lead, the sources of lead, and now ultimately what can we actually do about it. And I'm delighted to be joined by three great speakers who really exemplify, I think, what we're trying to do here at CGD, which is bringing evidence and actually making a change in the world based on that evidence and research. So first we have Perry Gottersfeld, who's the Executive Director of Occupational Knowledge International, where he's been working for decades publishing on lead exposure, and I think just making huge, fantastic impacts both through his direct work in countries and through the international conversation around multilateral organizations. So over to you. Excited to hear about your work. Thank you.
Does this come up? Yeah. There we go. Oh, one back. Oop. Okay. Welcome, everybody. It's great to be here and to feel the energy in the room. There have been some really great presentations. Occupational Knowledge International is a nonprofit based in the US, but we work exclusively in low and middle income countries. I founded the organization to build capacity around occupational environment and environmental health in countries with the greatest demand. We have focused primarily on lead poisoning prevention through research and advocacy to address important issues around the world in about 36 countries at this point. And today I'm going to be talking about the work we've done to collect evidence that workplace interventions can reduce not only occupational exposures to lead, but also community exposures as well. And I'd like to acknowledge my partner and co-author on this work, Manti Nota, who is a Tanzanian who had worked on the project we'll be talking about in Nigeria for almost 5 years under very difficult circumstances. CGG provided travel support, and I also serve as an expert witness. Okay, we're using this on lead poisoning prevention. On lead poisoning cases. So most of us think of the workplace and the home as two very separate entities, but it's never so delineated in real life. What happens in the workplace doesn't stay in the workplace, and we see that workers take home toxicants on their clothing and on their skin, and they contaminate their homes and their children, and they bring dust and they contaminate their cars and their vehicles. And this is particularly problematic for pregnant women, of course, because we know that lead is linked to preterm births and low birth weight babies. And we know that mothers who are lactating pass their lead exposure onto their infants in breastfeeding. And in many parts of the world, there is no distinction at all between the work and the home. And of course, that makes this even more of a challenge. And there have been documentation of take-home lead exposures from all of these industries listed here in the published literature from countries around the world. And it's important to note that about 60% of all workers are in the informal sector and don't have any access to occupational health protections. And those self-employed and formal workers are even greater represented in industries with very high lead exposures like construction and mining, for example. So this is not a new problem that just recently came into focus. 30 years ago, the National Institute of Occupational Safety and Health here in the US was charged to send a report to Congress on take-home exposures. And they identified at that time 80 reported incidents of workers' families that were exposed to lead. And this was documented in 60 published studies. And they examined the cohort studies that were available at that time and found that lead-exposed workers, children, had significantly higher blood lead levels than controls, even after controlling for non-occupational risk factors. And they concluded that lead contamination of workers' homes resulting in elevated blood lead levels of children is a, quote, substantial problem in the United States. And it still is, unfortunately, because even now, where kids have elevated blood lead levels that are investigated by local health departments, we find that approximately 10% of those cases are linked to a parent who works in a lead-using industry. So one of the examples I'm going to talk about is from lead battery recycling, and I know this has gotten a lot of attention at the meeting, but I also want to say and be very clear that lead battery manufacturing in many parts of the world is equally hazardous and often associated with equally high, extremely high lead exposures. In this case, the Puerto Rican Department of Health conducted routine blood lead surveillance in preschools or Head Start programs and found 3 children that they identified as having a common link to family members who worked at a battery recycling firm in Puerto Rico. And for those of you who are visiting and brave enough to have visited from other countries, let me explain that Puerto Rico is not a state, but it is part of the US, and they are subject to our same occupational and environmental laws. And we don't have informal recycling in Puerto Rico. And so the follow-up testing of the workers at this plant showed that they had a blood lead level, mean blood lead level of 30 micrograms per deciliter. And then they tested the children of these workers and found more than half of them had elevated blood lead levels. And they've also looked at dust lead levels in their vehicles, in their homes, and found very high dust lead levels from take-home exposure. So the case study that we're going to be talking about today is the work we've done in Nigeria around artisanal small-scale gold mining. And the story starts actually in 2010 when Doctors Without Borders or Médecins Sans Frontières were doing some routine medical work in very remote villages in northwestern Nigeria in the state of Zamfara. And they came across some villages where a significant portion of the children under age 5 had recently died from unexplained causes. And much to their credit, they did an investigation, and within 2 weeks, they recognized that it was from acute lead poisoning. And the source of the lead was the gold ore that is used and processed in these communities. And the gold ore contains somewhere around 5 to 10% lead by weight. And since that time, there have been hundreds of cases of documented children who have died from severe lead poisoning in this wide region of northern Nigeria, and thousands of severely poisoned children. In fact, some of the highest exposures ever recorded anywhere. And Doctors Without Borders recognized early on that they couldn't just treat these children with chelation and then send them home to an unsafe environment. So they teamed up with Terra Graphics, and a shout out to Ian, Casey, Margaret, who were here with us, who led that effort over many years in Nigeria under very difficult conditions. 5 years later, a second outbreak occurred in Niger State, which is a neighboring state to Zamfara. And at some point, Doctors Without Borders recognized that they weren't going to be able to address this problem unless they were going to look at the root cause, because it was a revolving door of chelation, and they were spending literally tens of thousands of dollars a month on just the chelation drugs alone. So they teamed up with my organization, OK International, to work with the miners and work with the communities to reduce lead exposures. And this is what we found when we arrived. A lot of the work was manual, and even those workers were highly exposed to lead. And on the left, you see the ore processing, which is done with mechanical equipment. And the worker on the far left is wearing an air monitoring pump that we placed there for his workday to find out what his exposures were. And we looked at not just the lead exposure, but also the respirable silica that's also a great hazard in these environments. And we used two specific strategies to work with these communities to reduce exposures. The first was converting the mining and processing to wet methods. And secondly, we introduced what I call the simple measures to reduce exposures. None of this is rocket science, but these are really low cost, really simple things like changing out of work clothing before returning home, having separate eating areas, having hand washing stations and showering facilities and change areas, and having a place they could securely store their ore at the end of the day without taking it home. And we also trained hundreds of workers and hundreds of people in the community about the hazard and about the means to reduce their exposures. We established health and safety committees in each of these villages that we worked in to monitor this process. And we took air samples, as I said, before and after, and found about a 95% reduction in respirable, in total lead exposures to these workers. And these are some of the practices we put in place, starting on the top right. That's water spray misting to trap the fine dust particulates that are released. On the bottom right, you have an ore storage area, a lunch facility in the middle, a change area, and simple hand washing facilities out in the field. But if looking at lead, the gold standard, if you will, is blood lead levels, and we measured blood lead levels of a random group of 58 miners, and we tracked them by measuring their blood lead levels every quarter for 19 months. And that data is presented here, and you could see that we had 32% reduction in geometric mean blood lead level from 31 to 21 micrograms per deciliter amongst this group that included most of the ore processors and a group of miners as well. And what you could also see from this graph is that the very highly exposed individuals, those dots at the top, people who are up and around 100 micrograms per deciliter, almost all of those cases were greatly reduced in the process. So the keys to our success, well, we use low-cost solutions with locally available equipment with very few exceptions. We trained hundreds of miners and community members to know about the hazard and take action. And we worked to build trust by living and working in these communities for months on end, and we brought in the participation of local and state governments, religious authorities, traditional leaders, and the mining leadership as well. And communities participated in this. They worked and donated their labor to build some of these stations, and they also donated funds for some of the equipment that was needed, like generators, et cetera. And the health and safety committees served an important purpose as an ongoing mechanism to check that these measures were still used and in place. And it was really that accountability that helped instill the importance of this going forward. So in conclusion, miners care about their health. Now that might seem silly or trivial, but when we started, people who even had experience working in these communities said, we don't even know if they'll talk to you, let alone cooperate. So we did find once they were well educated about the hazard, they were certainly willing to cooperate. It wasn't always easy. And we also know that it's possible to significantly reduce lead and silica dust exposures, even in these very difficult environments, self-employed, artisanal miners. And we could do this without destroying the underlying economics of this activity. And we know that prevention, primary prevention, is not popular amongst public health funders. Global health funders don't really care about that, but we know that it's very effective. And finally, we have a proven model that can be taken to scale. I'd like to thank my partners from Doctors Without Borders who are listed here.
Thanks very much, Perry. It's great. It's great to see these outcomes on blood lead. Next, we have Alexander Van Geen, who's a research professor at Lamont Doherty Earth Observatory at Columbia University. He has over 180 peer-reviewed papers on environmental health, which puts, I think, most of us to shame. And he's currently focused on encouraging more widespread use of field tests by non-specialists to help reduce exposure, which is what he's going to be talking about today. So.
So I am an environmental chemist, and I never understand why not everyone has a kit of some sort in the pocket, like I do here. So that's one of the points I try to get across. I don't see the first slide yet. Do I need to do something? Yes. So this study was funded by the, essentially a copycat of the now defunct USAID Development and Innovations Ventures by co-Nobel Prize winner Esther Duflo in France. And so it's called Fonds d'Innovation au Développement. And it uses a lot of the literature and the call for proposals that DIV used to circulate. Let's see, this is the last slide. That's interesting. So it is a collaboration between partners from Côte d'Ivoire and France, primarily. It is a pilot, but because some economists were involved, they couldn't resist adding a randomized control, a randomized sort of component, and you'll see that that was actually very useful. So for a long time, I've been a fan of field kits for the more obvious reasons, heterogeneity. One room may have leaded paint and the other one does not. It's unrealistic to expect someone, a government, for instance, to come with an XRF and test every room and every house of Abidjan, for instance, where today a lead paint is still sold widely and in fact is the most popular solvent-based paint. But more recently, someone pointed out to me this paper. For long, I've long had a hunch that participating in the measurement might help in some way, but it was a rather diffuse and sort of a belief. This paper here involved incentivized experiments where people in Chennai had to make guesses on the proportion of black and white balls in a bag based on partial draws from that. And what was interesting is that the people who were given a result, someone else drew the ball, they did okay, so it was better than random. The ones who saw someone else draw a few balls and made a guess made a bit more money from it. But the ones who made the most money are the ones who did the drawing themselves. And you can see the analogy here with making a measurement yourself. So that's to me, this was a big step forward to know that this is being studied. Côte d'Ivoire is one of the countries that has norms but not really enforced legislation. This paint, this brand here, Industrap, for instance, has somewhere between 5,000 and 50,000 ppm, and it's still sold widely. It's clearly also promoted the most. It's always at the front of the paint shop in Abidjan. And while there are alternatives, so the picture I had there, oops, that's interesting. There are alternatives and they are not more expensive. So it really is a matter of information that could make a difference there. So the kit that we use is not this one, but someone co-invented by Lucas Helmbrecht, who is sitting somewhere here and raising his hand there. I hope you've seen this poster. So when I saw this kit first, I was really very impressed. So we've done an evaluation of it, and we established a detection limit of about 500 ppm lead in bulk concentration. When you
you test it as a layer, that would come out as a 100 ppm measurement. It doesn't come out quite the same. So based on that, I talked to my colleagues in France, and we designed this experiment, this intervention. We recruited 200 women from maternal health centers. They were about, more than half of them were in their first trimester, so pregnant women. And then there were 3 visits at home. At home, they were asked a number of questions, awareness about lead, which was very low, I can tell you that, provided some infographics, why is lead an issue, what can you do about it, and they were given a kit, a Lumetalix kit, and there was a demonstration on a couple of painting layers of painted surfaces in their home. Then that group of 200 was split randomly. There was quite a bit of attrition. We ended up with 75 that were women who were revisited in one group and 92 in the other. And the randomized half of those XRF measurements were made by one of our field staff there from the university. And then the same questions were asked. And then at the third visit, the other group that did not get the XRF measurements did get it. But that means that by the third visit, we had some people who had positive results because the kit gave them a positive results. Others had a negative result. Some of them had it because of the XRF. Some of them had both. So we had these. So we could see what the impact on various responses was from this mix of provisions of information. Sort of a technical point first, how well did the kit do in this particular setting? Keep in mind that the Lumetalix kit only measures really the presence of lead at the surface, whereas the XRF will go several meters down. And so if there is a low lead paint that covers the high lead paint, the XRF will tell you this is high and the Lumetalix will tell you what is low. If this had been a perfect kit, all the bars on the left would have been green, this bright fluorescent green that the kit produces, and all of them on the right of this cutoff would have been purple. It's not perfect, but it's pretty good. It's about 85% sensitivity. So, and it turns out that more than half the houses in Abidjan had lead, more than 1,000 ppm measured by XRF. Water lead was not a problem, I can tell you that. We made those measurements. In terms of blood lead levels, we were not expecting a response. This was really a pilot. The mothers, there was no relation between the average lead concentration of the paint at home, a lot of scatter, and on the children there's no sort of traditionally defined statistical relationship for the children between 2 and 9 years old. But what you can see is that certainly the range of concentrations increases as the average lead concentration in the home increases. So on the sort of the responses, so I mentioned the fact that at the third visit, the participants had been exposed to various information. Some of them had the high lead, some of them had low, some of that it was by the demonstration kit, some of that was the XRF, and some of it by their own testing. We could have done a better job monitoring the self-testing, and so I'm not going to emphasize that too much here. This is the results that I was hoping to get across. Let's focus on column number 4, 5, and 6, sort of a typical economist diagram, and I had to call my colleague this morning to make sure I wasn't going to say something silly. So what this is the impact. We're looking at the impact of the test results on responses to one question. And the question was, do you know if there's lead in your home? And they all have different kinds of information. Now, for the ones where none of the results showed lead, the average response there is the outcome mean, no lead detected. So you see that 20% of these said that they knew there was lead. So ideally, it would have been 0. We're not quite there yet, but it's that. Now, if any of these measurements give them a lead indication, that percentage went up from 0.22, from 22%. If you add to that the 0.344, the top parameter here in column number 4. So it increased it to well over 50%. So clearly the provision of the information had an effect, and since it was randomized, I think you can assume it was causal. Now, the interesting part here, to wrap up, because I saw the 3-minute sign, is that if they got the information only for the XRF, you can see that in the traditional sense, it was not statistically significant. But it was for the combination of the XRF and the demonstration test, but also for the demonstration test on its own. So the kit was at least as good as the instrumental measurement in making people realize they had a lead problem at home. And that obviously encourages us now to go into the next phase. We are not quite ready to ask for funding for the full trial yet. I mean, obviously the outcome will be blood lead levels. Does providing these kits lower blood lead? And we're not going to do a pure control, we're going to have XRF measurements. So it's expensive, but that's going to be our reference. And we want to know whether the cheap kits do at least as well as the XRF measurements. That's our target, right? How are we going to do it? It was difficult to recruit the women. It's not a topic of discussion. In fact, if anything, it's suppressed a bit. Vaccination centers would be one way maybe to recruit. Put together some nice video stories that are looping with actors, you know, talking about the problem. Often the women would say, well, I can't decide anything. I have to talk to my partner, to my husband. Civil registry, the father often goes there. So we are going to put the videos there as one thing we're thinking about. And then one thing I've always been interested in is involving high school students. They can do the testing. You have to be a bit careful. You know, you don't want them to be sort of pressurized for, given the test results. So we're planning a second pilot on that. And then eventually we will probably have to recruit on the order of 5,000 women of that source across Abidjan to see whether generating this information in various ways impacts eventually blood lead levels in the children. Thank you.
Thanks very much, Lex. It's great to see this potentially low-cost testing, more evidence on there. Next, we have Rangoli Srivastava, who's an assistant professor at the Department of Public Health Dentistry at SGT University in Haryana, India. And she is going to be presenting about a multifaceted trial providing nutritional support, information, and environmental remediation in India.
Good afternoon, everyone. First of all, I would like to introduce my two uninvited guests with me, anxiety and jet lag. So if I stumble upon this presentation on a word or a two, please know it's a team effort. But in all seriousness, I am more than delighted to present my research, which is actually based on a multifactorial approach to reduce lead exposure amongst children. To proceed with, I have divided my contents into 3 parts: introduction, literature review in part 1, part 2 involving research, methodology, and results, part 3 involving all the discussion, conclusion, recommendations, and further prospects. Moving ahead to introduction, as we all know, why we all are here for, lead is actually a very toxic health concern nowadays. It is actually affecting variety of populations, specifically children. And furthermore, if we talk about globally, there are several areas which are severely affected, and same goes with India. There are nearly 23 states which are very severely affected. Moving ahead to the health impacts of lead exposure in neurological damage, in terms of behavioral issues, in terms of organ damage, and in terms of mortality, lead has caused a very serious health concern in specifically children. Moving ahead to the area where I did my research in Gurgaon, basically it's a district in Haryana having both urban and rural aspects covered. If I talk about Gurgaon, there were untreated groundwater being sourced upon as drinking sources, there were proximities to industries, and there was poor pollution control. Key challenges in lead exposure reduction, if we talk about, there are unregulated exposures, there is neglected surveillance, there is significant health burden, and there is local context urgency. Addressing the research problem, primarily that it's an ongoing concern, there are high-risk areas and children are vulnerable, there is risk amplification because there are nutritional deficiencies, and there is intervention gap. Research aim and objectives. Aim is basically to reduce the lead exposure by involving a multifactorial approach, which involved removing the sources, giving nutritional support, giving educational campaigns, and all the objectives which helped us in receiving the aim. Research question and hypothesis, if I talk about, research questions linked to this particular research were several, like what is the environmental status of lead, what is the blood lead level of children, what if we talk about the intervention, implementation and acceptance, what has to be what could be the post-intervention outcomes, what is the impact of nutrition and overall intervention effectiveness. Hypothesis could be all this comprehensive approach can either be successful or could be rejected. If we talk about the rationale, it's very much obvious because of the nutritional deficiencies and lower educational status in the rural areas of Gurgaon. It was very necessary for us to proceed with such an initiative so that we can compensate for lead exposure reduction as well as awareness amongst the population. If we talk about significance, importance, and expected impact, concisely if I talk about, it will lead to, if a successful model was implemented, it would have helped the population all around the globe, all around the country to reduce lead exposure in such specifically constrained areas. If I talk about the scope revolves around all that I have been till now talking about. An integrated intervention focuses on lead exposure as well as the cognitive abilities, includes environmental assessment, involves biological monitoring and pre and post intervention. If I talk about the literature review framework that is already existing, broadly divided into exposure in children, nutritional intervention and integrated intervention strategies. In children, if I talk about, there is a large variety of children who are affected by lead exposure in India, and the worst part is that they don't even know that they are affected and they are suffering from consequently very ill effects of lead exposure. Also, if we talk about oral health, because I am a dentist, I'll be focusing on this aspect as well throughout my presentation. There is severely increased amount of plaque and gingival index, kind of you can call it that there are more dirty teeth, more calculus in the oral cavity. If we proceed towards intervention strategies, definitely there are but an comprehensive intervention has not yet been implemented in India in terms of lead exposure reduction. If we talk about the global and local context, there are a variety of literature available, but not yet in the area which I did my research up to, that is in Gurgaon. Till date, there was no study that has been done, and this is the first of its kind. Moving ahead to identifying the research gaps, I have been telling it along, I'll continue saying it, that there are source identification and role of calcium supplementation in Indian context is missing, community awareness and behavior, role of integrated intervention, longitudinal data is missing, and policy evaluation needs to be done. Now, theoretical evaluations which revolved around my research was eco-social theory, health belief model, Dohart framework, and proceed model. Moving ahead to the environmental and nutritional factors, if we assess the environmental sources and if we proceed with nutritional supplementation, we might get a positive outcome. If we talk about integration in terms of national programs, before moving to international level, ICDS, NHM, and specifically some government bodies which can make fruitful use of this data to particularly implement lead exposure reduction. Moving ahead to the research methodology, it was a mixed method approach. Parallelly, there were quantitative measures being drawn and qualitative measures being drawn. If I talk about multimodal strategies, we've primarily focused on water filtration because in the further slides, we'll see the results of the lead amount in water, which was slightly higher than recommended. We focused on nutritional supplementation and we did educational campaigns. Particularly, moving to data collection, there were questionnaires, there were nutritional assessment charts, there was biological sampling done, environmental sampling done, cognitive function assessment, oral health indices were recorded, and qualitative components were recorded. Moving ahead to the tools and instruments for reliable data collection, they were already validated for this particular use. Then the ethical consideration, we kept in mind that informed consent has all the necessary information, confidentiality, cultural sensitivity, and transparency, participation, respect as well as adherence to standard was stuck upon. Next, inclusion and exclusion criteria. These are the following inclusion and exclusion criteria which were taken for my research. Moving ahead to the study design, this was not longitudinal cohort RCT, reason being there was no control group, and because there was no random allocation, it's not RCT as well, it's prospective intervention longitudinal study. Moving ahead to the sampling methodology, two-stage cluster sampling was done in identification of the villages and particularly the households which needed to be reflected upon. Moving ahead to the data collection tools, I have primarily mentioned particularly for cognitive abilities, Wechsler's intelligence scale for children was used, plaque and gingival index was recorded. As per the ICMR, 48-hour dietary recall chart was done for specific age groups, and water, soil, dust and blood lead exposure was calculated. Moving ahead to the interventions implementation, as per the citation sourced, chewable calcium carbonate and vitamin C as well as pediatric multivitamin which contains specific amount of iron and zinc was being recommended for over a duration of 3 months with specific instructions given to them that because calcium and iron need not to be taken together, they needed to be taken at a specific gap. All these instructions were priorly given. Then the statistical tests used for data analysis are as follows. Moving ahead to the results. In terms of demographics, these were the male and female participants as shown in the pie chart, and the household income, if I categorize into below and above poverty line, below poverty line, majority of them belong to that category. Age-wise distribution, if I talk about, majority belong to 5 to 10 years, and literacy level, primary education was the most frequently occurring level of education amongst the parents. Moving ahead to the source of drinking water, majority had groundwater. Moving ahead to nutritional supplementation, a very rare amount of those children were already undertaking nutritional supplementation. BMI of mostly was underweight. The school attendance and academic performance was reported by teachers, and it is represented as follows. Moving ahead to the nutritional chart, which made us aware of the fact that only the protein quantity was adequate, rest of them being inadequate. Occupation of parents, like majority of them were agricultural workers, industrial workers, followed by respective occupation, and homegrown vegetable consumption was done on a regular basis by 61% of the people. Clinical symptoms, focusing on the gingival Burtonian lines because I am a dentist, so I'll be specifically telling you all about Burtonian lines, like because we have bacteria in oral cavity and that bacteria degrades into sulfate compounds in oral cavity, and if you have lead in your body, lead along with sulfur combines and forms, it manifests as Burtonian lines in the oral cavity, which is seen over the gingiva as a bluish blackish pigmentation. And these are the neurological symptoms recorded as per asking the parents, and cognitive and other health concerns were also recorded. Moving ahead to the results of environmental sampling, soil, water and household dust, all of them significantly shown an increased level of lead consumption, lead amount. Moving ahead to the pre-intervention range of lead exposure, and this is a post-intervention as in after receiving nutritional supplementation, after getting their source of water changed, after educational campaigns being conducted, all of it was done over a duration of 12 months. And if we talk about concisely, there was a 30% reduction in blood lead levels observed with a significant value. If I talk about the cognitive scores that were observed, there was a major improvement post-intervention. If I talk about the progression score-wise as per the scale, these are as follows. Also, if I talk about plaque and gingival index, the plaque index showed a decrease, that is a better oral cavity. Gingival index also showed a decrease, better oral cavity, and these are the age-wise segregation of the indices. And if I talk about discussion, this was a multifaceted approach which was significantly implemented over the areas. There were reduction in blood lead levels, there were cognitive improvements, there was decreased plaque index, reduced gingival inflammation, and calcium's protective role was also kind of validated, kind of proved. Moving ahead to the summary of key findings, I have already told you about that there was improvement in blood lead levels, improved cognitive outcomes, enhanced oral health, and all of it can be further used for policy and clinical implications. If I talk about study limitations, there are a variety of study limitations in my study as mentioned. And if I talk about future research directions, these are like longitudinal studies need to be conducted, advanced biomonitoring needs to be done, oral microbiome research can be done, policy development can be done. Recommendations are as follows for policymakers, clinicians, researchers, and community leaders. If I talk about key reference, they have been taken as per the national data available over UNICEF, Pure Earth. Also, if I talk about the public health significance, it led to a variety of improvement amongst the population, specifically the children. If I talk about strategies and broader implications, it can lead to a variety of screening and capacity building in the future. Also, if I talk about future scope and recommendations for lead poisoning mitigation, this research can be beneficial for getting the same achieved. Also, innovative approaches could be team collaboration and innovative creativity. Strategic collaboration could be achieved by professional networking, strategic partnerships, and effective communication. Technology integration can be by process automation and specialized software dealing with this particular aspect. Of course, publication would be the first step to disseminate the same information amongst the population. These were my annexures, consent form specifically in English for visibility, though Hindi was given to them. Survey questions, demographics, 48-hour dietary chart, and the scale for cognitive abilities. Also, this is the gingival index and plaque index performer, and these are my references. Thank you. I would like to end by saying that we must remember that we are all a part of one community, and the health of that community depends on our collective efforts. I would like to sincerely acknowledge my university, SDT University, my Dean of Faculty of Dental Sciences, Dean of Research at SDT University, and my faculty, Faculty of Dental Sciences, and my department, Department of Public Health Dentistry, without whose support and guidance and resources this research wouldn't have been possible. Thank you.
Thank you very much. So I think we have about 15 minutes for questions, so I'll kick off. Terry, behavior change is hard. What do you think is the minimum level of effort and training that could convince workers to start changing their behavior? Do you need this intensive effort, or can you, if you need to scale it up, can you reduce that somehow?
Well, as far as who could do it, I think you could trade the traders quite easily. None of this is rocket science, as I've said, and we worked with community leaders, and we've also worked with health promoters in these communities, and they were able to take this on and pick it up and train the workers and the community about these measures. So it's quite easy to do if you have a good foundation. Of course, you have to work to develop those relationships.
Did you have resistance from people, or people were happy to listen?
Oh, I can't pretend that it was linear and everything just changed overnight. That would be false. No, it's 1 step forward, 2 steps backwards, 3 steps forward. But over time, the changes were implemented. People came around, and sometimes it required some external pressure from the emirates, the religious leaders in these communities. But also, I think, people began to see improvements and really were concerned and did step up. It wasn't always easy for them because there's obviously a lot of other constraints on their time.
Thanks. Lex, with the metallics, one thing that occurred to me, is there any danger or risk that with this imperfect measurement that you might lull someone into a false sense of security if they do a home test with metallics and it comes up negative, but in fact there was some, if you're in the 10% who was missed and they continue to.
Right, so the two measure something different, so I'm not quite sure you can say it's an imperfect measurement in that sense, so because it is the surface, metallics can modify the composition of the underlying layer. I can tell you that Columbia University has plenty of housing with lead paint, and the mitigation measure is to paint it over, especially if there are children living there. So some people believe that painting it over is a solution. So you might actually say that the Lumetallics kit is closer to the public health relevance than the X-rays that go several millimeters down.
Thanks. And Rangoli, you had this package of interventions. So obviously, statistically, you can't tease out exactly what was driving the effects. But if I asked you to speculate, do you think it's the water filtration or the nutritional supplements or the information? Do you have any sense? Or?
If you specifically ask me, because we are not assessing prenatally, we are assessing postnatally, 3 to 12-year-old children, I would, in my opinion, would like to say that nutritional supplementation is a better suggestion as compared to water filtration, because they were somewhere running from deficiencies. And those deficiencies were there, and when they consumed lead in any form, be it from water, be it from the soil they are having, their agricultural practices continued. So that nutritional deficiencies accelerated to that lead absorption in the body, which led to lead toxicity. If they would have nutritionally better profile, they wouldn't have that much high profile in terms of lead amount. So in my opinion, nutritional supplementation was much better intervention as compared to water filtration, but definitely it added on to the outcome. It added on to the profile. It added on to, like, educational campaigns were also there. They also added on to the results. But somewhere I believe nutritional supplementation played a very major role, because calcium, iron, zinc, all three of them have already existing literature review so as to reduce lead toxicity in individuals. So yes.
Okay, great, thanks. Let's take a couple of questions. There's a hand right at the back over there.
First of all, just thank you all so much. It's really exciting. Whenever you have a session where there's a few no-regret solutions, that's very exciting, to hear at this point in the day. I guess one thing I'm wondering is sort of, my experience, I'm at a university, is, if I'm from a university and I want to try and talk about no-regrets public health solutions, governments aren't very interested in what universities have to say a lot of times. And I'm wondering if there's any process or plans or opportunities to sort of synthesize and pull together some of these different evidence-based solutions, particularly the ones around primary, secondary, tertiary prevention, for populations, occupational settings, and feed those to somebody like WHO or somebody else who maybe governments would see as an amplifier of these types of messages, if, rather than, sort of having a study here and a paper there. Anyway, just curious.
Should we take another here?
Thank you so much. It was a very interesting and impressive presentation. My question, and to hear your reflection on the ethics perspective. When you are doing blood level, you might find children elevated lead in their blood. So are you leaving them behind, or just doing, or what should be done? Because this is one of the things that we have been in a problem while doing blood level assessment. Thank you.
Let's take one more. Yeah.
Thank you to all the presenters. My question is to Perry. Just beyond your presentation, I'm trying to link what you have done from mining to batteries, and you are also amongst the first people long ago to study the cookwares in Africa. My question is, there is a very big mix of participants here, from university researchers to practitioners. I am a practitioner. In all the researches that you did, what is the challenge to go beyond the research, beyond the results, thinking that we have at least enough data to show that lead is a problem? What was the challenge to practice, to act on solutions of those problems? And what message would you tell us to solve those problems? From cookwares, batteries, paint, or mining, what shall we do to to solve those problems from the practitioner point of view?
Who wants to take any of those?
I could start with the last question then, in terms of, I think you raised an important question in that, when do we have enough information to act? And I think, in most cases, we don't need perfect information in order to reduce exposures. And, if we're talking about an environment where you can't eliminate the exposure, which is always the first choice, like with lead paint, that's always the first option and best option. But in an example like I presented here, where we can't eliminate the exposure, we could make it safer. And we could do that with these very simple measures. And we don't need to have complete data in order to implement these kinds of improvements and to reduce these exposures both in the workplace and communities.
Lex Rungalu, so the other two questions were, how do we get the message out for universities, and what are the ethics of?
Right. So on the ethics, we had a budget line in case we encountered some blood lead levels above 45 microgram per deciliter to pay for the chelation. So that was our plan there. And on the dissemination of the results, as my poster in the back shows, I believe very much in working with schools. So we're talking to the government. Côte d'Ivoire is about to have elections, so people are distracted by that right now. But in terms of getting kits used more widely, I think the education system, the Ministry of Education, is a real important pathway, because not only is it kids making measurements that are environmentally relevant locally, but they learn about science, they learn about replication, they learn about measurement. So this is something that I'm thinking about emphasizing more in the future years.
I would like to take that question. I would like to answer it from my point of view, like what happens in India. Like, for example, if I talk about this research, initially there was a descriptive study based on the prevalence of Burtonian lines. So when this question came up that if Burtonian lines is an oral manifestation of lead exposure, and Haryana, that is my state, that has got potential amount of lead in the children, so why not proceed with conducting a descriptive survey for the same? I approached my Dean of Research. Further, she made me make a whole proposal based on this, what all budget is required and everything that needs to be involved in terms of ethics, in terms of routine follow-up, in terms of everything. Then I got a grant from Sanrachna Foundation. Basically, that's a government level grant that I received. So if we want to approach something like WHO, I believe we need to begin from the roots. First approaching our core area, first getting the whole literature review, getting it summed up, proceeding towards what can be done at a state level or a district level, then we can get it implemented towards a national level, and then we can approach chain by chain, step by step. It will get recognition and it will get grant likewise. So that is in my opinion. Also, my branch is public health industry. So while you talked about primary intervention, secondary intervention, tertiary prevention and everything, when we channelize it from someone's point of view who deals with these things, it already gets a better alignment. So in my opinion, getting in touch with public health strategy makers would always help you get into what can be the real solution, real world oriented solutions. Like in my case, the study which I did was in the villages. So my university, when they gave me that ethical approval, they were pretty much convinced that, okay, even if you won't be getting a positive result in terms of blood lead exposure reduction, you'll be giving the nutritional supplementation. So if not in the longer run, yes, they are getting nutritional deficiencies covered up. So that ways, I guess, it was channelizing into the real world and making it oriented from that point of view is a better way to reach particular whatsoever you're aiming for. Thank you.
Unfortunately, I think that we're at time now, but I'd like to say thank you to all of our speakers for great presentations.
All right, thank you, everyone. So we now have a well-earned coffee break for the next 30 minutes. We'll reconvene here at 3:45 for our final panel and a half of the event. As a reminder, please do bring out your garbage with you. If you are a speaker at the next panel, please meet us outside about 15 minutes beforehand for your mics, and we'll see you again soon. Thanks. All right, everyone, welcome back from your final break for the final session. If you guys can all join us back in here and wrap up your coffee breaks, please. Give a moment for people to come back in the room. All right. Well, welcome back. This is our final research session of the day, and we're going to go directly from this into our final session of the day, which will be a bit of a wrap-up. But for this, we're sort of pulling it all together. So we've heard about lead surveillance. We've heard about source assessment. We've heard about solutions, mitigation, in old and new sources alike. But what does it mean to be sitting in a country and trying to tackle the entirety of all of your lead exposure challenges, end to end, across sources, across everything that's happening in your country, and to help make your citizens safe, free of lead, and happy with you as the country's leaders as well. So I'm pleased to kick off our final panel by introducing Dan Cass, who is the Senior Vice President of Environmental, Climate, and Urban Health at Vital Strategies, where he leads a team working to use the tools of public health to address environmental threats and ensure healthy and sustainable outcomes for people living in an increasingly urbanized world. He has a very long and distinguished career. He served as Assistant Commissioner for the Bureau of Environmental Surveillance and Policy with the New York City Department of Health and Mental Hygiene, prior to his appointment as Deputy Commissioner for the Division of Environmental Health Service. He brings us expertise in New York City and the American context to now help provide technical capacity to abroad to help address environmental threats, particularly in low and middle income countries. So Dan, thank you, and over to you.
Thank you. So as the last moderator of a scientific panel, I do want to take a prerogative just for a moment to thank Rachel and her team at CDG for what is, obviously the best and first scientific meeting on lead poisoning, but also one of the best scientific conferences I've really ever attended. I've learned a tremendous amount, so thank you so much. So I'm really excited about this last session. We have a chance, as Rachel said, to hear from 3 distinguished investigators and practitioners about how they're tackling national level questions that are designed to inform priority setting and policy actions and improved characterization of sources. So just quickly, Dr. Zimba will present her findings on a novel mixed method approach to characterizing geospatial differences in exposure risk and the capacity to respond to those risks. Dr. Tamayo Ortiz will describe the process and outcome of the development of Mexico's action plan for comprehensively addressing exposure and clinical management of lead exposure. And Dr. Raudza will describe follow-on studies to Georgia's seminal work on blood lead surveillance and source control to better characterize and apportion sources of exposure. So let me introduce our first speaker. Dr. Chifundo Coleta Zimba is a doctor of nursing, trained as a community health nurse and midwife, who has gone on to a global health and healthcare systems career as an expert and researcher. She is the executive director of the National Organization of Nurses and Midwives of Malawi, and she's adjunct associate professor at University of North Carolina, Chapel Hill School of Nursing and at School of Social Work's Global Social Development Initiatives. She's led multi-country and multi-site health interventions, including Malawi's first prevention of mother-to-child transmission of HIV, mental health integration into non-communicable diseases, and USAID's National Lead Exposure Risk Assessment. So thank you very much, and please come up, Dr. Zimba.
Thank you, Dan. So I'll be presenting on the lead exposure. This was an assessment supported by USAID. So my presentation will be on the insights that we learned from stakeholders. We also did environmental observations, geospatial mapping. So as I said, the research was made possible by the support of the American people through the United States Agency for International Development and that contract. So the contents that we are presenting are the sole responsibilities of us as authors. So this is my outline. I'll quickly go through the background, objectives, methods, findings, recommendations, and conclusions. So as we have been discussing since yesterday, we all know that lead is a major public health concern, especially in Malawi. And this is because of rapid urbanization, industrial activities, and also mining operations. The waste management and improper handling of hazard materials also contribute to this concern. There have been studies that have been done in Malawi that estimates that 3.5 million children in Malawi, they have blood lead levels that exceeds 5 microgram per deciliter, and over 500,000 of children, they are having levels of over 10 micrograms per deciliter. And we all know that the children are particularly vulnerable as exposure can irreversibly affect their neurological development, leading to cognitive impairment, behavioral problems, and also reduced IQ. We also know that the adults are at risk with lead exposure that is linked to the reproductive health issues, the kidney damages, hypertension, and also cardiovascular diseases. In Malawi and in other maybe parts of the low-income countries, environmental lead contamination is widespread with elevated levels detected in soil, water, and the household dust, especially near the Europe sites, the mining areas, and waste disposal sites. In Malawi, there have been studies that have tested the environmental samples in those areas. Lead concentration in Malawi's agricultural soil is also extremely high. Malawi relies much in agriculture, and we use a lot of fertilizers. And our colleagues who are also in here, they are also working hard on elimination of lead, especially in paint. And their study, the 2023 study, they found that there is tremendous reduction in lead, especially in paint. That falls from 67% to 24%. But despite the progress in paint regulation in the country, lead exposure remains the problem, especially from the other sources of contamination. So for this study, we conducted a qualitative and geospatial mapping of the high-risk areas. We assessed the exposure risks, testing capacity for both blood and environmental, and we identified the targeted population for both environmental and blood lead, and we developed actionable strategic plan. So just to talk about our approach, it was a mixed methods. We did comprehensive desk reviews. We did geospatial mapping. We observed the environment. We consulted several stakeholders. And in the consultation of stakeholders, we did in-depth interviews, focus group discussions with officials in the government. We focused on the principal secretaries and directors in the industries that are working on the batteries and paint, the community leaders, non-government organizations, and also in the academia sector. So we focused on the 4 major cities that the country has. That's Lilongwe, Blantyre, Zuzu, and Zomba. These cities represented the diverse regional and industrial activities that are happening there, especially in the informal used lead acid batteries. And on environmental and geospatial observation, we systematically observed the environment within the Europe recycling and waste disposal sites. And for the geospatial mapping, we collected the XY coordinates for the Europe and waste disposal sites. And for the mining location, we verified it using the literature and also using the Google Earth. And we pointed the water points and the schools. We sourced this data from the national data. So this is our analytical methods. For quantitative, we did thematic analysis. And for the geospatial analysis, we identified the high risk and then the proximity of these high risk with the water points and also with the schools. So we assessed community exposure risks through that. Our key findings for the geospatial mapping. So we identified 92 sites. All these, they are doing informal battery recycling. We had 14 out of 19 that are, I can say, big shops or companies, but they don't have the trade certificates to be doing recycling of these batteries. And the others are small scale, located within the residential areas done by our local community members. And we also identified the schools that were within 0 to 100 meters of these high-risk areas. For the water points, there were 605 that were within this range, and for the schools, we identified 484 within 0 to 1,000 meters. And all these four cities, they have the waste disposal sites that is not well controlled, and that was also identified as one of the risky areas. And those sites, they are located within the residential areas. So this, we came up with the maps. So we know exactly where the mining sites are, where the URAB recycling sites are, where the water points are, and where the schools that are close to that are. And we have the data that is citing to that. And on the potential high-risk areas that we identified that can be marked for future environmental and blood lead testing. So in all the cities that we went across the country, we have identified specific residential areas where this risky behavior is being done. And those areas that written there, the names of the communities where people live. So area 25, area 49, Kawade, they are the names, the residential names of the communities. And within the central region where Lilongwe is, we identified 61 schools and 31 water points that are within 100 to 1,000. Likewise, in other cities across the nation, we also have the areas that can be targeted for both environmental and blood lead testing. So this is the same as the other side. And on the population that we have identified for the targeted blood lead, we identified that the recyclers, the workers who are working in the URAB recycling industry and their family members, they are at risk. The children that are attending nearby schools, the women within the reproductive age group, the residents that reside close to the URAB sites, and also the residents that resides close to the general waste disposal sites. There are also waste pickers within the waste disposal areas. They pick waste for several use. Some of them, they use it for manure. So they are also at risk. And in other areas, apart from these cities, we identified the miners and their family members, those who are working in the processing of lead, so the crushing, the milling, the smelting, and also the residents that are living close to the mining sites, they are also at greater risk, including the children. These are the pictures that we took when we are doing the observation. So picture A, it is somebody's residential place. You can see the batteries are being recycled there. And on the mat, there is maize flour. In Malawi, we use a lot of maize flour for food. And then you can also see the children on the door. And on picture B, the buckets, they are holding water for drinking. Picture C, they are using local charcoal burner to smelt the lead. And on picture D, the children are visiting their father in the shop, and they are playing there. They are doing all sorts of things in that shop. This is one of the local brother who is in the Europe recycling site. You can see they are working without protective wear. And when we asked them about the health problems, apart from the cracks that you are seeing, they are also complaining about breathing problems, the eye irritation, the burns with acid. Yeah, so that's also another photo that we took. And on this picture, you can see those children. They are living there 24/7. That's where that's their house. And then it's the same compound that their father is doing the battery recycling. So on the stakeholder consultation, we talked to 143 stakeholders. And as I said, and the findings from the stakeholder consultations, we found the regulatory gaps, the lead exposure risks, the testing capacity problems. When the testing capacity, at least in the environmental samples, there are some universities, Ministry of Water and Sanitation, and Malawi Bureau of Standards they are doing, but for the blood, there is a greater limitation on that. And there is a greater limitation on the awareness. So these are just the quotes that people were talking about. And this is what I already talked about. So the recommendation and the next step. We are thinking as a country we need to strengthen the regulation framework. We need to develop specific regulations for informal Europe recycling, enforce environmental and safety regulation, and formalize the sector. We also need to enhance the targeted testing and monitoring capacity for both environmental and blood. And for the blood, we are thinking that if healthcare facilities can be equipped with portable blood lead testing equipment, that can help, and also deploy mobile screening to reach out the people in the communities, in the at least communities where they are not close to the health facilities. And we also need to improve the public awareness and education and collaborate with the stakeholders for multi-sectoral action. So we need to form a multi-sectoral lead mitigation working group that needs to be working on this in the country. Yeah, and for future research, we need longitudinal health impacts, socioeconomic mapping, and lead exposure pathways. So just to sum up, we have identified that lead is not just an environmental issue, but it's a public health crisis that is affecting most vulnerable, especially the children. And we need a multi-pronged solution for us to mitigate the lead. And for this to happen, we need to revise our hazardous regulations, policies. We need to engage the communities, and we also need to build the capacity. We feel that together we can work on this that we think is a challenge, but we can turn it into an opportunity to create a healthier and lead-free communities for our future generation. Thank you.
Thank you so much for the inspiring talk. We'll have a chance to talk a little bit more with you in a moment. Next up is Dr. Marcela Tamayo-Ortiz. She's a medical doctor and an environmental and occupational epidemiologist whose work currently focuses on the maternal child health effects of environmental, occupational, and psychosocial exposures. She's an associate professor at the Mailman School of Public Health and part of their wonderful Children's Environmental Health Center, which is sort of, for those of you who don't know, she works with a sort of one of the largest and longest cohorts of maternal child pairs doing remarkable research. Currently, she's focusing on women's environmental and occupational exposures and bone health and body composition. And prior to coming to the Mailman School of Public Health, Dr. Tamayo-Ortiz was the head of the Occupational Health Research Department at the Mexican Social Security Institute, which is the largest health and social benefits provider in Latin America. Please.
Well, thank you all. I would like to start my presentation by saying thank you to CDG for having me here for this opportunity. Thank you all for still being here. And thank you all for these fascinating days. It has been fascinating learning about everything you're doing and also to be able to meet you in person. So I'm going to be talking today about this work that is not only mine. It's from many, many other researchers and activists and many people working on this program for the control of lead exposure in Mexico. I have no conflict of interest to declare, and this program didn't receive any direct funding. So in 2019, this Vivir en un Mundo Químico, a collaborative, came together with the idea of regulating chemicals in Mexico, because we don't have that. We wanted it to be something like REACH in Europe, you know, and so we were endorsed by the General Health Council in Mexico, which is the highest health authority in Mexico. And of course, more or less around this time, we were able to publish the first data on lead exposure, blood lead levels in Mexico. And as my colleague Sophia has shown you, this is the same data shown by states, 32 states in Mexico, where you can see clearly how the distribution of these lead intoxication levels above 5 micrograms per deciliter in children between 1 and 4 years old. You can see that in some of the states, it's almost 50% of the children that have high lead intoxication. And in the green bars, I want to call your attention to the use of leaded pottery, right? So when we put our minds together, we're like, well, where should we start with this regulations? And so, of course, let's start with lead, right? And so in 2019, the General Health Council approved this program, Immediate Action Program for the Control of Lead Exposure in Mexico. And I'll be talking to you about each of these research of action lines. They're all very comprehensive, they are all interrelated, and one cannot exist without the other. They have to talk to each other. So the first line is the review of the regulatory package. As we've seen, this is key. Then what do you do when you have children that are intoxicated or people that are intoxicated? So we created a clinical management protocol. Then how do we change this generalized source of exposure? Our integration of an epidemiological surveillance system for blood lead surveillance. And then, of course, health promotion strategies. So all of them have to go hand in hand, work together. And as I said, this is only a very short list of the extensive people, like a very long list of people that have been working in this program throughout the years. So line one, the review of the regulatory package, we started and reviewing everything that exists out there, okay? And so there are about 30 regulations related to lead. Of course, they tackled different things, you know, but we started with the ones related to the leaded pottery as something that needs to be reviewed urgently. And of course, our lead criteria for children and the general population. I'll be talking to you more about the reference values for the lead concentration in blood. This is currently 5 micrograms per deciliter for children that are 15 years and less, for pregnant women and nursing mothers. But the rest of the population that is non-occupationally exposed is 25 micrograms per deciliter, which is really high. So this is what we proposed. And we officially constituted a working group with COFEPRIS, which is like our national FDA, in 2022, where we proposed to reduce this criterion value to 1 microgram per deciliter. Open your eyes. 1 microgram per deciliter. And so we want to, the idea is to really protect everybody. Okay, so not only children under 5-year-olds, but also children from 5 to 15, pregnant, lactating women, and non-occupationally exposed people would lie within this criteria. So here is a protocol for the clinical management. It's out there, it's published, and we know that several of our colleagues at EAMS are actually using it already. It's a clear guideline of how to tackle this when you have clinical cases of intoxication. This is perhaps the line that I've dedicated over 2 decades of my work, working with the lead pottery. Somebody before asked Sophia why this is a problem, and I think that it's convenient, but also like it's part of our culture, of our identity. I dare anybody who goes and eats in the Mexican restaurant, you might be served food in these pottery, and it's beautiful, it's inexpensive, and it's really part of our culture. So it's been very, very hard to tackle this. So we put together a project with all the institutions that you saw before that had a member of all the sectors that we thought had to be included. And this was 3 overall lines: environmental health, materials, social, and anthropological. I'm not going to go into the details, but everything we thought had to be included. It's not just changing the glaze. It's also like, then what happens? Like, where are these potters going to sell their new pottery? And what happens if it doesn't work? And so, like, everything, very comprehensive. Unfortunately, like, we were promised some funding. Didn't happen. However, what was very good is that FONART, the late director of FONART, was very engaged with this. And so finally we have a seal by which that is endorsed by COFEPRIS, and so that if you eat in a Mexican restaurant, you might lift your plate and then see, like, does it have lead or not? Because you will not know if it has lead or not unless we have a seal. So finally, this is still, it went out just a few years ago, and now it's up to COFEPRIS to keep it ongoing. And this is part of what FONART was doing. They were doing these beautiful exhibitions where you could buy lead-free pottery, and that had the seal. So more and more workshops are turning into this lead-free pottery, but there's still only a very few percentage of the workshops. And this is because many of the workshops are scattered around Mexico. They might be tiny, like the battery recycling, right? They're tiny workshops where mom and dad work there with the kids, and so we still have to do a lot out there, especially to identify them and then be able to work with them. So for the 4th line of integrating these epidemiological surveillance systems, as we've seen, it's crucial to know what are our blood levels, right? So we are tackling this, suggesting that this is tackled by, as you saw the graph that I showed you, where those states that have the highest prevalence of lead exposure, like, we should tackle them first, right? Because that's where most of the problem should be. But then we have 2 implementation complementary axes. One where we will identify at an individual level these cases with lead intoxication and then provide them with a clinical follow-up. And the other is that to incorporate in our National Health and Nutrition Survey other populations like adolescents, women, and older adults, right? Because remember that lead that was that is now in our bones, it comes out later at our age, right? And then the 5th line that I've also been very involved in is like health promotion strategy. So how will we communicate this to the public? And so while I was still working at EAMS and together with a lead prevention poisoning week, Poison and Prevention Week of 2022, we created this exhibition that was at the National Mexican Social Security Institute. It was in the entrance where thousands of people pass every day. And we worked together with Pure Earth, with Little Things Matter to create these posters that were actually used later in several international conferences and at the retreat of the International Society for Children's Health and Environment. And so they're available and they're very beautiful, they're graphic, and the idea was to communicate to the public in very simple words the health effects of lead. And for example, this, like you cannot distinguish easily which one has or doesn't have lead. So look for the seal, and if you're not sure, ponle flores, no frijoles, use it for flowers, not for beans, So if you're unsure if the pottery has lead, just don't use it to eat. And so this is the center that I'm talking to you about, and this is what the exhibition looked like. We had all these posters and lead-free pottery there so that people could see how beautiful it is. And lastly, we worked on this massive online course with EAMS. This is a platform that was created during COVID, and it reached thousands and thousands of people. And so we created this program that is free. It's a course that is directed for the general public and also for clinicians. And so it's out there, and up to now, like over 10,000 people have taken the course. And so I would like to finish really with saying that we are all part of the difference. I alone cannot do this. Nobody here can do it by themselves. So I think that, political will is important, but also how everybody takes a part of it in this. So you can make a difference. Thank you.
Thank you. Our last speaker is Dr. Ekaterina Rausa, who's a medical doctor trained as an epidemiologist and holds a doctorate in public health. She serves currently as the Monitoring and Evaluation Officer at the National Center for Disease Control and Public Health in Georgia, where she oversees the implementation and impact assessment of a large-scale HIV prevention program supported by the Global Fund. Her research has centered on environmental health with a particular emphasis on lead exposure in children, and as principal investigator of several national studies, she's developed and led field investigations, data analysis, and stakeholder engagement efforts, resulting in a lot of publications with a lot of impact. She also supervises the Medipet Field Epidemiology Training Program, which is kind of near and dear to my heart. So thank you.
Thank you, Daniel, for presenting me. Good evening, everybody. I would like to share findings from the lead exposure source identification project, which was conducted by the National Center for Disease Control and Public Health in collaboration with UK Health Security Agency and PureEarth. A national representative survey of 1,578 children conducted in 2018 showed that 41% of Georgian children had blood lead level at or above 5 micrograms per deciliter. The highest prevalence, from 61% to 85%, was observed in Western Black Sea coastal regions. In children living in the east part of the country had comparatively lower blood lead levels. It should be mentioned that before this national survey, we had a few small-scale studies. Those already indicated elevated blood lead level in Georgian children. In response to these findings, in 2019, Georgia launched a national state program. With the support of UNICEF, we developed and piloted a lead surveillance system in 2022-2023. As a capacity building activities, we also started developing a lead isotope ratio method to identify the possible sources of lead exposure with the help of PureEarth and UK Health Security Agency. In parallel of environmental agencies also implemented steps to reduce lead contamination in spices. And there are studies both showed a high level of contamination of spices, Georgian spices. For example, a market assessment, which was conducted from 2020 to 2022 with the support of PureEarth, showed that out of the selected 765 spice samples from 29 Georgian cities, 46% of them had elevated lead level above the reference value, which is 5 micrograms per kilogram for Georgian standards. The vendor interviews also indicated issues of supply chain and intentional adulteration of spices. These findings also contributed to stricter food safety regulations implementing from 2018. The collaboration between NCDC and UK Health Security Agency began in 2019, and we're aiming to develop lead isotope ratio methods to identify the priority sources of lead exposure. In this proof of principle study, we found that samples like soil, dust, and spices and paint were isotopically indistinguishable from lead, blood lead. We also found that samples like water, milk, and flour were not the sources of lead exposure in Georgian children. Following this proof of principle study, we initiated pilot study in the Black Sea port city of Poti. The aim was to measure the blood lead concentration in children. Also, we wanted to compare our findings in Poti to the mixed findings, and also to find predominant sources of lead exposure that might be specific for this region. And all these activities were implemented together with capacity building activities of NCDC laboratory through staff training and implementing all the analysis in Georgia. We focused children 2 to 7 years of age. We included 63 children from 50 households. And even though that was a pilot study and the sample size does not allow us to talk about representativeness, we still wanted to make sure that our studies are, we include all zones of Poti, children from all zones of Poti, and that's why we employed this probability proportional to size method to include all whole city. We selected samples with soil, household dust, spices, and paint, and we also tested salt and sugar with XRF method, but we did not find any exceeding level, or in many cases it was undetectable. Analysis of whole blood revealed that only 2 children out of 63 had blood lead level above 5 microgram per deciliter, which is about 3%. And additionally, 13 children had blood lead level above 3.5 microgram deciliter. Environmental analysis, let's compare it with the findings from the mix 2018, and this comparison showed that there is a 70% decline of geometric mean of blood level. In the mixed study, we included 38 children from Poti, all right? And their geometric mean was 7.5, and in our case, it was 2.0. So that's a huge decline. Environmental analysis also showed remarkable reduction of lead concentration in spices. Only 2.3% of spice samples exceeded the reference value of 5 microgram per kilogram. The highest exceedance level was observed in paint samples, followed by soil and the dust samples. And if you look at the lead isotope ratio graphs for these 2 children, those exceeded the blood lead level, 5 microgram per deciliter, we notice that it's mainly dust that shows isotopical match with blood lead, and also in one child which has blood lead level above 10 microgram per deciliter, it's soil as well. The Poti pilot study was followed by the representative study of Guria. In this case, we really wanted to measure the prevalence of blood lead level in a representative sample for this region. And we wanted, of course, to compare our findings from the mixed findings and to find the predominant sources of lead exposure in Guria. We used the stratified random sampling to assure representativeness, and the sample size calculation told us that we have to include 300 children. We actually concentrated, again, for children 2 to 7 years of old. We did our random selection using Stata 18, and we actually selected based on urban-rural and sex distribution and age distribution as it was defined. according to the protocol. And we only collected only 4 types of samples, which is dust, soil, spices, and paint, based on the findings from proof of principle study and POTI pilot study. And this map actually shows the distribution of children. The concentrated red dots are urban areas, the rest are rural areas of Goria. Our studies found that only 14 children, which is 4.6%, exceeded the reference value of 5 microgram per deciliter out of this 300. And 37 children included the reference value of 3.5 microgram per deciliter out of these 300 children. The highest blood lead level in this case was 14, and low was 0.8. And again, if you compare it to the findings from the mixed study, in this case, we also see the reduction by 75%. From 8.4 microgram per deciliter of geometric mean, it reduced to 2.1 microgram per deciliter in geometric mean. And again here, in analyzing the environmental samples, we had a similar findings as in POTI, with very low level of lead concentration in spices, highest in paint, followed by soil and dust. But it's notable, it should be mentioned that in case of Goria, the proportion of exceedance in dust was lower than in POTI. And if we look at the lead isotope ratio graphs, it's actually a mixed picture. Well, even in spices, the lead concentration was very low. Isotopically, it still showed some resemblance with blood lead together with dust. In one case, out of these 14 children, we saw that it is a dust and soil. In only one child, it was only soil that showed a resemblance with blood lead. In 3 cases, our lead isotope ratio analyses were not conclusive, meaning that we did not sample enough, or we did not sample that environmental samples that caused the high lead level. In conclusion, so what we are observing is that there is a reduction from 2018 to 2023, which is very encouraging. However, we still have blood lead level in Georgia, and many children have above 3.5 microgram per deciliter. We also observe a reduction of lead concentration in spices, which is also extremely encouraging. Just looking at the analysis of POTI and Goria, we might having a different predominant sources in different districts and regions in Georgia. Even Georgia is a small country. There might be maybe in POTI that might be mainly dust that causes the elevated blood lead, and in Goria that could be a mixture of everything. And of course, we need a national representative sample to actually see what's happening in the region, where initially we mixed found the low prevalence of elevated blood lead level. And of course, we need to carry on with our questionnaire analysis, and we have to do other lead isotope ratio analysis to see what's happening in children below 5 microgram per deciliter in order to direct our future work. Okay, thank you. And I'm extremely grateful for all of this papers. So the job could not be done without the support of UK Health Security Agency and PRF and National Institute, and a lot of my colleagues both support, and they are behind this presentation and all of the work we do. Thank you.
So those were fantastic presentations, all reflecting a different way in which each of you are really trying to bite off a very big chunk of the lead problem in your countries, and it's admirable and I think instructive for the rest of us. Let me start with a question for you, which is in Malawi, which is what kind of audience are you finding for your findings? You know, you've laid out a very strong case for the need for national action. You've covered a lot of different components of what really needs to happen. But it wasn't a government-led effort. And so I'm wondering if you could talk a little bit about the reception of this so far.
Yeah, thank you. So we are targeting a wide range of audience, starting from the government itself, because we feel that several sectors in the government needs to come together to work on the regulations, to work on the, to reinforce guidelines on the occupational safety. And we are also targeting the schools to work on the curriculum, to work on the development of the curriculum for the informal sectors to formalize the batteries. We are also targeting the general population. We found that there is no awareness in the country, so the general population, including those who live in the at-risk areas and the at-risk populations that we have identified, need to know that there is a problem and how to prevent them. We are also targeting the health workers. The health workers, as I said, in the testing capacity, it is better in the environmental testing, but in the blood testing, we learned from the health workers that we interacted with. They said that they are now maybe seeing the strange symptoms and the signs and symptoms to the patients, but they don't know what is what's the problem. And for the lab technicians or technologists, they told us since they learned in schools, they have never tested that. Of course, they do other chemistries, but they don't test lead. So we are targeting a wider range of the audience in the country in order for us to tackle the problem of lead poisoning.
And how confident are you that you'll get the level of support, resources necessary to, even in these high-risk areas, to do this?
As I'm confident because there is already a political will. Our president, the president of the country last year when he attended the United Nations General Assembly, he signed a commitment on the lead-free. And through our interaction with the government officials, I mentioned that we talked to the high level, the principal secretaries, the directors. The only challenge that we noticed is lack of awareness and also lack of resources. For the environmental testing, we have very good lab structures housed within the Ministry of Water and Natural Resources. And we have the trained technicians who are working in those labs. But the challenge they told us was the reagents. And we have machinery in the Malawi Bureau of Standards, but the challenge was the geographical reach, and they are also focused. They only focus on the food and the other samples. We have the lab and the technical knowledge within the academia, but they are only focusing on their academic cycles. So we need all these to come together to maybe develop a national intervention. Yeah.
That's great. And speaking of national interventions, Marcela, you've set this wildly ambitious goal, a reference level of what? And so two-part question. First is, in the US, a reference level actually represents a population figure for the highest sort of 2.5%, I think it is, of exposure. You're setting it as more of an action level, it sounds like. Exactly. So talk about that. Like, how did you set it? How is it received? And how are you gonna act on levels that low?
Yeah, so I mean, I know that this is very controversial, and when we were working on this group, I actually got stopped. It's paused for a while. We hope it starts again. You know, we thought like, well, we all know here, right? Like, there's no safe level for lead, right? So why would we set a standard that is not entirely protective, right? So I think that with that in mind is like to do what is right, right? And then several of the people in Mundo Químico have worked a lot with like setting the national air standards. And so with that as an example, like, you know, like before, like industry would be crazy about that, right? Like the industry would fight back. You know, you cannot set that standard because we don't have the technology. So here's the challenge, right? Like we need to challenge ourselves with those standards. So I think that that's the point, you know, to protect everybody and to make it a challenge for the country to comply with it. I know that it comes with a lot of controversy, you know, like, well, I mean, if you set it so low, then people might just not comply. I mean, we don't comply with the 5 microgram per deciliter, right? But I think that that's the way to start. And also bear in mind that, I mean, these regulations get reviewed every decade. You know, putting together like the whole system to do these reviews takes a long time. You know, so if you set it at once and for all, like, you know that that's going to be the case, right? Mm-hmm. And I also think that marrying to, I mean, one of the things is the portable, you know, like how do we test lead, right? So that's a challenge for technology too, you know, like let's invest in creating this technology that will be able to test in the field these very low levels. Because again, like many of you have done the work and know that there's health effects even at very low lead levels.
Yeah.
You know, so that's the idea behind it.
Yeah, it's quite a goal. You know, I think about the duration of time it's taken to reach levels even in the United States. Our current, you know, we're at that level basically, sort of at a population level, but it was 40 years of regulations and action to sort of get there. But I'm hearing you say that like set the goal and develop action plans to basically get there and monitor its progress.
Otherwise you want, I mean,
yeah.
Right?
Katerina, your work is really interesting. You've picked a couple of places in Georgia to demonstrate this source apportionment strategy. At the end of your presentation, you described the importance of basically replicating this. But one of the things you pointed out was that you mostly are able to sort of characterize the sources for the higher levels of exposure, but that it's important to also characterize sources of exposure for the lower levels. So what are your plans going forward to get there?
Thank you. Well, what I presented is preliminary. We have not finished the analyzing of the whole GURIA findings yet. Yes, that's interesting thing. What we found is that sometimes when there is a high lead concentration in a certain, for example, in paint or in some other exposure, that might not be the isotopically close to the blood lead, which indicates that is probably not the source. However, there might be a low level, even lower than reference value of exposure, and then might be isotopically close to the blood lead. So actually everything is about how much you are exposed to a specific thing, specific exposure. And I think the future direction will be to explore that sources and to actually find out whether this isotope ratio analysis, do they work well for the low concentrations as well as for high concentrations. So that's the question we need to answer. And of course, even though that the UNICEF study, we saw that there is a low prevalence in east part of the country, so we don't know what's happening there. So we still need to find out on national level and what are the exposures there. Yeah. So what we think that there might be, as I mentioned at the end, Georgia is a small country, but we might be seeing a different predominant sources in different regions, based on the culture, based on the consumption, even spices, based on the, we don't have now factories, etc. But in the old ones, we have some ore somewhere. So all these things should be taken into consideration. So a future is, just to know what's happening in the low level of exposure samples, and what are the sources of exposure in children below 5 and below 3.5 microgram per deciliter. Yeah, because there is no safe level of lead, as we said. That's an actual level, what we call this 3.5 and 5 microgram per deciliter. Yeah.
Terrific. Are we out of time, or any sort of like one or two pressing questions? Okay, let's go.
Going back to the issue of the reference level, the standard, is the problem in part our inability to think of it as in terms of a sliding scale? Because you mentioned yourself, Marcela, the issue of prioritizing. If you set it very low, people sort of get discouraged. I was always impressed by this idea of setting it relative to a population proportion. I thought that was a step forward. But if you stick to the binary, you're always going to have this problem. Do you see any prospect of saying, well, if we have someone with 50, we should address that first, and then 10, and then 5? But the sliding scale, I don't know why we have trouble in instituting that.
So you mean that we should have like different reference levels for different?
No, it should be a number rather than yes, no.
Sure, but I guess that this is a very, I wouldn't say easier way, right, to say you're intoxicated. I mean, right? I just can't imagine the challenge that would be for surveillance and for enforcement, right? I think that that's kind of like when we have this set number, then you know that if you're complying or not, right? Like, and so if we would have, it might make more sense, like you're saying, right? But I think that that's the idea behind setting like a binary, you're intoxicated or not. And plus, I don't know if you're intoxicated really with, but yes, that's, if we know there's no safe level, like that's the idea behind.
Okay. Well, thank you very much. And we'll turn it over to the final panel. Rachel?
Thank you, guys. That was great. Okay, great. Thank you. All right, well, thank you for that. And quick change, we have a new format, the fireside chat format. We should have a fire in the background. We've obviously had a lot of great research, I think a dense program, but a really rich one. And I hope this has been helpful, informative, inspiring, sparking to all of you. I think I have a lot to digest. I think maybe we all do. But we thought to have this chat at the end of the day to try and pull together some reflections, thoughts on what we've heard. And I'm here today with a key audience of a lot of our work, if we are trying to be policy relevant, because this is Tom Hurd, who is the head of grant making at the Lead Exposure Action Fund. So he is in a position where he is constantly using research, evidence to weigh decisions and think about what the most effective ways would be to mitigate, prevent lead exposure. And so we're really grateful to have him here today, and can you give him a round of applause to share his thoughts. Thanks. All right, so let's keep this kind of informal and casual, but maybe just start at a high level. So we just listened to a lot of research, right? Are there any findings, themes that stick up to you, maybe something where you've updated your priors or you've found some new piece of knowledge that feels particularly important?
Yeah. Thanks, Rachel, and thanks everyone for still being here. It's great. There's a lot. I think I think some of it is reinforcing, which is encouraging, of a lot of our beliefs and views already. I think the need for nationally owned, larger levels of national data across blood lead levels and source ID type of work is really strong. But I think we also saw lots of the power of data linkages to other types of data, so the sort of environmental data, some of the soil work education outcomes. Yeah, the power of those data linkages throughout was kind of a theme for me. I also thought there were sort of highlighting that there's still a lot of questions around source apportionment and a lot of like sort of attempts at different parts of that map. And that's really encouraging to see. That's something we think about all the time. Yeah, so I think on that side, I think we've sort of had strategies around paint and spices. But I think ULabs in particular, I think the proportion of the burden that might be associated with ULabs is something that we've seen build, but I think is like really coalescing into something that we need to take very seriously. And also not to ignore, a lot of really interesting updates and pieces of research across a bunch of other source verticals, cookware, soil, paint, updates, as well as ULabs and spices. So yeah, we were in the sort of source vertical mindset that we find ourselves in often. There were some great updates there. I also think the theme was, we saw a lot of really good examples, and one of the things I love about the lead field is using research as advocacy or in tandem with advocacy. Yeah, so tying it directly to government initiatives or involving them, involving others was a feature of a lot of the research. I think that's something that's really important to continue.
Yeah, absolutely, the audience. And I mean, I think I agree on the ULab point. I still don't feel like we quite have our heads around it. There's a lot of unanswered questions. But it does seem like there's a broader theme that actually this, environmental contamination writ large, in getting into the crops, getting into the water, and probably that's ULab. We don't necessarily know 100% for sure in all cases, but that whole environmental layer seems to be something that's quite important. That I'm certainly always updating my priors on about just how important. I think the other very interesting thought, I had a bit of attention is, on the one hand, we see, for example, the situation in Georgia, where you have this incredible success story, right? A 75% reduction in blood lead levels. And, you did many things, but a lot of that came from the spices, right? You found one key source, and that helped lower it. But then we look at somewhere like Bangladesh, right, where we also had lead in the spices and an incredibly successful intervention to take the lead out of the spices, and children are still very, very significantly lead poisoned. So it's, it can be quite complicated and, again, very location specific what's happening.
Yeah, I think just to pick on that, I think that's right. That's definitely something that we find hard. I think as a sort of, we don't have a set list of countries we're interested in. We're not, we're interested in maximizing the expected value of our donors' money in doing the most good in lead exposure reduction. I think that crosses borders, but that issue of context specific is difficult. An easy, what we'd like to see is like replicable solutions that we can sort of scale very quickly. That plays very well, as you can imagine. But yeah, I think to extend that, I think the supply chain sort of features and compliance and sort of economics, the variance there is kind of striking as well. I will butcher the statistics, but massive success and compliance on paint law in Malawi, sort of not least due to a lot of media buzz, seems to be one thing. And then in Ghana, you're looking at like a lot of fines and enforcement processes there. Like, there's big variance in how this will work across countries, although maybe not so much variance in how it will work across sources within those countries. So maybe there's some hope to sort of share learnings there.
Yeah, for sure. I mean, I think this question of why people act the way they do, it's it's obviously a contribution of economics to of the economics field, and something I find fascinating, care a lot about, and I think it has a lot of explanatory power for the world. But it's like the lead chromate issue, for example. I mean, we worked on this lead chromate paper tracking the supply chain. But it is also true that it is very easy to make lead chromate and highly profitable to do so in an informal setting. And so, we have to be realistic that while it's a good thing to do to shut down this trade and to, do a practice what we preach kind of approach in rich countries, we have to understand that that itself is not going to solve the entire problem, so long as part of the reason people act the way they do is that it's very easy to make and there's a market for it. And so I think thinking through all of these questions from this multidisciplinary point where you need to understand that the chemistry is simple and that allows it to happen, and the incentives are such that it actually is very possible to shift it in this way. And there's not really any enforcement incentive cutting against it is quite helpful. But maybe to zoom out a little bit from this specific conference, we're very grateful for LEAF's support of this gathering along with Founders Pledge. But I think you use research a lot in your line of work. Can you talk, as head of grant making for LEAF, how do you see the role of research in informing funding decisions? Do you have any specific examples where you can say, okay, here's how research really inflected a key funding or strategic decision we were making?
Yeah, sure. I mean, it plays into it almost all the time. I think, at Open Philanthropy, which houses the LEAF, I think, we're pretty analytical. All the grants that we do are anchored on what some of the grantees will hear with dread, a back-of-the-envelope calculation. No envelope is that big, but it's a massive oversimplification. But we try and estimate, get towards some kind of estimation of a return on investment for the dollars in terms of a reduction in blood lead levels. We've sort of created a shortcut for what that might mean for a gain in DALYs and income generation. But we have a cost effectiveness bar that's true across all of the programs at Open Philanthropy, so that we can compare within that. And that bar is pretty high. We're spending all of the inputs into that model come from the types of research that you're all doing. So we have put a huge amount of value on that. It's still pretty practical and imperfect. Some of the things that play really well on it, I think, are scale, leveraging of other efforts. Generally leans us towards a sort of population prevention type approach. So as someone else noted, shifting low-level exposure in many people plays very well in this model. As an example, though, of how the research plays in, it also has, obviously a big influence on the strategies that we have and where we look for grants. So I think when we look at source identification work, including the RMS from Pure Earth that we funded, and lots of others since have influenced. We came across the sort of lead in traditionally used cosmetics as an area we weren't otherwise looking for necessarily, but popped up. I think that, in terms of all of the research inputs that go into that, the model, as you can imagine, it's immediately sort of how much lead is in there, where is it, what population, how much of the population, leachability, bioavailability, all of those elements flow in there. And then there's a whole meta layer about how likely it is for, to find a replacement or to produce a replacement. What's the manufacturing like, the supply chain, are there levers and formal, informal? A lot of the words that we've heard a lot of during this play directly into it. So it's almost constant that we're digesting what you're producing, and we're very thankful for it.
Maybe the inverse of that question, right? Where is there something you're trying to tackle in your strategic process where you're kind of hung up on a decision, or you're not sure what direction to take because there's a lack of research? And this is all of us should be taking notes.
Well, I think there's, where ULabs is a great example over the last year, I would say, where I just started this job last year. There's James Snowden and Santosh Harish and others doing this role before me, continue to be involved. But we had a day one discussion about ULabs. This is looking like it's gaining more consensus around it being a potentially large part of the problem. The stumbling blocks at that point are, to a certain extent, still the stumbling blocks now. Is I think the resolution on the problem, on it potentially being a large part of the problem, is gaining, but I still don't see sort of reproducible examples of what exactly we should do about it at scale across many countries. And don't get me wrong, I think there are the starting points for all of that, but the way that it, the large proportion of informal sites, as we've heard, the many different exposure pathways means that's a blocker on us moving on what we think could be a really important source vertical.
Yeah. I mean, I think the ULab issue is interesting from a research perspective as well because there's just so many angles on it, right? There's the fundamental questions of just how big a burden is this? How big is the plume of pollution? How far does it spread, both directly and through, food, water, other secondary sources, maybe slag being moved somewhere. Somebody told me recently that the drained battery acid is used as a cleaning astringent in countries, and which yet another, you're always learning something new. So there's all of those questions. Then there's the questions around behavior and enforcement. What can you actually do about it, right? And you sort of need to marry all these different points of research together to get at something useful.
Yep.
I guess another kind of feedback question for us, for the community, for everyone. You've listened to the whole conference. I think you've been a very good audience member. I think you've been very engaged. And do you have feedback for us about how this has gone from your perspective, right? And what we can do better in the future, both for myself, for CGD as an organizer, thinking about how to make this event as useful as possible. And for those of you who don't know, this will be the first in at least 3 of these. So I'm asking this in a very practical sense. We will have at least 2 more of these next year and the year after that. So always looking for feedback on how to improve and grow. But then also more broadly for the community of researchers, right, who are producing research, communicating it, how it can be most useful.
Yeah. Well, boringly, I've got a lot of praise. I've really, really enjoyed it. It's been fantastic. The breadth the countries represented has been amazing, really tightly aligned with areas we think have some of the highest burdens and are super important to us. I think the pace is great. I love how packed the sessions are, even though I am literally exhausted. But, yeah, I think that's been great. I think in terms of for researchers and feedback there, I think the lead research world is already very good at this in terms of thinking about where their research should be applied. But I think as I was going through, I found myself thinking sort of like, okay, I should sort of put this in proof of concept, or I should put this in like, part of ready to scale, or buckets that I should put this in. So it's worth thinking that's the kind of thing we're thinking. I think maybe the other thing is putting the research into a theory of change that ends up with a reduction at scale, either in that country or more broadly in lead exposure is great with any proofs of sort of points of proof along that theory of change that you have, even if it's a sense that the government it's a good policy window for this kind of thing now or something. Those kind of things can be hard to find out otherwise, and researchers often have more insights on that than I think they think. So I think that can be really helpful. But you are really good at telling me what I'm doing wrong, so I'd love to know, which I value immensely. So I'd love to know what you think could be improved.
In like lead funding in general?
No, in terms of the conference.
Oh, in terms of the conference. No, I mean, I'm very pleased with how this has gone. I think it's mostly a testament to all the people who came here and delivered exceptional research, and were just very engaged for a day and a half. I mean, I've been to a lot of research conferences. I've been to a lot of closing sessions. There's usually not this many people still here. They're usually not still nodding and paying attention and as part of it. So I think you guys and the more community more broadly have done a terrific job of energizing this community. I also give a lot of credit to USAID for helping, I think, connect this community and start a lot of that mobilization, getting it sparked. And obviously there's many people who've been working in this space a very long time, laying the groundwork that then people later, like me, later discovered and worked on. So, but that said, I'm quite happy with this. I think although I do have the reflection, I do just think, it's classic end of the paper, more research needed, right? Like, there's a lot of useful findings here, and there's a lot of really nagsome, worrisome, open questions. The question on the labs, how bad a problem is that? I worry about that a lot. The question, I was very struck, I made a comment at the time, but in Jenna's presentation about, I do worry that when we do, if we're not stratifying, like, are we missing patterns in the data, right? Are we just, because exposures aren't, are we looking too much for one? And I say us, I'm sort of saying, and myself included, like when we're all doing this research, are we looking too much for the one thing in a way that's actually maybe like masking some of the variation and some of the actual sources. I think there's some methodological questions still to think through. You know, one nagging question for me, I raised it with you over dinner, is, you know, there's this whole missing piece on kind of the treatment side. I totally understand that it's not nearly as cost effective as prevention, you know, but again, in the spirit of coming to countries with, you know, do you have a solution if we're finding lead-poisoned kids? What can be done about it? Having some basic capacity at the hospitals to treat severely lead-poisoned kids and diagnose them seems important. And I do think that's been maybe a bit of an under-explored avenue of research, both sort of how to do that cost-effectively and effectively, and also, you know, that is a contributor to engaging government, civil society, and presenting a palatable package that governments can be excited to take up to their populations. So that's one thing on my mind.
On that last point, I think that's a good place to illustrate. I think sometimes I worry that by saying that we're very analytical and we try and pull everything back down to $1 cost per DALI, means people think they need to be doing research that's very close to a blood lead level or a DALI. But we're pretty happy with wild assumptions to a certain extent, you know, and stating our confidence in them. So I think, for example, on treatment, I agree, like we haven't yet seen a case where it reaches the incredibly heady heights of the cost effectiveness that is on the table in lead exposure reduction. But I think the way I would do that kind of an analysis for that would be something like, if it increases the likelihood of a government being engaged on lead by a few percent and creating a national lead plan, then the cost effectiveness can come from that, and exactly how good that treatment is at saving lives or reducing morbidity is by the by to a certain extent. So I would, encourage people to think laterally on those things when they approach us. It usually works.
Good to know. Yeah, I mean, I do think these questions, right, of, in part it's presentation, in part it's substance, right? I mean, we're talking about bringing research to different audiences, including governments, including funders. We're also, you know, a lot of us bringing requests, bringing asks of the government, right? Bringing you should pay attention and you should do something and here's what we think it is. And I think shaping that to be something they can say yes to, and what the components of that have to be for them to want to say yes is a very important part of this whole thing.
Yeah, I was, sorry to interrupt you, I was sort of internally clapping when, I forget who it was who said it, I think it was even maybe in the first panel when someone said we need governments to see this as an area for increased growth as opposed to a health cost. And I think that's really important. I would extend that to a certain extent to funders, and maybe not just on growth unless that's the focus for the funder, but I haven't seen as much as I would like of the framing of the lead problem as an education issue or as a growth issue or a jobs issue or as well as, you know, health and environment. I think that would be great. I would love to not be the only donor up here next year. So maybe that will help.
Absolutely. And I think one other good reminder, and I think many of the presenters did a terrific job of this, is yes, a lot of us, I think for good reason, are convinced to work on this because the numbers and the impact are enormous, right? But at the end of the day, they're, you know, children. They're not just numbers, right? And part of telling that story and making our research connect with people is to bring it back to the individual children, mothers, families, workers, right, who are being harmed, and this is preventable. And, you know, realizing those numbers are an aggregate of a lot of people, human beings who we care about. And I think that, you know, bringing that back when we're looking at our, you know, statistical significance tables and having that as part of our messaging is very powerful. And I think some people here did that very effectively in their storytelling.
Yeah, absolutely. Yeah, I think that plays on our mind all the time. I wrote myself some challenges before the conference to try and some sort of provocative challenges to try and get back on. One of them was that is not directly related, but it speaks to it a little bit. That I put nothing can replace country-owned, preferably nationally representative blood lead level and source ID surveys for creating political will. But can we accelerate it without this data? Does every government have to see the data first? And the motivation behind that, I think the answer is, I'm not sure. I think probably a lot of governments do need to see that data first. But motivation is like, for every year we're waiting for this stuff, you know, tens of millions of children are born into unsafe environments. And I think that's, front of mind for sure.
Yeah. Well, I heard you loud and clear, and I think you spoke for many of us when you say you're exhausted. So I think we can maybe wrap this a little bit early, but any final reflections before we...
Only just that I think we should give Rachel and CGD a big round of applause for an amazing conference.
Well, thank you very much. Although that said, I think there are a lot of acknowledges to go around. So let me say a few things of my own. So, I mean, first of all, and first and foremost, thank you to all the speakers, the poster presenters, and the moderators. I mean, you were absolutely the core of this. You brought tremendous content and research findings and ideas that, I will be weighing for a long time. Particular thanks to those of you who traveled internationally to be here. I know it's not so easy to get visas, and there's a lot of concerns these days. So it's very, meaningful that you went through the process and, took that on to come here. So thank you for that. We really appreciate it and see what you did to come here. I want to thank Rory, Theo, Caroline, Justin, and Lee, who helped us sort through all the submissions to this conference. There were a lot, which was, again, great to see, but it took some time to get through all of them. I want to thank the terrific CGD events team who helped put this on, Shannon in particular, who's in the headset and has done a terrific job. Big round of applause for Shannon. But also Saul and Mike, who've been behind the scenes helping with the videos, and our whole production crew who have been miking and unmiking me very diligently and effectively over the course of the last day and a half. Our comms team, Maya and others who helped promote this. Caroline, Christelle, and Mahima for all they did on organization. It is not an easy feat to get everyone here, get everyone in hotels, and we really appreciate everything they did. And of course, to Open Philanthropy and Founders Pledge for their support of this event. So thank you. All right. And we will see you all here next year. Well, maybe here, maybe somewhere else. We'll let you know. All right, thanks everyone.